Hello, good morning. Good morning po. Yan. Good morning. Malamig na. Hello, good morning po. Good morning. Ano mga schools nyo? Hello, ano mga schools nyo? Para lang familiar. Good morning. Kilala nyo ba ako? Kilala nyo ba ako? Parang hindi ata. Good morning. Kamusta? Arellano. Okay, mga ano. Arellano na Pasay. Di ba? Or Saint Bernadette. Okay. Kilala nyo ba ako? No po. Okay. Sige. Kamusta yung recalls 2 nyo? Ay, kilala niyo ako. Yung iba. Okay. Kamusta yung recalls 2? Madali, mahirap? Mahirap. Nakakaiyak. Bakit? Bakit? No comment. Ganun talaga. Dito ba si Princess ngayon? Huh? Okay. Kamusta? Mahirap. Mahirap ang ano. Bakit? Ganun talaga. Pahirap ng pahirap yan. Pahirap ng pahirap yan. Ang alam ko. Mas okay pa po recalls 1. Ilan pa yung recalls na iti-take nyo, di ba? Parang, hindi ko alam kung hanggang 6 ata or hanggang 8. Sabi nila hanggang 14 recalls daw. Hindi ko sure kung totoo. Meron ng recalls 6 sa akin. May recall 6 na ako na template. Oh, di ba? Okay. So recalls 2 tayo. Papakilala mo na ako. You can call me Sir Miggy po. Ano bang background sa akin? Siguro, naging top rank student din po ako. Hindi ako yung sa panlasang Pinoy. Grabe naman. Hindi rin po ako, karamihan niya magsasabi niya, kamukha ko yung sa panlasang Pinoy. Si Luis Manzano, sabi nila, kamukha ko daw yun. Pero hindi talaga, mukha bang mangga yung mukha ko? Mahaba-baba ko. Parang hindi naman. Yan yung mga common nila sa panlasang Pinoy, tsaka si Luis Manzano. Ang palagi ko dyan, di naman mahaba yung baba ko, di ba? Di ba? Ay, wow. Ayun. So, yun, ano bang konting background sa akin? Siguro konting background sa akin, ang pinaka-ano ko na lang, naging top rank student din ako. Kaya medyo, din ako sa, medyo familiar din ako sa ni top rank. Di ba? Ano pa ba? Si Dr. Kilingmore, parang layo ko naman. Okay? Ayun, ano ba mga schools nyo? Ano yung mga schools nyo para lang familiar ako? Tapos pure online class ba to? Pure online class ba to mga to? Sir Chief, parang layo naman. Ano yung mga face-to-face hybrid. Okay, hybrid yung iba. Okay. Alam ko halo-halong section. Baguio, ang layo ng Baguio. Yupang, kilala ko yung mga Yupang. Gordon College. Okay. Anak ni Small Loud eh. Saling ko kayo dyan eh. NP3 tayo second half. Okay, NP3 second half. Okay, NP3 second half muna tayo. Punta muna kayo sa NP3 second half. Para ano. Okay? Hanapin nyo lang muna. Hanapin nyo muna yung NP3 second half. Kamusta naman? Ilan days na lang before the board exam? Excited na kayo mag-boards? Excited na? Excited na mag-board exam? Kaya nyo yan. Kinakabahan? Normal kabahan sa board exam. Pag hindi ka kinakabahan sa board exam, hindi ka tao. Normal kabahan. Feeling nyo ba madali lang ang board exam? Feeling nyo? Feeling nyo? Feeling nyo madali lang ang board exam? Ako, yes, madali ang board exam. Pero, madali siya ang board exam. Hala, madali ang board exam, but, anong tawag dito? Mag-overthink kayo. Tendency nyo mag-overthink. Kasi sa sobrang dali ng board exam, mapapa-overthink kayo. Promise, mapapa-overthink. Nung board exam ko din, ang tawag dito, totoo ba? Ito lang yung tanong sa board exam. Tapos mapapaisip ka, ito ba talaga yung tamang sagot? Pero yun talaga yung tamang sagot. Mag-overthink ka na. Yun, ganun. Okay? Number 51 na. Go na tayo sa number 51. Number 51. Ilang pre-boards, tatlong pre-boards ang titake nyo. Diba? Tatlong pre-boards ang titake nyo. Pre-boards 1, 2, 3. Okay? Okay na po. Okay. On number 51, Nurse Ann presented the disaster plan in the community assembly for acceptance and approval. NP3 po. NP3 po yan, second half. Okay, lagay natin dito. NP3. Yan. Okay. So let's go. Which of the following is the most important criterion for the plan's acceptance and approval manifested by the people? Okay, pag ganyan, most important, most probably, madami dyan tamang sagot. Pag yung mga, ang 50 po, sa first half po yun. Akin po yung 51. Okay, akin po yung 51. Yung first half po, yung hanggang 50 yun. Akin yung 51. Okay, 51 onwards po hanggang NP5 akin. Okay. Kapag ganyan, most important criterion, how about reconstruction sa NP1? May other schedule kayo dyan kay Ma'am Shannon. Okay, may other schedule kayo doon for Ma'am Shannon. Sa akin, unahin muna natin tong second half. Okay, unahin muna natin tong second half. Okay? Sige. Pag dito kasi, pag most important criterion, most probably may mga answers dyan na pwedeng tamang sagot. Okay? Pero ang hahanapin mo dyan yung pinaka-best na sagot. Okay? For example, letter A, presence of the majority of the committee. Pwede siya. Pwede siya. 'Di ba? Tasking the community people, pwede. 'Di ba? Letter C, volunteerism and willingness of the people, pwede. Pwede to tatlong sagot na to. And then the presence of the municipal health officer in the assembly, syempre ito X agad si letter dog. Pero mamimili ka sa ABC. So ano ba yung hahanapin mo dyan? So most probably, participation ng mga tao ang hahanapin mo na dyan. Okay? Participation ng mga tao. So ang best answer dyan is letter C. Okay? Letter C po. Volunteerism and willingness of the people. Okay? Volunteerism and willingness of the people. Isabihin niya, gusto ng tao yung gagawin nila. Okay? Willing silang gawin yung mga pinapagawa mo sa kanila. Okay? As compared kung presence ng majority of the community, presence lang nila yun, pero hindi naman sila nag-volunteer, hindi sila gumagawa ng action. Okay? Next, situation. The family is the unit of service in the community health. Hello. The public health nurse, Ju, takes care of the Ross family. Aldous works as nursing orderly in the hospital, Batong Malaki. His wife, Ina, tends to small variety store in front of their house. Their children are Bubbles, no, yan na. In-unmute ko na po. Ayan, na-unmute ko na. Okay. Based on the characteristics of the Ross family, Nurse Ann can easily categorize to each of the following developmental stage. Ano ba yung majority ng age group? Ang majority dyan, 3, 4, 5. Okay, 3, 4, 5. Okay, school age children, di ba 6 years old? Okay, beginning family, hindi naman. Early childbearing, dapat may infant sila. The best answer is letter dog. Families with preschool children. Di ba? Ano ba yung school age? 6 to 12. Di ba? Age beginning 6 to 12 yan ang school age mo. Next, 53. In this particular stage, which of the following is the most basic concern? Ano kayang tamang sagot dyan? Letter Apple, syempre wala namang minention yan. Okay, walang minention about marital and in-laws relation. Letter Boy, the couple shift to adult social interest. Matagal na yun. Okay, matagal na siya nangyari. Balancing the time and energy to meet the demands of work and family. Your letter dog kasi wala din naman siya sa context ng situation. Okay, anong best answer dyan? Letter Boy. Child rearing. Okay, child rearing po. Okay? O Zach and Mika have 8 children already who are all boys at age of 35 years old. They would like to be counseled on the family planning methods at San Pedro Health Center. The following questions apply to Nurse Thea. Nurse Thea explaining the 2 forms of hormonal contraceptions, which are the pill or the oral contraceptives, the oral combination contraceptive to the couple. The composition and the corresponding actions are, select the correct answers. Ano yung tamang sagot dyan? Tamang sagot, letter Apple. Pabalik po sa 52. Sige po. 53. 54. The correct answer is letter A. Okay, your progesterone complements the action of your estrogen, causing the decrease in the permeability of cervical mucus, thereby limiting sperm motility and access to the ova. And estrogen acts to suppress the follicle-stimulating hormone and luteinizing hormone, thus suppressing the ovulation. Letter apple. Okay po, apple. Number 55. 55, the following are side effects of COCs except, anong hinahanap natin tamang sagot dyan? Ang hinahanap natin, yung mga mali, yung mga hindi side effects o yung mga side effects. Kapag ganyan, ano hinahanap natin? Yung mga not side effects, negative, except. Okay, except yan. Weight gain, expected ba weight gain sa COCs? Expected ba? Yes. Okay, yes. X agad si letter, cat and boy. Headache, expected ba headache? Expected bang headache? Yes. Depression, pwede kaya magkaroon ng depression? Yes. Okay, and breast tenderness. Ang tamang sagot is letter dog. Letter dog. Kaya always nyo tatandaan kapag nagsasagot kayo ng board exam questions, bilugan nyo agad yung except. Okay, bilugan nyo agad. Okay, pag may nakita kayong not, bilugan nyo siya agad. Okay, basahin nyo mabuti exam kasi doon talaga kayo nadadali. Okay? Next. Nurse Mabel advised the best way to lessen the side effects of COC is by, so pag ganyan, combined oral contraceptives. Combined oral contraceptives. Okay? Kapag ganyan, you would always choose for the independent nursing intervention. Okay? Always choose your independent nursing intervention. Okay? Letter apple, consulting the physician for the side effects. Is that independent or dependent? That is a dependent nursing intervention. Okay? Dependent po yan. Letter boy, using different brands of contraceptives. Diba? Sino ba ano yan kadalasan? Sino kadalasan ang nagre-recommend yan? Si doktor. Okay, si doktor. Letter dog, na ano mo ba, na-address mo ba yung problem or yung concern ng patient, not minding it because it will just subside. Hindi mo siya na-address. Okay, so the best answer is letter cat. Okay, changing the routine activities. Letter cat. Mika expressed fear in choosing your OCs and COCs. She asked about the advantages of using chemical barriers as methods of your contraception. Which of the following are the advantages of this type of contraception? Ano ba yung mga example ng chemical barriers? Ano yung mga example ng chemical barriers kaya? Ano kaya mga example ng mga chemical barriers? A good example niyan, yan yung mga gels, okay, cream, sponges. Yan yung mga yung mga example ng chemical barrier. Films, foams, suppositories. Okay? Yan yung mga example ng chemical barriers. Ibig sabihin yan, ang tendency niyan, pinapatay yung sperm. Alam niyo yung mga spermicidal na lubricant? Yan siya. Okay? Yung mga spermicidal lubricant, yan example ng chemical barriers. Okay? Number 1, when used with another contraceptive, they increase the other method's effectiveness. Tama po ba yun, mali? Tama po ba yun or mali? It is correct. Tama yan. Okay? Number 2, various preparations are available in the market. Yes, ito yung mga various preparation na available sa market. Okay? They can be purchased without prescription. Yes, they can be purchased without prescription. It interferes with sexual enjoyment. Yes or no? Pwede ba niya ma-interfere yung sexual enjoyment? Pwede ba niya ma-interfere? No. 'Di ba? Kasi hindi ka mag-worry. Okay? Hindi ka mag-worry na mabuntis yung partner mo. So the correct answer is letter C. Okay? 1, 2, 3. Okay, 1, 2, 3. Okay, letter C po. Alam, mali yung nasa form. Baka nagkaroon lang ng error po. Okay, baka lang human error lang din siya. Okay? Pero at least natama natin. 1, 2, 3 talaga yung tamang sagot. Okay? Next, Nurse Shira Easter, Ariel and Ann are close friends because they are almost of the same age. orphans and out-of-school youths. Nurse Angela from the Department of Social Welfare and Development is tasked to attend to them. What would be the primary goal? Okay, primary goal of Nurse Angela for these 3 children? To letter apple. Letter apple, sino kaya may responsibility to locate the family of the children? Sino kaya ang may responsibility niyan? Si social worker po ba ang may responsibility niyan? Social worker ba may responsibility to locate the family of the children? Yes. Okay, yes po. Okay. How about letter cat? Pwede ba yan maging goal? Analyze the information gathered or nasa assessment yan? Assessment phase yan. Okay, assessment phase yan. Letter dog din, assessment din po yan. Hindi rin po siya goal. It listed the important data about the family. Okay, so the correct answer is letter boy. Change the behavior of the children. Okay. Next, number 59. What could be the number 1 health threat for these children? Ano kaya number 1 health threat nila? Best answer for that one, di ba school age nila? School age, malikot ba yung mga yan? Malikot ba sila? Yes. So the best answer for that one is letter dog, injury. Okay, injury siya. Okay? Because school age children have developed more refined muscular condition and control, can apply their cognitive capacities to their behavior. The number 1 injuries in the middle childhood is diminished compared to the number in early childhood. Okay? So injury po ang common. Kristen, 20 years old G1P0 has just delivered to a baby boy 1 hour ago. Nurse is the nurse assigned to the newborn, but she is worried about because it is the first time to handle a newborn and new mother. The following questions apply. Which of the following senses are expected to be developed at birth? Select those that apply. Ano kaya ang tamang sagot dyan? Develop na ba ang hearing? Develop na ba ang hearing? Yes. Vision? Yes. Taste? Yes. Okay. Smell? Yes. The correct answer is letter dog. Okay, letter dog. According kay Piliteri, ang sabi ni Piliteri, the senses in newborns are already developed at birth. Okay? Develop at birth. Okay? Now, next. Baby boy Kristen is struggling to suck from his mother's breast due to the inverted nipples. The doctor ordered intravenous fluids, which among this complication will nurse region anticipate occur almost immediately. Baby boy bata, malikot po ba kapag baby boy, yes or no? Malikot po ba pag neonate? Malikot po ba pag neonate? Yes. Prone ba mag-dislodge yan? Prone mag-dislodge? Yes. Di ba? Prone mag-dislodge. Kapag nag-dislodge yan, and most probably, magkakaroon siya ng infiltration. Anong common manifestation ng infiltration? Warm to touch, cool to touch. Cool to touch. Namumula? Namumula ba to? Yes or no? No, maputla. Maputla siya. Okay, maputla. As compared to your phlebitis, ang phlebitis mo namumula? Yes. Pwede ba tong sign of infection, yung phlebitis? Pwede ba may infection ng phlebitis? Yes. Masakit? Masakit? Yes. Anong first thing to do mo pag nakita mo may infiltration? First thing to do? Stop. Okay? Stop mo yung IV fluids. Okay? Stop mo agad yung IV fluids mo. Later, baby boy of Kristen is ABO blood incompatibility. Dr. Young ordered to transfuse red blood cells. As a competent nurse, what should be the best equipment to use in as much as 50 ml of blood is ordered? Syringe pump. Pwede ka ba gumamit ng syringe pump? Yes or no? Pwede mo ba ilagay sa syringe pump ang blood? No. Di ba may BT set yan? May blood transfusion bag talaga ang indicated for your blood. Soluset. 61 plus letter dog. Letter dog. Soluset. Pwede mo ba ilagay sa soluset ang blood? No din. Bakit? Kapag nilagay mo sa soluset yung blood, ano mangyayari sa blood? Pwede ano kaya? Ano mangyayari sa blood mo kapag nilagay mo sa Soluset? Pwede mag-clot. Okay, pwede mag-clot yan. Okay? Regular pediatric IV set. Pwede ba? Pwede po ba? Pwede po ba? No din. Siyempre hindi rin. Okay, meron nga tayong blood transfusion set. So the best answer is letter dog. Infusion pump. Okay, infusion pump po. Okay, kasi mas maganda siyang i-administer lalo na kapag neonate sa infusion pump para hindi siya mag-cause ng anong possible na mangyari. Para na fast drip mo yung blood, anong pwede mangyari kay patient? Na fast drip mo yung blood, ano kaya pwede mangyari kay patient? Circulation overload, pwede mag-congest yung patient mo. Okay, pwede mag-congest yan. Okay, so letter dog, infusion pump. Yeah, para sakto lang siya. Kumari, 50 ml, usually gaano kabilis mo ini-infuse ang blood? Ilang hours mo siya i-infuse yung blood? 4 hours. Okay, 4 hours. Usually 4 hours yan. Okay? Yes. Sa adults din, pwede mo siya ilagay sa infusion pump. Yes. When it comes to the board exam, always stick to the ideal one. Okay, always stick to the ideal one. Ano po ba yung ideal, sir? Ang ideal ngayon, as of now, infusion pump. Okay? Mas prefer natin ang infusion pump rather than yung free flow lang. Okay? Kapag nasa board exam tayo, palagi tayo nasa ideal state. Okay? Which of the following observations of a mother who had healthy baby 48 hours ago would alert nursery genes concerned about the mother's attachment with the newborn? Okay? Letter Apple. She expresses difficulty in finding a name for the newborn. Concerned ba yan kapag ganyan? Concerned ba siya? Immediate concern mo ba siya? Most probably hindi. Diba? She requests the father change the newborn's diaper. Hindi din naman. Kasi nag-aano pa rin sila. Kumbaga nagkakaroon sila ng tawag dito, dynamics. Okay? Asking repeated questions about infant care. Expected po ba magtanong ang G1 sa'yo? Expected po ba magtanong ang G1? Yes, expected dyan magtatanong sila. Anong best answer dyan? Letter cat. She stares out of the window while feeding the newborn. Ano kaya most probably manifestation kapag nakatitig lang siya? Ano kaya possible? Pwedeng postpartum depression, postpartum blues, pwede yan, di ba? Or pwede naman lutang lang si mother, di ba? Mali mo puyat lang. Pero yun pa rin ang best answer, letter cat. Okay? Letter cat. Next. A nurse kisses the quality assurance officer of the hospital. She just got her promotion. That is why she is not aware of the nature of her new position. The following questions apply. Pediatric patients are prone to falls from the hospital beds, which may result to additional costs on the part of the hospital. Which safety measures should not, okay? Pag ganyan ulit, bilugan nyo na yan. Okay, bilugan nyo na yung nut. For sure ako may nadali dito. Not be instituted to prevent such incidents. Okay? So ano yung hinahanap natin sagot? Tama or mali? Negative ulit. Okay, maling sagot ulit. Number 1, restraining them. Tama or mali yan? Pwede ba natin mag-restrain agad-agad kung kailan natin gusto? No. Di ba? Hindi tayo pwede basta mag-restrain. So, X agad si letter A and boy. Okay? A and boy, X agad. Having their mothers or any significant adult with them. Dapat po ba pag may pediatric patients ka, meron siyang bantay agad? Yes. Meron dapat. Advising watchers to put up the bed rest at all times. Yes. Telling them that will be given injection if they will get out of bed alone. No. Di ba? Nagtitreat ka ba dyan? Nagtitreat ka ba dyan? Yes. Okay. So, ang correct answer dyan is letter. Charot. Letter dog. 1 and 4. Okay. 1 and 4. Next. As young manager, Esther knows that conflicts occurs in any organization. Which of the following statements regarding conflict is not true? Okay, not true. Sabihin mali. It may result to poor performance of the staff. Pwede ba yun? Kapag may conflict, pwede magkaroon ng poor performance ng staff? Pwede kaya yun? Yes, pwede siya. 'Di ba? Lalo na kapag frequent occurring siya. Okay, kapag recurring ng recurrent yung conflict. It can be destructive, hence it should not reach the highest level. Pwede ba siya maging destructive kapag paulit-ulit na? Yes. Okay? It may create a new leader from among the staff. Yes. Okay? So the correct answer is letter C. It is not beneficial and it should be prevented at all times. It is beneficial, but to a certain extent lang siya. Okay? Certain extent lang siya. Pero yung paulit-ulit siya nangyayari, may mali na doon. Okay? May mali na doon. So the correct answer is letter cat. 66. Which of the following is the best action that she must take? Seek help from the director of nursing. Director of nursing ka ba kagad diretso? Pag ganyan. No, syempre grabe naman. 'Di ba? Grabe naman. Quit her job and look for another employment. Pag ganyan, kuwari may nang away, bagong nurse ka lang. Gagawin mo ba yung letter boy tapos inaway ka nung senior nurse mo, pinagalitan ka? Gagawin mo ba yan? Quit agad. Maniwala ko sa inyo. Siyempre, plastika na sagot kapag board exam. 'Di ba? Pero kapag kuwari bagong work na kayo, kuwari RN na kayo, tapos nasa work na kayo, tapos pinagalitan ka, sinigawan ka ng nurse mo, quit ka kagad, stat resignation agad ang person. Okay, 'di ba? Pero joke lang, wag niyong gagawin 'yun. Kapag kayo, pag sinigawan kayo ng senior nurse, sigawan niyo din. Para para quits kayong dalawa, 'di ba? Okay? Disregard what she feels and continue to work independently. 'Di ba? Kapag dinisregard mo, ano mangyari kapag dinisregard mo? 'Di ba? Ano mangyari diyan? Mag-aano lang siya, parang mag-add up lang na mag-add up. Okay? Lalaki lang siya ng lalaki. So the correct answer is letter dog. Identify the source of conflict and understand the source of friction. Letter dog. Okay? Expected dyan, madaming ganyan mga questions sa board exam. Yung mga Palmer o yung mga plastikang sagot. Madami yan. Last board exam season din, panay din siya. Panay, tawag ito, panay Palmer. Okay? Which of the following nursing strategies would be most likely encourage an ill child to eat? Okay? O kapag ill child, di ba? Most probably yan, gusto mo ba ng may autonomy si bata? Gusto ba niya may familiarity sa environment niya? Yes or no? Pag bata. Yes. Okay? Yes yan agad. Feed the child to be sure she eats all the food on the tray. Pinilit mo naman yung bata. Day. Okay? Take the child to the playroom for all meals. Diba? Pag nilagay mo siya sa playroom, ano mangyari? Makakalimutan ba niya kumain? Yes. Diba? O withhold dessert until intake is adequate. Grabe ka naman. Ang harsh mo namang person. Okay? Best answer dyan is letter cat. Offer the child food and fluids she likes para madami yung kainin ng bata. Okay? Next, Nurse Kai is at the labor room and delivery room caring for several pregnant women experiencing labor in various stages. Mrs. Henson is a primiparous woman. The nurse expect that the average labor of her labor would be, anong tamang sagot dyan? Take note, primiparous. Pag primiparous, anong sabihin nun? Pag primiparous, una. Okay, una yan. First, mahaba ba yan or hindi? Expected mo ba? Mahaba yung niya? Yes, mahaba-haba yan. So the correct answer is letter C. Paano pag multipara? Gaano katagal? Multiparous woman. Letter letter boy. Okay, letter boy po. 8 to 14 ang multiparous. Okay? 8 to 14 yung multiparous. Kapag primiparous, 14 to 20. Kapag 8 to 14, multipara yan. Ano yung 1 to 8? Anong klaseng labor yan kapag less than 8 hours lang? Or minsan 1 to 3 hours lang nanganak na. Anong tawag doon? Precipitous labor. Okay, precipitous labor. Okay, anong pwedeng complication kapag precipitous labor yan? Anong possible complication? Anong possible complication kapag precipitous labor? Pwede siya magkaroon ng uterine atony. Diba? Pwede mag-uterine atony. Okay? That could lead to your hemorrhage. Okay? That could lead to your hemorrhage. Okay? 69. Since Mrs. Henson is a primiparous woman, she has been on labor for the past 16 hours and she is still 6 cm dilated. This can be noted as, ano kaya tamang sagot dyan? Primipara. Anong normal ng primipara? Normal ulit ng primipara labor. Primipara labor, gano'ng kahaba? 14 to 20. So 16 hours, normal siya. Okay, normal labor. Letter apple. Letter apple. Okay. 70. Which among the following stages of labor is deemed to be the most critical stage? Ano yung pinaka-critical stage dyan? Letter. Ba't kaya yung fourth stage? Bakit kaya fourth stage? Ba't kaya fourth stage? Ano ba yung fourth stage ng labor? Yan na yung pagkatapos mga anak, di ba? Postpartum. Di ba prone ba sa complications yan mga yan? Pag ganyan. Yes. Pwede siya magkakaroon ng major physiologic adjustments. Okay? Sige po. Okay. Sige po, lalagay ko sa screen. Okay, lalagay ko na sa screen. Okay, lalagay ko na sa screen. Okay? Kasi ang fourth stage mo, dito nangyari yung major physiologic adjustment. So ang tendency niyan, prone sa mga complications. Okay, prone sa complications 'yan. Okay? Yan. Okay. Mabilis ba? Mabilis ba ako magturo? Hindi naman. Mabilis. Sabihan niyo ako pag nabibilisan kayo sa akin. Para lang din magalang ko ng slide. Diba? Para makapag-adjust din ako. Sabihin sa akin kung paano kayo natututo. Gusto niyo ba yung nilalagay sa screen? Gusto niyo ba mini-mention ko lang? Ganun. Okay? Both. Okay, both. Okay po. At 32 weeks gestation, patient Yuri. A 16-year-old primigravida, 5 feet tall. Okay, mas perfect yung sinusulat. Okay. 20 pounds with 1 pound gain. Precipitous labor at is less than 8 hours yan. Okay, less than 8 hours. Usually yan, lumalabas sa board exam o lumalabas sa mga exam, nag-labor lang siya 1 to 3 hours. Okay, nag-labor lang siya 1 to 3 hours. Okay? In the last 2 weeks, urinalysis reveals negative for glucose and trace of protein. She came to the clinic for consultation. Okay? Wait lang. Next. Which will best describe serious risk for pre-eclampsia? Okay, risk siya, risk factor. Kapag ganyan, ano ba yung mga different risk factors? Ano yung mga possible risk factors? Number 1 dyan, multiple pregnancies. Okay, multiple pregnancies. Okay? Next, age less than 20, di ba? And age more than 40. Okay? Low socioeconomic background. Economic background. Okay? 5 or more pregnancies, nandito na siya. Hydramnios. And underlying chronic diseases. Ano ba yung mga underlying chronic diseases? Ano yung mga example nito? Mga example nito, diabetes, ano pa? Heart failure, ano pa? Hypertension, very good. Ano pa? Renal involvement. Okay? So anong risk factor ni Yuri dyan? Letter dog. Adolescent age group. Take note, risk factor ang hinahanap natin, hindi manifestation. Okay? Risk factor ang hinahanap natin, not manifestation. Okay. Next, after instructing Yuri how to keep a record of daily fetal movement counting at home, the nurse determines that the teaching has been effective when Yuri says that she will count the number of times the baby moved during which of the span. Anong tamang sagot dyan? Letter dog. Anong normal? Anong normal? Normal? Ang normal natin 10. O, paano pag paano pag less than 10? Anong gagawin mo? Anong gagawin natin? Pag less than 10. Extend. Okay, extend for another hour. Okay? Okay? Paano kung wari after an hour ulit, less than 10 pa din? Anong gagawin mo? Okay? Gagawin mo, report. Galing. O, kala ko ba nahirapan kayo sa sa recalls 2? Anong NP ba kayo nahirapan? Ay, NP4, NP5. Medyo nga NP4, NP5. Medyo siya, direct question siya. 'Di ba? Medyo siya, tawag dito, medyo weird yung mga tanong, 'di ba? Medyo weird. 'Di ba? Pero sa board exam, ang pinaka nahihirapan talaga ko NP3 talaga. Grabe NP3 ng board exam natin. When teaching Yuri about nutritional needs, the nurse should emphasize, ano kayang tamang sagot dyan? Anong meron kay Yuri? Pre-eclampsia, may proteinuria siya. Ibig sabihin nito, nag-excrete ba siya ng protein sa ihi? Yes. So, anong diet mo? Ano kayang diet natin? The correct answer, madami mag-disagree dito, pero ang correct answer talaga is letter C, regular diet. Okay, regular diet talaga siya. Okay? Bakit, sir? Ito siya. Kay Pili Terry tsaka sa isa pang OB book, ito yung sinasabi nila. Okay? Kapag nagpi-pre-eclampsia siya, the diet should have ample protein and calories. A regular diet without salt or fluid restriction is prescribed. Okay? Promote good nutrition. A woman needs to continue her usual pregnancy nutrition. So regular diet yan. Kapag nag-eclampsia ka, doon ka mag-high protein diet. Okay? Doon ka mag-high protein diet. Pero kapag pre-eclampsia yan, regular diet ka lang po. Okay? Malinaw na? Yes. Okay? Kay Piliteri yan mismo nakuha. Okay? Kay Piliteri siya mismo nakuha. Next. The nurse mentioned some of the condition. Ay, 73. Sorry na. Yung DLSL, lipat to, no? High protein siya kasi severe wasting na siya ng protein, 'di ba? Mas mataas na yung proteinuria na meron siya. Di ba kadalasan kapag pre-eclampsia sa trace lang ng protein yung nakukuha or positive 1 lang siya. Pero kapag eclampsia siya, positive 4 na siya, ang dami na ng protein na nare-release diyan. Okay? Dito tayo. The nurse mentioned some of ito. Ito po. Ito. Okay? The nurse mentioned some of the conditions associated with preeclampsia. Yung siyang feedbacks by Yuri to the nurse would warrant further explanation. Okay? Further explanation. Preeclampsia. Number 1, iron deficiency. Pwede ba siya maging risk factor or condition associated? Okay? Ano kaya? Pwede kaya? Iron deficiency. Yes. Pwede siya. Bakit, sir? Kapag iron deficiency ba, kulang, anemic ba yung patient mo? Possible anemic ba siya? Yes. Anong possible compensation ni heart? Tachycardia, yes or no? Tachycardic? Yes. Perfusion mo, kamusta? Di ba? Pwede ka magkaroon ng hypertension. Di ba? Which can lead to your preeclampsia. Multiple pregnancy? Yes. Pwede siya. Okay, di ba? Diabetes mellitus? Pwede siya? Yes. So ang best answer dyan is letter boy. Physical disability. Letter boy. Next. Oh. Yuri was brought to the labor room. The primary purpose of its administration is to, ano kayang primary purpose ni ano mo? Magnesium sulfate. Ano kaya? Para sana magnesium sulfate. Hello. Letter, ano kaya ang possible na tamang sagot? The primary purpose, okay, the primary purpose of your magnesium sulfate is a central nervous system depressant that acts to block your neuromuscular transmission to halt convulsions. Okay, to halt convulsions. Okay, to halt convulsions. Okay. So ano mo sabihin sagot mo dyan? Ang best answer dyan is letter C. Okay? Kasi di ba, kaya ka nagbibigay ng magnesium sulfate is to decrease the neuromuscular activity para ma-prevent ang seizure ni patient. Okay? Para ma-prevent ang seizure ni patient. Okay? So, ang ano dyan, anong babantayan mo kapag nakamagsul yung patient mo? Okay? Anong babantayan mo kapag nakamagsul yung patient mo? Ano kaya? Ano yung mga babantayan mo? Respiratory depression? Yes. What else? Magnesium sulfate toxicity. Ano yan? Meron tayong mnemonics na burp. Okay, babantayan mo yung burp. Okay? So letter boy is your blood pressure. Okay? Pwede ba 'to magkaroon ng hypotension, hypertension kapag nagbibigay ka ng magnesium sulfate? Hypertension, hypotension. Hypotension, very good. Okay, pwede siya mag-hypotension. How about yung letter U? Ano yung sabihin ng letter U? Ano kayang letter? Urine output. Very good. Diba? Ang galing. Anong normal urine output per hour? Anong normal urine output dapat every hour? Minimum na urine output mo every hour. At least 30 ml per hour ka. At least 30 ml per hour. How about yung letter R? Respiratory rate. Okay, your RR. Okay, respiratory. Charot, hindi wrong spelling. Okay, respiratory depression bang pwede mangyari dyan? Yes or no? Yes. Ano normal ba ng respiratory rate mo? Normal 12 to 20 kapag below 12. Okay, pag below 12. Paano kung wari? Nasa delivery room ka, nag-monitor ka, nakamagsul. Ang RR ng patient mo 12. Normal, abnormal? RR ng patient mo, na-notice mo 12. Normal, abnormal ang RR ng patient mo? Normal. Normal pa din yan, B. Di ba? Ang normal range mo 12 to 20. Normal pa din siya. Okay? Di ba? Letter P is your patellar reflex. Palatandaan lang siya, pero all your reflexes, nagkakaroon sila ng hyporeflex siya. Ano ba yung spelling ko? Hindi ko sure kung tama spelling ko. Okay? So, anong antidote dapat na nasa bedside mo? Anong dapat antidote na nasa bedside mo? Your calcium gluconate. Okay, calcium gluconate. Okay, calcium gluconate po yan. Paano binibigay calcium gluconate? IV push? Pwede mo ba i-IV push yan? Pwede ka ba mag-IV push ng calcium gluc? Pwede ka ba mag-IV push? IV push, IV drip. Isang ganun yung tanong sa board exam, promise. IV push, IV drip. IV drip. Siyempre IV drip. IV drip ka. Okay, IV drip. Hindi ka mag-IV push. Kasi kapag nag-IV push ka dyan, ang tendency niya, baka pag nag-IV push ka, hypercalcemia, or pwede ba mag-arrest yung patient mo dyan kapag pinush mo yung calcium gluc ng mabilis? Pwede po ba mag-arrest? Yes. Pwede mag-arrest yan. Okay? taas ng chances mag-arrest yung patient mo. Okay? Linaw na po. Yes. Okay, another question dyan. Ano pa yung mga gamot na hindi ina-IV? Kapag KCL drip, IV push, IV drip. KCL, IV drip. Pag nag-IV push, ano mangyari? Arrest yan, B. Tegi bells ang patient mo. Okay? Lagot ka. Tanggal ang lisensya. Diba? Kaya dapat maging cautious kayo sa mga ganun. Yun na yung tatandaan yung kadalasan. Basta anything na electrolyte, huwag kayo magpupush ng electrolyte. Okay? The pediatric nurse is preparing necessary research for her case presentation. At nakakatakot siya in a way. Yes naman, nakakatakot naman talaga. Diba? Nakakatakot naman talaga. Pero, ano naman, nagiging cautious kayo as, at from time to time. Kapag hindi sure talaga, di ba? Pag naging RN na kayo, for example, pag hindi kayo sure, magtanong. Okay, that's the best thing to do, magtanong, 'di ba? Alam ko sure ako dito karamihan dito online ng product ng online anong tawag doon? Online class, 'di ba? Kaya ang taas ng anxiety niyo pag nag-nurse na kayo. May mga gusto ba dito mag-hospital nurse? Meron ba dito? May mga gusto ba dito mag-hospital nurse? Or community health nurse kayo lahat? Ang gusto maging community health nurse. Okay? Hospital nurse din po ako. Ay, research nurse. Ako, nagbe-bedside din po ako. 2019 ako nag-boards. Lecture sa TR. Pwede naman maging lecture sa TRA. Pwede. Okay? Her case is an 8-month-old. 2019 po ako nag-board exam. Okay? Ang gawin nyo na lang, maging parish nurse. Maganda yun. Mag-parish nurse na lang kayo. Para pray lang. Diba? Diba? Her school nurse maganda din. Di ba ang school nurse, minomonitor mo ang ano. Anong minomonitor kapag school nurse? Her case in 8-month-old patient with phenylketonuria. Diba? Pag school nurse ka, monitor mo din yung ang tawag dito, yung halaman sa school. Malabas sa board exam. Diba? Okay, it is an inherited disorder. Military nurse, grabe naman. Wala lang, gulat lang. Ano yung mga specialty na gusto nyo? This can cause mental retardation, behavioral and movement problems. Diba? Psych, grabe, psych nurse. Seryoso ka? Psych, kadamihan dito for sure, ICU nurse, ER nurse. Yan. Nagulat ako may gusto mag-psych nurse. Aesthetic nurse, ay. Sino dito Ay, OR nurse. Okay? O mataas ang travel nurse. O kaya research nurse. Ay. Promise. Aesthetic, 'di ba? Basta ako nga gusto ko na lang maging pasyente eh. 'Di ba? Lang yung wellness nurse, yung wellness lang na pasyente, yung executive check-up lang, 'di ba? Using a blood test, 'di ba? Yes, same, 'di ba? Pag pasyente 'yon kapag hihilata. Using a blood test, PKU can be easily found in newborns. Ang treatment is diet low phenylalanine. The following questions apply. Lapit na. True. Ako nga lapit na din ako maging pasyente eh. Sobrang pagod. Okay? Pero pinakamaganda, totoo, maging wife ng doktor, kaya maging asawa ng doktor. 'Di ba? Wala ka nang poproblemahin. Ikaw na lang umano diyan. 'Di ba? What type of inheritance does sa PKU belong? Ang tamang sagot diyan, ano ba ang PKU mo? Ang PKU mo ay isang autosomal recessive. Okay, autosomal recessive 'yan. Anong usual manifestation? Mataas or mababa ang phenylalanin nila sa blood? Mataas or mababa? Mataas, mababa ang phenylalanin sa blood kapag may phenylketonuria tayo. Increase or decrease? Increase. Increase yan. Okay, increase siya. Okay? The nurse was asked, what milk should be given to the child? What would be her best answer? Tamang sagot dyan. Soy milk, pwede ka ba magbibigay ng soy milk? No, protein yun. Okay. Letter C, you need to buy phenylalanine-rich milk. Eh, di ba mataas ang phenylalanine sa blood niya? Di ba? Any would do. So kapag mali kagad si letter dog. Letter boy, lofenalac. Ang lofenalac po kasi is an infant powder that usually binibigay yan sa mga patient na may PKU. Okay, PKU. Ito siya. Ang tanong dyan, pwede ka ba mag-breast milk kapag may PKU ka? Pwede ka ba mag-breast milk kapag may PKU ka? Yes or no? The correct answer is yes. Pwede siya. Kasi mababa lang yung phenylalanine sa breast milk mo. Pero dapat meron ka monitoring ng phenylalanine levels as much as possible. Ayan siya. Ayan. Okay? Next. As part of her long-term nursing care, she was preparing some of her health teaching plans for the patient. Which among the following should be included in her teaching plan? Ano ba yung pag ganyan? Okay, ang pinakamagandang gawin nyo dyan kapag ganyan, ano ba yung mga common na common side effects or common manifestations or common complications sa mga patient na may PKU? Siyempre, meron dyan intellectual disability. Okay, meron ba dyan interventions for intellectual disability? Wala. Microcephaly, pwede din. Meron ba siya dyan microcephaly? Wala. Okay, congenital heart disease. Meron ba dyan sa choice na may congenital heart disease? Wala din. Okay? Seizures. May mga ba dyan for seizure? Wala. Okay, what else? Pwede din siya magkaroon ng eczema. Eczema. Okay, eczema, hindi rin siya. Atopic dermatitis. Meron ba atopic dermatitis na sa choices? Yes. Okay, ano pa iba? Alopecia. Alopecia, behavioral disorders. And mousy odor. Yan. So, anong tamang sagot dyan? Ang tamang sagot dyan, letter dog. Patients should need to have monthly consult with the pediatrician for signs and symptoms of atopic dermatitis. Letter dog. Okay? Letter C, mali yan kasi lungs yan. Lungs ang inaano niya. Hindi naman nakalagay na lungs sa congenital heart disease. Okay? Patient should do outdoor activities. Wala din naman siya sa common complications mo. Okay? Patient shouldn't rehabilitation of muscles. Take note yung letter A and B mo, almost same answer yan. Diba? Kapag almost same answer yung nasa choices mo, matic X yan. Okay? Matic X yan. O, number, si 29. Which among the following is known to be the endpoint of a patient with PKU if left untreated? Ano kaya yung tamang sagot dyan? O, intellectual disability, pwede ba siyang mental retardation? Yes or no? Yes. Letter cat. Okay, letter cat. Mental retardation po yan. Number 80. Dito na tayo. Nurse Amara is assigned in high-risk delivery room for 2 weeks. The following questions apply. Episiotomy is usually indicated to which of the following purpose? Okay, ano ba yung episiotomy? Ano po ang episiotomy muna? Ito yung ano ang episiotomy? Kapag otomy, cutting. Okay, cutting. Diba? Cutting. Okay, cutting yan. Okay? So letter apple, prevents distension of the bladder. Ano ba yung nagpe-prevent ng distension ng bladder mo? Di ba usually yung mga nanganganak, usually naka-epid cut yan. So mas prone sila magkaroon ng distended bladder. Anong gagawin mo para ma-prevent ang distension ng bladder kapag manganganak? Nagika-folicut ka. Folicut insertion. Polycat. To aid contraction of the uterus following delivery. Ano ba yung mga possible mong intervention to aid contraction? Ano yung mga possible? Oxytocin, what else? Ano pa? Stimulation, di ba? Ng nipple. Nipple stimulation. Tsaka uterine massage. Okay. Yan. To relieve pressure of the fetal head, yes. Yan ang tamang sagot natin. Letter cat. To relieve the pressure of the fetal head. Ang question dyan, paano ka mag-episiotomy? Median? Medial cut ba or medial lateral? Medial lateral. Okay, medial lateral ang cutting natin dyan. Okay, sorry. Okay, medial lateral ang cutting natin dyan. Another question dyan, routine pa po bang ginagawa ang episiotomy? Yes or no? No na. Okay, no na. Di ba? Hindi na po siya. Ano? Okay, si 28 po is letter dog. Okay. Next, a 39-year-old at 37 weeks gestation is admitted to the hospital with complaints of vaginal bleeding following use of cocaine 1 hour prior. 1 hour earlier. Sorry na. Okay? Which complication is most likely causing the client's complaint of vaginal bleeding? Anong tamang sagot dyan? It is your abruptio placenta. Diba? Abruptio placenta. Okay? Anong difference si abruptio placenta? Anong usual yan? Kapag abruptio placenta, masakit or hindi? Masakit or hindi? Masakit kapag abruptio placenta. Masakit yan. Diba? Ang abruptio placenta mo, ano yan? Premature separation. Okay? Ang abruptio placenta mo, premature separation yan. Okay? Premature separation. Ano pa? Painful. Anong color ng ano? Ng discharge ni patient mo? Dark red. Okay? As compared to your placenta previa, ano placenta previa? Low-lying placenta? Yes, low-lying placenta. Painless, painful? Painless. Okay, painless. Ano pa? Bright red. Okay, bright red yan. Okay, bright red yan. Okay? So, kadalasan dyan ang tatandaan nyo, kapag placenta previa, good signs. Okay, ano ba yung mga good signs? Painless, bright red. Kapag abruptio placenta, bad signs. Okay? Okay, bad signs yan. Opo, yan siya. Okay, may nagtanong, di ba sir, pwedeng concealed yung sa ano, placenta, sa abruptio placenta? Yes, pwede siya. At the same time, pwede din naman siya maging bloody kapag completely separated na siya. Okay? Yun siya. Next. Ito siya, yung illustration. Ayan lang siya. Pwedeng ganyan or pwedeng complete separated yung abruptio placenta. Okay, anong intervention mo kapag ano, nakita mo may abruptio placenta yung patient mo? Or na-diagnose na abruptio placenta, anong pinakagagawin mo? Ano expected mong gagawin nila, doktor? Emergency delivery ng bata. Okay? Pwede mag-emergency CS yan. Okay? Kasi pwedeng ikamatay ng baby Ben, yes or no? Yes, pwede siya. Eh pag placenta previa, ano most probably pinapagawa kay mother kapag nalaman na may placenta previa siya? Bed rest. Bed rest yan, di ba? No, i.e., pwede ba sexual intercourse dyan? No, bawal sexual intercourse dyan. Di ba? Ito siya, yung main difference lang nila. Charot, ayaw mag-next. Ayan yun. Ayan lang siya. In-explain ko naman na lahat yan, screen cap nyo na lang. Nakita na kayo ng placenta previa, mother. Ako naka-experience na akong placenta previa. True, tiis muna kahit mahirap. Diba? Nakapag-duty ba yung mga person dito? Dalta is Las Piñas, diba? Ang University of Perpetual Health, Dalta, is is Las Piñas. Diba? Jonelta yung sabihin niyan. Diba? Jonelta yung sabihin niyan. Tama ba? Okay. A pregnant woman arrives at the emergency department with abruption placenta at 34 weeks gestation. She is at risk for which of the following blood dyscrasias? Anong tamang sagot kaya dyan? Letter? Na-try mo na IE? The correct answer is letter C. DIC. Diba? Ang abruption placenta, ang pinaka-common na complication niyan is your disseminated intravascular coagulation. Okay? Ang tendency niyan, hemorrhage po ba yes or no? Hemorrhage? Hemorrhage? Pwede ba mag-hemorrhage si mami dyan? Pwede. Oo, experience yung nag-hemorrhage si mami dyan. Ano ba yan? Tawag dito. Nagbi-bleed ba na nagbi-bleed si mami? Nagbi-bleed ba siya na nagbi-bleed? Yes, magbi-bleed na mabibleed dyan si mami. Okay? Dito tayo. Number 83. Nurse Amar is caring for a client with abruption placenta and is monitored for DIC, which assessment finding is least likely to be associated with disseminated intravascular coagulation. Prolonged clotting time. Pwede ba itong cause ng bleeding? Yes or no? Prolonged clotting time. Bleeding? Yes. Decreased platelet count. Decreased platelet count? Yes. Ano normal levels ng platelets? Normal levels ng platelet? It's 150 to 450. 150 to 450. Okay? Ito, petechiae, oozing from injection sites at hematuria. Sign ba yan ng bleeding? Na poor bleeding time? Ay, napangit yung bleeding ni patient? Yes. Okay? So the correct answer is letter apple. Swelling of the cuff in one leg. Kapag nag-swelling one cuff sa one leg mo, ano most probably yan? Pag may swelling sa isang leg, ano manifestation yan? Ano kaya yan? Ano kaya DVT, very good. DVT yan. Anong? Pathognomonic sign ng DVT mo. Pathognomonic sign ng DVT mo. Homan sign. Paano ini-elicit ang Homan sign? Angat mo si paa, then dorsiflex. Okay? Dorsiflex mo si paa. Ano manifestation kapag nag-dorsiflex ka? Masakit or hindi? May pain? Very good. Okay. Yan lang siya. Now, kids. Next. Nurse Amar is assessing a pregnant line in the second trimester of pregnancy who was admitted to the maternity unit with suspected diagnosis of premature separation of placenta. Abruption placenta yan, di ba? Which of the following assessment finding would the nurse expect to note if this condition is present? Okay? Di ba? Ano ba kapag premature separation? Good sign, bad sign? Good sign, bad sign? Kapag abruption, bad sign. Letter apple, good or bad yan? Absence of abdominal pain, good. Letter boy, a soft abdomen, good or bad? Good. Letter dog, painless, bright red, vaginal bleed, good. Anong tamang sagot? Letter C. Uterine tenderness. Your A, B, and D, most probably placenta previa yan. Okay, placenta previa yan. An ultrasound is performed on a client at term gestation that is experiencing moderate vaginal bleed. The results of the ultrasound indicate that the abruption placenta is present. Based on this finding, Nurse Karina would prepare the client for kapag may abruption placenta daw, pwede ba mamatay yung bata? Pwede ba mamatay yung bata kapag may abruption placenta? Yes. Okay? Anong gagawin mo dyan? May weekly monitoring pa ba? Day, emergency yan. X yung letter apple mo. Complete bed rest, placenta previa. Strict monitoring of intake output, X yan. Letter C, delivery of the fetus. Okay? Dito ba yung mga taga-UP? Dito ba yung mga taga-UP or hiwa-hiwalay kayo? Kung hiwa-hiwalay kayo. Hiwa-hiwalay. Okay? The Ebola virus causes an acute serious illness which is often fatal if untreated. Ebola virus first appeared in 1976 in two simultaneous outbreaks. One was in Sudan and one was in Congo. The outbreak which occurred in 2014 in West Africa was the largest and most complex Ebola outbreak since the virus was first discovered. The following signs and symptoms of your Ebola virus disease. Ano kayang tamang sagot dyan? Sudden onset of fever, yes. Okay, may sudden onset of fever yan. Okay? Tumpak to. So kapag ganyan, X agad yung walang number 1. X. X. Tingnan mo dito, walang manifestation si splenomegaly. So X yung si splenomegaly. Si 3, may fatigue dyan. So tama siya. Okay? Bleeding, meron din siya. So matitira ka dito, decreased LOC or tinnitus. Okay? Based sa sa mga common na sources, ang common manifestation is tinnitus. Okay? Usual siya? Anong tawag dito? Complication po ng Ebola virus and tinnitus or hearing loss. Letter dog. Okay, letter dog. Ano pa yung mga other manifestations mo ng EBV? Pwedeng may vomiting. Pwede bang diarrhea? Rashes? Okay? Impaired liver function and kidney function. Okay, ano pa? External bleeding. Yan siya. Keys. Next. The following basic nursing interventions can aid increase the chances of survival except letter apple, provide symptomatic care. Symptom-based manage po ba pag Ebola virus? Shit. Shit na malagkit. Yan. Hala ka. Symptom-based management, yes. Administer oral and intravenous fluid ng susuka to. Pwede siya ma-dehydrate? Yes. Okay, monitor for oxygen saturation and blood pressure. Yes. Bakit mali yung letter boy? Anong mali sa letter boy? Anong nagpamali sa letter boy? Anong mali sa letter boy? Antibiotic. Di ba virus yan? Mag-antibiotic ka ba sa viral infection? No. Di ba? Waquens yun, B. Waquens yun. Okay? Nurse later is reviewing concepts of practicing skills on intravenous transfusion to become competent nurse because he has been struggling coping up with to other nurses. Nurse later is selecting vein for intravenous transfusion in 62-year-old patient. He wants to dilate and distend the veins for easier insertion. Pabalik. Sorry na. Tayo mo sa akin pag done na. Done. Okay? He wants to dilate and distend the veins for easier insertion. He does the following methods except, so ano yung nanap natin? Tama or maling sagot? Tama or mali? Siyempre mali. Okay, apply warm washcloth on the extremity for several minutes. Bakit? Ba't ka mag-apply ng warm cloth? Anong ratio dyan? Para mag-dilate. Okay? Tapping the selected vein multiple times. Pwede hindi. Hindi. Okay? So, Dr. Kansas letter boy. So, pag placing the extremity independent position, tendon yan, mag-pull pa yung blood. Stroking the extremity from distal to proximal. Yes. Okay? So, Dr. Kansas letter boy. Okay? Pero may mga na-encounter akong question, nakalagay doon, slightly tap. Pwede ba slightly tap? Yes or no? Slightly tap. Yes, pwede siya. Basta may nakalagay na slightly tap, pwede yun. Okay? Pero kapag tapping the selected vein multiple times, mali yun agad. Okay? Mali yun agad. Which of the following catheters is used less than 24 hours? Anong tamang sagot kaya dyan? Letter? Portacat. Alam mo yung portacat? Where's the portacat? Parang yung mga naturuan ko ng peri-op dito, parang familiar na kayo sa portacat. Alam mo yung portacat? Yung portacat, usually siya dito siya, central line catheter siya. Okay, central line catheter siya. Sabihin nito, direct siya to the heart. Nakadirect siya sa heart. So, ang ano niya, usually binibigyan sa mga cancer patients po. Okay, sa mga cancer patients kasi 'di ba, mahirap hanapan ng ugat. Okay, mahirap hanapan ng ugat yung mga patient mo. Letter boy parehas. Midline catheter dito siya. Dito. Your peripheral inserted central line catheters. Okay? Dito siya. Your plastic indwelling cannula. Other term for intravenous cannula siya. Okay? Other term yan. So the correct answer is letter boy. Ano ba yung wing? Ay, ito yung butterfly. Butterfly needle. Yeah, butterfly needle siya. Other term for your butterfly needle is the wing infusion set. Okay? Wing infusion set. So letter boy. Di ba meron sa TikTok yun, yung nag-i-insert na nurse? Hindi ko alam kung anong pangalan niya. Tapos palaging butterfly yung insert niya or gauge 26. Di ba? Number 19. How often should nurse later observe a patient with intravenous infusion? Ano kayang tamang sagot dyan? Ang nasa book nakalagay every 1 to 2 hours. Okay, nasa book talaga nakalagay every 1 to 2 hours. So anong best answer dyan? Letter apple. Diba? The frequent, the better. Yes or no? The frequent, the better. Yes. Okay? So, nasa ideal state tayo. The frequent, the better. So, letter apple siya. Okay? Letter apple. Okay? The frequent, the better. Number 91. 6 hours after initiating an IV ring in a patient, nurse later noticed an IV site was red and warm. The patient complained that it was painful. Nurse Daniel would suspect which of the following? Letter apple, phlebitis, di ba? Sabi natin ng phlebitis, kadalasan yan redness, warm to touch. Pwede bang swelling yan? Yes or no? Swelling, pwede bang namamaga? Yes, swelling. Ang infiltration, pale, cool, and pwede bang namamaga din pag infiltration? Pwede din bang swelling kapag infiltration? Yes, pwedeng swelling yan. Eh ano extravasation? Ano nagdi-distinct? Painful, stinging. Okay, stinging and burning. And ang main difference lang tatlo. Okay, that is caused by extravasation. Vesicant drug. Ano yung mga vesicant drugs, sir? Your vesicant drugs are your electrolytes, and antibiotics. Yan yung mga common na mga gamot na nagpapa-extravasate. Yan. Sabihin niyo kapag next na. Next na. Okay. O, ito lang siya, comparison. Na-summarize ko naman na siya. Para screen cap nyo na lang. Lahat yan, kapag na-feel ng patient mo, discontinue IV line agad. Okay. Discontinue IV line. IV para mo kasi mahapdi siya. Pwede din siya can cause extravasation. Mahapdi ang IV paracetamol. Mahapdi ang IV paracetamol. Kasi malapot. Next. What should be the size or gauge of the needle nurse later would use in administering IV infusions for trauma patients? Trauma patients, ano yan? Anong gauge mo? Letter apple. Diba? Letter apple. The smaller the gauge, the bigger the needle, the smaller the needle. The bigger the needle. Anong color kapag gauge 18? Anong color? Green. Anong color kapag gauge 20? Pink. Galing. How about gauge 22? Blue. Blue. Gauge 24? Anong color kapag gauge 24? Yellow. Okay? Yan ang mga color coding natin. Mga nice to know things. Violet 26. Very good. Violet 26. Nurse Jill is a public health nurse in Buhay Mahalaga Health Center and is teaching a group of women who are consulting in the facility. The following questions apply. A patient 3 days postpartum asked Nurse Jill when her menses will return, considering that she is doing exclusive breastfeeding. The best response is 4 to 6 weeks, 4 to 6 months. 4 to 6 weeks or 4 to 6 months? It is months. Letter cat. Letter cat. Okay. Next. Nurse Jill is teaching a female client about congenital rubella. Which of the following is not part of your teaching? Tamang sagot kaya dyan. Pwede ka ba magbigay ng rubella vaccine kapag juntis? Yes or no? No. Bakit? Teratogenic, very good. Letter boy. Congenital rubella can be prevented by receiving rubella vaccine within the first trimester. Okay? Kasi pwede siya magkaroon ng congenital rubella syndrome, deafness, eye problems, brain defects, and patent ductus arteriosus. '95, a couple approached Nurse Jill in the health center with plans to get pregnant. The nurse will advise the couple with the basis on the knowledge that the egg cell will last up for ilang kaya? It would last up for 1 to 2 days. Anong tamang sagot kapag 1 to 2 days? Letter C, 24 to 48 hours. Letter C. Okay? 96. Mali sa document. Sorry. Ano lang yan? Yung baka human error lang. Nagkamali lang ng pag-transcribe. Okay? Which among the following is true about progesterone? So letter C. It maintains and supports the growth of the endometrium. Letter C. Galing talaga yung na-miss ako sa Zoom. May may mga reply. Pwede na mag-react. Di ba this year lang yan, yung ganyan, yung pwede di ba this year lang yan. Last year wala yan eh. So, pwede ka na mag-react. Paano ba mag-react dito? Paano mag-react? Hindi ko alam kung paano mag-react. The following are correct positioning and latching when the baby is being breastfed except. Tapos, quote. Wait lang. Hindi naman eh. Mali naman, di ko alam. Ang tamang sagot, letter dog. None of the above. Okay, none of the above. Grabe naman. Hoy, bata pa ako. Grabe naman siya, nakahalata yung age. Bata pa ako, promise. Di lang halata. Grabe sila kung makajudge sa akin. Hoy, grabe talaga. Hoy, promise. Age review. Kahit hulaan nyo pa ko ilang taon ako, tingnan nyo. A pregnant mother. Hoy, hindi ako 30. Grabe naman yung 30. Grabe yung 30 as in. Bata pa ako, promise. Ilang taon na kayo? Anong age range nyo? Grabe naman yung 30, 23, 22. Oh. Ano, naabutan ko pa kasi yung mga UP student dito, batch ano sila 2022. Naabutan ko pa silang first year college sila, fourth year college ako noon. Oh. 25 pa lang, grabe naman kayo. 25 mukha lang 20. True or false? Mukha lang 20. Sabi na, ay false, grabe naman. Mukhang 20. Hoy, grabe naman. 25 pa lang ako. Hoy, anong 35? 35. Legit. Uy, grabe talaga. Mukha lang ako matanda. Okay, a pregnant mother who was diagnosed as having diabetes mellitus type 1 is already at 24 weeks gestation. Mas matanda ako kay JD. Mas matanda ako kay JD. Ang batch ni JD 2020 si JD, ako 2019 ako. Which of the following statements by the nurse Jill is relevant for the client? Ano kayang tamang sagot diyan? Kapag ganyan, diabetes mellitus. Okay? Letter apple, tama po ba yung letter apple? You need to have optimal glycemic control to keep your blood sugar low. Gusto mo ba mababa yung sugar? Yes or no? No. O, diba? Mali. Hyperglycemia is the most common complication of your baby when he is delivered. Hypoglycemia. Hyper o hypo? Hypo. Hypoglycemia. Mag-oohas ka ba kapag juntis? Ohas? Ohas pag juntis? No. Okay, hindi ka mag-oohas kapag juntis. Contraindicated ang ohas sa juntis. Okay? Letter boy. Letter boy. Next. The mother consulted to Buhay Mahalaga Health Center as she suspects that she is a mother of having no menstruation this month. She told the nurse that she had her menses last February 14, 2018. The mother asked when she will deliver the baby. Nurse Jill correctly replies. Anong tamang sagot kaya dyan? Ano ba yan? Plus 9, di ba? Plus 9. Tapos plus 7. Di ba? Anong rule muna to? Anong rule to? Anong rule to? Nagel's rule. Hindi ko sure kung mag-online class. Ay, mag-face-to-face ako eh. Nagel's rule. Hindi ko sure. Hindi ko sure kung bibigyan ako ng face-to-face na class. Hindi ko sure. As in, wala akong idea. Kasi, part-time ko lang po ang lecture. Ang pagiging lecture. Full-time po akong nurse po sa isang hospital po. Okay? So, plus 9 months. Plus 9 months. Plus 7. Pwede din naman minus 3 months. Plus 7. Okay? Kapag January to March, plus 9. Kapag April onwards na, minus 3. Okay, minus 3. So, ang correct answer dyan is letter. Ang tamang sagot dyan, letter dog. Letter dog po. Okay? Next. Which among the following is the first step that the nurse Jill must consider in preparing a health teaching plan? To know, ano kayang tamang sagot dyan? In any health education, dapat alam mo to. Dapat, ito yung i-assess natin. Ang tamang sagot, letter dog. Learning needs. Okay? Any health teaching plan mo, kailangan alamin mo yung learning needs ng patient mo. Para, ang number one pinakamaganda example dyan, for example, buntis yung nanay. Tapos tinuro mo contraceptives. Magiging kaya sila dyan? Makikinig kaya sila sa'yo? Yes or no? Mga buntis ang ang participants mo. Tapos ang tinuro mo, oral contraceptives. Makikinig kaya sila dyan? Yes or no? No. Kasi hindi nila need yun as of now. Yun ang important ng learning needs. Okay? Yun ang importance ng learning needs po. Okay, questions so far for the NP3? Questions? None. Okay, bladder break muna, 5 minutes. 10:40 balik kayo. Carry lang 10:40 or 10:45. Pili. 10:45. 10:45. Mabalik kayo 10:45. Pag may mga questions, sampal nyo lang dito sa chat. Sasagutin kayo eventually. Magba-bladder break lang ako. Okay? Let's go. So go. Bukas pa ata, di ko sure kung ano schedule nyo, pero NP3 for second half po ako, ha? NP3, second half po ako na recalls to NP3 on, NP351 onwards pa hanggang NP5. Ibang lecturer po ang ang NP1, NP2, NP3 first half. Okay. Ready na ba? Hoy. Wala. Hello po. May tao po ba dyan? Ready na. Okay. Ay, coffee. Ano mga routine nyo para sa mga kape-kape? Ano yung mga recommended coffee nyo? Oh. People empowerment is an important purpose why community participatory action research was created. And it encourages the community to generate community participation in development of activities. Nurse Cody is reviewing the concept of COPAR as he is about to conduct it in Mendez, Cavite. The following questions apply. In COPAR, people of the community are being prepared as managers of development programs in the future. All of the following but one is NP4 na po. NP4. Lagyan natin NP4. Ano ba? Natin NP4. NP4 na tayo, B. Yeah. All of the following but one is considered as principle of your COPAR. Kapag ibig sabihin, ano ibig sabihin ng all of the following but one? Negative or positive answer ang hahanapin? Negative. Negats yan. Nega ang hinahanap mo dyan. Okay? People, especially the most oppressed, exploited, and deprived sectors are open to change, have the capacity to change, and are able to bring about change. Yes. Okay? COPAR should be based on the interests of the poorest sectors of the society. Yes or no? Ang COPAR ba dapat ay naka-base sa interest ng poorest sectors? Yes. Okay, COPAR should lead the self-reliant community and society? Yes. The correct answer dito po ay letter po. Community resources are identified and mobilized for the poor and powerless and oppressed. Okay? Yung letter A, C, and D, that is the definition of your COPAR. Okay, that's the definition of your COPAR. Okay? Direct answers talaga to. Okay, direct answer talaga siya. Next, COPAR is people-based. It is focused towards the powerless and oppressed, which developmental approach is related to participatory. Letter Apple, abandoning traditional methods. Pwede ba yun? I-abandon mo. Sabihin nito, you won't utilize the resources that the community has. No. Di ba? Kapag COPAR ba, i-utilize mo kung ano ang meron ng community mo. Yes or no? Yes. Di ba? Kung anong meron sila, di ba? Di lang, kung ano meron sila, yun yung i-focus mo. Okay? Introduction of whatever resources are lacking in the community, adopting technological development. Yes or no? Introduction of whatever resources lacking in the community. Siyempre, hindi rin po. For example, ang lacking sa community mo, walang x-ray. So, magdadala ka x-ray doon. Diba? Parang ganun ang logic niya. Okay? Immediate or spontaneous response to ameliorate the manifestation of poverty, especially on the personal level. Immediate and spontaneous response. Diba? Kapag nagko-COPAR ka, ang priority mo dyan, capacity building. Long-term po ba ang gusto mo kapag capacity building? Or kapag COPAR? Long-term ang effect. Yes, long-term and self-reliant dapat sila. Okay? So the correct answer is letter dog. Diba? The process of empowering the poor so that they can pursue a more just and humane society. Gusto mo, di ba? Gusto mo ba kapag alas ng COPAR, naiiwan mo yung base, yung community at self-reliant na sila? Yes or no? Gusto mo ba magiging self-reliant na sila eventually? Yes. Okay? Next. The following statements do not relate to community development but one. Ano yung nahanap mo dyan? Tama or maling sagot? Tama or mali? Hinahanap mo dyan, tamang sagot. Opo, tamang sagot. Negative times negative is equal to positive. Okay? For example, nurse must not join protest action as nurse should always be neutral at all times. X yan. Okay? If people are not attending to the services offered by the health staff, the team must reassess the needs of the people. Yes. Okay? Yes, yan yung correct answer. 'Di ba? Kapag hindi nakikita ng community mo yung problem na pinreset mo sa kanila, feeling mo ba attendan nila yon? Yes or no? No. Pag hindi nila nakikita yon as something na problem sa community nila, wala silang paki dyan sa ano mo, sa interest or sa plan mo. Okay? Carrying out the plant activities involving maximum community participation is referred to as sige, catch up mo na yung mga person. Number 1, letter boy. Number 2, letter dog. Number 3, letter dog. Ano kaya yan? Plant activities carrying out. The correct answer is letter. Ano siya? Yung number 1 kasi. Yung number 1 kasi. A, C, and D, yan yung ano talaga. Yan yung by definition po ng COPAR. Okay, yan talaga yung definition ng COPAR. Kaya yung letter B kasi inimbento lang siya. Okay? Yan siya. Yung letter A, C, and D, yan talaga siya yung definition sa COPAR. Okay? By word talaga siya kinuha. 2. Four na tayo. Mobilization. Next, community organizing ends when the community is already self-reliant. This signals that the community organizers are now ready to pull out of the community because anong gusto mo? Di ba gusto mo maging self-reliant yung community mo? Ibig sabihin nito, hindi sila nakadepend sa iyo. Di ba? It would prevent dependency of the community. Di ba? It would prevent dependency. Ibig sabihin nito, hindi sila magiging dependent sa iyo. Kaya nila tumayo mag-isa. Okay? Letter boy. Yeah, sila na dapat yung gumagawa. Nakapag-COPAR ba kayo? Nakapag-COPAR? Yes, medyo mahirap ang COPAR, no? Sobrang na-turn off ako sa committee nung dahil dyan, eh. Dahil ang hirap-hirap ng COPAR. Tapos, nasa ano kayo? Nasa probinsya. Probinsya din ba ang COPAR nyo? Hindi. Kasi kami Cavite kami. COPAR sa Cavite. Okay? Local government code known as RA 7160 brought major roles of the Department of Health. Under this law, all structures, personnel, and budgetary allocations from the provincial health level down to the barangays were devolved to the local government units to facilitate health service delivery. Okay? RA 7160 or the local government code mandates devolution of basic service from the national government to the local government units. Which of the following is a major goal of your devolution? Ano kaya ang devolution mo dyan? Letter. Ano kaya? Letter dog, to empower the people and promote self-reliance. Letter dog. Okay? Devolution, by definition, and devolution po refers to the act by which national government confers, okay, and the authority of the various local governments to perform specific function. Sabihin nito, yung devolution nasa nasa local government unit ng power. Okay? Ang power ay nasa local government unit na. Okay? Kaya ang goal mo dyan to empower the people and promote self-reliance. Actually, hindi rin maganda yung local government code kasi paano kung hindi priority ng mayor or ng local government mo ang health? Eh di halos putso-putso lang yung health interventions mo. Diba? Kaya hindi masyado maganda ang 7160. Diba? Next, diba a good example niyan, may mga local government unit na maganda ang vaccination process nila. May mga iba naman ang pangit. That's an example of the local government code. Diba? Okay? Lavinia recently passed the board exam and now has her license to practice. She wants to become a public health nurse where she will be applying. Saan siya mag-a-apply? LGU code, saan? Sa RHU. Rural Health Unit. Alam niyo ba kung saan yung mga RHU nyo? Alam niyo kung saan yung RHU? Yung health center nyo, alam niyo kung saan health center nyo? Kilala niyo yung BHW na naka-assign sa inyo? Sa akin wala, hindi ko talaga alam lahat. Ay, ganda. Sana all. Ever nabisita na kayo ng BHW nyo? Nabisita na kayo ng BHW nyo? 'Di ba? Sad reality, ang pangit, 'di ba? Doon nyo malalaman kung maganda ang local government nyo. 'Di ba? Kung priority ba nila ang health. 'Di ba? O, the public health nurse is a supervisor of rural health midwives. Okay? Oo, surveillance. Social naman, nag-aano kayo? Hindi ko matandaan. Which among the following is a supervisory function of the public health nurse. Supervisor. Ano po bang ginagawa ng supervisor? Anong ginagawa ng supervisor? No, sa mga midwives, anong ginagawa mo? Guide. Di ba i-guide mo sa letter? Dog. Technical guidance to the midwife. Di ba? Sila i-guide mo yung midwife, kumbaga magde-delegate ka ng task sa mga midwife. Okay? O, sino naman ang sinusupervise sa mga midwife? Si BHW. Very good. Si BHW ang sinusupervise sa midwife. Tamis sa akin kapag next na. Next na. Next. Oh. One of the participants in Hilo training asks you to whom she should refer the patient in labor who develops complication. Complication, you will answer would be to the, saan kaya? Kay public health nurse po ba? Kay municipal health officer. Sino ba si municipal health officer? Sino siya? Si doktor. Si doktor yan. Okay? Si MHO, si doktor po yan. Community health nursing is developmental service which among the following best illustrate this statement. Community health nursing, letter apple, treatment of the disease, yes or no? Community health nursing, treatment of the disease. Priority mo ba? No. Diba? Ang primary mo dyan, promotion and prevention. Okay? The goal of the community health nursing is to provide nursing services to people in their own places of residence. Dapat, 'di ba? Pupunta yung yung people sa health center. Yes or no? Yes. Okay, hindi ikaw yung pupunta sa bahay nila. Okay, hindi ikaw yung pupunta sa bahay nila. Sila ang pupunta sa health center. Okay? The community health nurse continues to develop himself personally and professionally. Dapat kapag ganito, yung mga ganyan, patient-centered. Okay? Health education and community organizing are necessary in providing community health service. Letter dog. Letter dog. Next, you are a nurse in the entry phase of the community organizing process. After establishing rapport with the people in Barangay San Miguel, the following questions apply. With the number 9, yan na pala, may nag-reply. With the community health activities started in the entry phase, which of these activities should not include? Entry phase. Ibig sabihin niyan, pag entry phase, papasok ka pa lang. 'Di ba? Informing health leaders, yes or no? Yes. 'Di ba? Core group formation, yes. Conducting deepening social investigation, yes. Letter boy. Ano ba yung mga phases ng COPAR natin? Ano yung mga phases ng COPAR? Ano yung first phase? Ano yung number 1? Your pre-entry. Number 2, entry. Number 3. Okay, number 3. organizing or building phase. Ano yung number 4? Sustenance and strengthening phase. Okay? Binigay ko lang yan. Mas ma-further ma-illustrate yan kapag nag-community na kayo. Nag-community na ba kayo? CHN? Nag-CHN na kayo sa review? Nag-CHN na sa review? Ay, hindi pa. Yung iba, yes. Sino CHN nyo? Sir Ducklis. Ang galing ni Sir Ducklis nun. Naabutan ko pa si Sir Ducklis na lecturer nung ano. Naging lecturer ko si Sir Ducklis pa. Diba? O, ba't kaya sabi ko sa inyo, bata pa ako? Pabalik. Diba? Galing. Sino si Alright? Sino si Alright? Hindi ko maalam yung mga ano. Nagbago na ata yung mga ano nila. Ang sa amin kasi no. Ganun siya ng ganun sa amin noong time namin. No. Ganun siya, di ba? Hindi ko alam kung ganun pa rin siya. Mas okay pa sa Alright, gets. Wala akong ganun eh. Okay, identification of potential leaders is crucial during the entry phase. Which of these characteristics may not be necessary to an efficient and effective community leader? Anong tamang sagot dyan? Ba't lahat ba ng lecturer meron ba mga tagline? Parang hindi naman lahat, Toy. Yes. Lahat meron, di ko yo. Diba? May type Y kung buhay. Dapat sir meron. Isipan nyo ako. Anong tamang sagot dito? Alpha P na kilala ko kay Sir Archie. Tamang sagot. Sir Chavez, di ko nakilala si Sir Chavez eh. Tamang sagot dyan, letter Apple. Di ba dapat responsive and willing to work for change? Yes. Di ba? Must have relatively good communication skills? Yes. And a respected member of the community? Yes. So letter Apple. Okay? Letter Apple. Di ba? Not necessarily mean college graduate ka. Pwede ka na maging potential leader. Kasi paano kung wala kang pake sa community? Di ba? Let's be honest, yung kadalasan yung mga college graduates sa community, sila pa yung walang pake. Diba? Next. The best technique in identifying potential leaders in the community proven to be effective is to... Sino si Sir Keith? Si Sir Kenneth ba si Sir Keith? Hindi ko kalala yung mga lecturers na halaka. Anong tamang sagot? Iba pa. Hindi ko din siya naabot. Sir Garino, hindi ko na rin naabot sa Sir Garino. Ang tamang sagot dito. Ask community resident to directly name. Take note, best technique. Ibig sabihin niya may mga answers na pwedeng tamang sagot dyan, pero hanapin mo best. Kilala ko yung sabunutin ko bulbul mo. Si ano yan? Si Attorney Kapili. Abutan ko si Attorney Kapili. Grabe kayo. Okay, ask community residents to directly name person. X yan. Diba? Ask volunteers who are willing to become community leaders. Hindi rin po. Review family background properties and academic records. Grabe naman. Diba? Correct answer dyan is letter dog. Observe people who are in active small mobilization, activity that motivate residents to start working. Okay, saan niya makikita? Saan mo usually makikita yan? Yung mga ganyan. Yung mga, mga marites. Diba? Yung mga marites sa committee, sila yung mga yan. Yung mga observe people who are in active small mobilization activities. True or false? Yung mga marites, yung mga group dyan. Sila ang CCTV, true. Sila ang ultrasound, malalaman nila kung buntis or hindi ang babae. True or false? Diba? Ultrasound ng community yan eh. Diba? Minsan din RT-PCR pa yan. Alam nila kung may COVID o wala. Diba? Alam nila yon kung may COVID ang tao wala. True yan. Kaya ang pinaka-best answer dyan pag tinanong kayo, sino malaman nyo kung sino ang potential leaders? Yung mga marites po. Joke lang. Okay. The core group. True. Alam pa nila may utang ka. Kilala nila kung sino jowa mo. True or false? Diba? Kilala nila kung sino ang kirida ni ganyan. The core group is composed of individuals in the community who possess leadership potentials, organized into cohesive working unit. The core group works with the team in what? Ano kayang ginagawa ng core group mo para mobilize the community to act on their most immediate felt needs and to participate in the delivery of essential health. Gano'n ba karami ang dapat na core group mo? Usually ang core group, ilang members yan? 5 to 7. Okay, 5 to 7 people ang core group mo. Umamin kayo, ayaw nyo ng core group formation, ng hassle nyo. Diba? Hassle kaya yung init-init pa. In layo-layo ng lalakarin. So, init. Okay. Population-focused nursing practice requires which of the following processes? Anong kaya ang tamang sagot dyan? Anong tamang sagot kaya dyan? Pinaka-ayaw nyo din gawin yan. Sure ako. Pinaka-ayaw nyo gawin yan. Yung CDX. Community diagnosis. Di ba ayaw nyo din gawin yan? Ako din ayaw ko din yung CDX talaga. CDX. A relevant program address community health conditions, particularly tuberculosis. Again, safety and quality care is every nurse's concern. The following questions apply. TB dolls or directly observed treatment of short course can do all of the following except. Ano kaya ang tamang sagot dyan? Stop resistance to anti-TB drugs? Yes. Okay, bakit siya naging it would stop the resistance? Kasi nga po, direct observed treatment, ibig sabihin nito, targeted kung ano yung kailangan na gamot. Tapos short course siya. Ibig sabihin nito, yung pinakamaikling time na exposure sa antibiotic na patient, yun yung ginagawa sa kanya. Cure TB patient, curable po ba ang TB? Yes or no? Curable. Curable po ba ang PTB? Yes. Okay, curable ang PTB. Okay? Prevent new infection among children and adults. Yes, para po malimit, 'di ba, ang hawa-hawaan. Letter C, increase healthcare cost, 'di ba? Ibig sabihin nga po, 'di ba, kapag TB dots ka, pinapaikli mo yung time ng treatment niya. Tapos, yung ginagawa mo din, yung monitoring din, pinapaikli din siya. Usually ba ang TB dots gaano katagal? Pag Cat 1 yung patient, primary tuberculosis, primary pulmonary tuberculosis, usually 6 months lang siya. Okay, usually po 6 months lang siya. Next, which vital statistics relating to tuberculosis in our country is inaccurate? Well, ano kaya dyan? 1 year ginamot, depende yan. Depende kung Cat 1 or Cat 2 ka. Kunwari na ulit yung TB mo, most probably 1 year na yan. Okay, it would depend. It would depend po sa protocol. Na first time mo, kaya lang ang nangyari dyan, baka nung parang ika-sputum CS mo ng 5th month or 3rd month, meron pa nakikita. Kaya in-extend pa. Pwede yun. Okay, extra pulmonary tuberculosis ka. Okay? Anong tamang sagot dito? Most TB patients belong to 015. Saan ba common ang PTB? Saan common ang PTB Saan kaya? Old people na low socioeconomic background. Okay, low socioeconomic background. Letter dog. May mga nagka-TB na ba dito? Meron na. Meron na nagsabi may isa na eh. Meron na. Primary. Hindi ko sure kung kung true yun. Sabi nila kapag nagka-TB ka daw, mahirap daw makaalis ng ibang bansa. Hindi ko alam kung totoo yun. Kasi nagkakaroon ng ng scar sa lungs mo. 'Di ba? Hindi ako nananakot hindi ko alam kung totoo 'yun. Oo. Hindi ko sure kung true 'yun. Sabi lang nila 'yun. Mahirap daw. Kaya 'di ba bago ka mag-ibang bansa, chine-check nila 'yun kung nagka-TB, kung may TB ka or wala. Kaya pala kaya ka 1 year kasi extra pulmonary TB ka. 'Di ba? Kaya alagaan ang sarili, B. Okay? The elements of TB dots na need to be fulfilled include all of the following except standardized recording and reporting of TB. Yes. Okay? Direct course treatment type. Sabihin dito, binabantayan ka ng BHW mo. Regular supply of anti-TB drugs. Yes. Ano yung mga anti-TB drugs mo? Rights or ripes? Ano yung letter R? May nagsasalita na naman. Letter R. Rifampicin. Rifampicin. Ano yung I? Isoniazid. Isoniazid. Ano yung P? Pyra. Zinamide. Ano yung E? Ethambutol. Ano yung S? Streptomycin. Okay? Ang bagong update dyan, ang streptomycin hindi na siya kasama. Hindi na siya na nakapag cat 2. Category 2. Ibig sabihin nito na ulit yung tuberculosis niya. Hindi na sinasama ang streptomycin. Bakit? Paano ba binibigyan streptomycin? Paano binibigyan streptomycin? Paano kaya binibigyan streptomycin? Via, galing, IM injection, intramuscular injection. For ilang days? For ilang days? 30. 1 month siya. 1 month siya ibibigay. Yes. 1 month po siyang ibinibigay. Kaya nagkakaroon ng port compliance. Okay, port compliance. So the correct answer is letter apple. Okay? Hindi ka magkakaroon ng regular chest x-ray dyan. Okay? Hindi ka Ano bang gold standard for your TB dots or for your pulmonary tuberculosis? Gold standard. According to the DOH. Ano nang gold standard natin? According to the Department of Health, hindi na siya sputum. Hindi na siya sputum microscopy or yung TBCS culture studies, hindi na. It is the MTB gene expert na. Okay, MTB gene expert na po. Okay? Yan na ang gold standard according to the Department of Health. Galing. Okay? Next. Pulmonary TB is suspected when the client manifests which of symptoms? Ano kaya dyan? Very good. Letter. Siya yung pinaka-distinct. Diba? Kapag may cough ka for 2 weeks, for more than 2 weeks, sinususpect ka na kagad. Okay? Sinususpect ka na kagad. Which of the following statements about TB treatments is incorrect? Sinabi na natin to. Ano kaya? Letter. Ay, sorry. Yan. Sorry, number 19 yan. Number 19 yan. Nagkamali lang ako na numbering. Ano to? Letter C. Single drug is appropriate. Okay? Kasi di ba most probably 4 combination drugs yan. Okay? Combination drugs kadalasan po yan. Okay? One of your responsibilities as a community health nurse is to conduct home visits to evaluate health conditions of families and communities. Gusto nyo ba yan? Yung home visit? Umamin kayo. Ang gusto nyo sa home visit, yung pagkain? Umamin. Wala akong makikikain. Tapos makikita mo yung kaldero nila may ipis. Diba? Tapos kumakain ka ng pansit, tapos may ipis. Sarap nun, no? Minofera ka ng tubig. Pagkakita mo sa, diba? Minofera ka ng tubig, inom-inom ka, ay, ang sarap po ng tubig yung lamig. Pagkakita mo sa timba, meron? Kiti-kiti. Diba? Diba? Umamin kayo. True yun. That's the reality. Diba? Yun yung reality dyan. Kaya dapat kapag offeran kayo, dapat C2 ang tatanggapin nyo. C2, Zesto. Diba? Ganun dapat. C2 Zesto, dapat naka-tetra pack. Prior to the visit, when you have checked on your client's records in the health center to have background of their case and to formulate for objectives of the visit. This phase is, anong ginagawa mo? Nag-check ka na. Nagba-background check ka na. Anong ginagawa mo dyan, letter boy? Planning. Okay, nasa planning phase ka na. In every home visit, you are not only concerned with the client, but you should also, anong tamang sagot kaya dyan? Pay particular economic status, X. Hindi naman siya, kumbaga, pwede siya, pero hindi siya yung priority mo. Put emphasis on the children's education. Pwede siya, pero hindi rin siya priority mo. Observe family spiritual practice, pwede siya, pero hindi. Mas maganda yung letter boy. Umbrella answer yan. Observe the family and the environment. Ano ba yung mga ino-observe mo kapag nag-home visit ka? Ano yung usual mga ino-observe? Presence ng vectors, 'di ba? CR. Tas 'di ba gumawa din ba kayo ng anong tawag doon? House, yung mapping ng bahay. Gumawa din ba kayo ng bahay, mapping ng bahay? Spot map, 'di ba? Tapos titingnan niyo kung fully now open ba yung yung pintuan. 'Di ba may ganun tanong sa community? 'Di ba? Tapos tatanungin mo kung paano sila natutulog, saan sila natutulog, anong arrangement ng tulog nila, true or false. 'Di ba? Tatanungin mo kung paano po kayo natutulog, 'di ba? Ayoko din nun eh. Haba-haba. Tapos gagawa ka pa ng ang tawag dito, family tree. 'Di ba? Ang community health nursing may family tree din, 'di ba? Tama ba? 'Di ba? Sa amin nung college kami dapat ang isa sa mga nursing intervention, makikikain ka talaga sa family. Oo, sasama mo, kakain ka kasama yung family dapat. Nung college kami, third year college ako noon. Tapos dapat sasama ka sa pamimili ng pagkain. Sa pamimili sa palengke, pag namamalengke, kasama ka. 'Di ba? Ay, nilulutuan niyo pa? Which type of family nurse contact will provide you the best opportunity to observe family dynamics? Anong tamang sagot dyan? Letter C, home visit. Paano malalaman yung family dynamics nila? Ang tip sa amin dyan ng prof namin ng college, malalaman mong yung family dynamics nila pag nag-aaway sila. Kailangan makita mo nag-aaway sila. O para makauno ka sa subject, sa rotation niya. Dapat makita mo nag-aaway yung family. Okay? During a home visit, socialization is important in order to, anong tamang sagot dyan? Ano yung pinaka-main goal mo ba pag home visit? Malaman yung mga pangangailangan nila. Letter C. Identify the needs of the client. Okay, letter C. Para malaman mo yung mga important information na meron sila. Next. To give clear and correct information to the client, the nurse should consider the following except listen to what the patient is saying, yes or no. Listen to what the patient is saying, yes. Kailangan mag-pay attention ka kung ano sinasabi nila. Do not use medical terms. Do not use medical terms. Yes, dapat common terms yung sasabihin mo. For example, anong Tagalog ng Foley catheter? Anong Tagalog ng Foley catheter? Galing sonda. Okay? Yan yung mga common nila. O kaya Tagalog ng enema. Enema. Anong Tagalog ng enema? Labatiba. Galing. Tagalog ng sperm. Hindi. Ang semilya, semen. 'Di ba? Hindi rin siya yung letter T. Punlay. Punlay ang Tagalog nun. 'Di ba? Ang kole, ang gallbladder, alam ko Tagal ng gallbladder. Hindi ko alam. Anong tagal ng gallbladder? Lapay? Hindi ko din alam talaga. Papaitan. Parang tanga. Apdo. Okay? Or repeat important information, yes. Okay? Bakit mali yung letter A? Give several instructions one at a time. Bakit kaya? May several instructions, ma-overwhelm ba yung family? Ma-overwhelm, yes. Ma-overwhelm yan sila. Pagka ginanya mo sila na overwhelm sila, kinabukasan, wala nang tao sa bahay nila. Yes or no? 'Di ba? Why in-explain mo lahat? Kinabukasan, wala nang tao sa bahay nila. Katok ka ng katok, naka 30 minutes ka na kumakatok, walang tao. Lagot ka sa prof mo. 'Di ba? Next, professional development is achieved through participation in various trainings and continuing professional education. This is to keep nurses abreast with the latest development in the profession and staying global competitive in skills development. Nurse Irish is attending pediatric advanced life support training to review her previous PALS training as a requirement in the new hospital where she was recently employed. This is an example of ano kaya? Continuing education, letter boy. Letter boy. Kasi, pag in-service training, sabi niya employed. Mag-continue education, magbabago ka. Okay lang yung tandaan nyo kapag ganyan. Next, Nurse Isabel believes that health is a fundamental right of every individual. He believes in the worth and dignity of each human being and recognizes primary responsibility to preserve health at all costs. These statements are part of the, ano kaya yan? Sa Code of Ethics of RN. Diba? Sa Code of Ethics ng Filipino nurse, health is a fundamental right. The Filipino RN believing in the worth and dignity of each human being. Diba? This recognize the primary responsibility to preserve health at all costs. This responsibility encompasses promotion of health, prevention of illness, alleviation of suffering, restoration of health. Yan. Okay. Awayin nyo. Aralin nyo yan. Okay? Awayin. Aralin nyo siya. Okay? Aralin nyo yung ano. Nasa search lang siya sa ano, Code of Ethics PRs. Lalabas na siya doon. Okay? Lalabas na siya doon. Next. Wait, tingnan natin. Nurseries na. Wait, check ko. Requirement siya in a new hospital. Requirement siya sa new hospital siya. Hindi siya requirement sa previous hospital niya. So, continuing talaga siya. Hindi siya in service. Kasi magbabago siya ng hospital eh. Okay? The object, RA 9173, type nyo lang RA 9173 sa Google, lalabas na siya. Okay? The objectives of continuing professional education programs in nursing are the following except, ano kayang tamang sagot dyan? Ano kayang tamang sagot? Protect and promote general welfare of the public by attaining highest standards and quality, yes. Make the professional globally competitive, yes. Augment the nurse educational preparation for admission to the practice of his profession, yes. Okay? Letter dog. Kapag ganyan, plastika na sagot na lang yan. Okay? Plastika na sagot kapag ganyan. Letter dog. Knowledge on the epidemiology and communicable disease is an important tool that can help a nurse in taking care of a community and population group. In the investigation of an epidemic, the nurse compared the present frequency of the disease with the usual frequency at this time of the year in the community. This is done during which state of investigation? Ano kaya yan? Kino-compare mo daw. For example, kino-compare mo yung previous year, yung frequency ng disease previous year and this year. Anong ginagawa mo? Tinitingnan mo ba kung may epidemic, yes or no? Or may increase sa cases? Yes. Okay, nag-establish ka kung may epidemic mo or wala. Letter apple. Okay, letter apple. Number 30. The number of cases of dengue fever usually increases towards the end of the rainy season. This pattern of occurrence of dengue fever is best described as, take note, meron siya every rainy season. Tuwing kailan ba tumataas ang dengue cases? Kailan siya tumataas ang dengue cases? Tuwing kailan? Anong month sa atin? Diba? Rainy season, start yan ng June. Diba? Start ng June hanggang siguro mga December, mataas ang cases niyan. So, cyclical ba siya? Yes or no? Yes. Okay, cyclical siya, letter boy. Ano yung sporadic? Ang sporadic, ito yung mga infrequent, irregular yan. A good example of your sporadic, ang common na lumalabas, ano kaya? Ano yung common na lumalabas? It is your, rabies. Very good. Rabies yan. Rabies ang sporadic mo. Ang secular, ito yung mga prolonged period. Ito siya. Yan. Ang epidemic, anong epidemic dito sa Pilipinas? Anong epidemic dito sa Pilipinas? TB, tuberculosis. Kaya nga tayo, 'di ba, pag mag-ibang bansa, i-screen tayo for TB. Okay? Ang measles kasi more sporadic na siya ngayon. Kasi 'di ba halos mababa dahil sa vaccination natin, nagiging sporadic na siya. Okay? Pero yan yung kinakatakutan, 'di ba, ngayon? Kasi ang baba ng ang baba ng vaccination natin ngayon sa mga bata. Kinakatakutan nila baka maging epidemic ulit ang measles. Secular, long term, usually years. Ano ba mga long term? Ang HIV kasi pandemic pa siya eh. Pandemic pa ang HIV. Pwede din naman siya maging secular ang ano. I'll try to search sa secular variation. Kung ano yung mga example ng mga secular. I'll try to research on that one. Then send ako kayo. Hindi ko sure kung may outbreak ng measles ngayon. Parang wala ako nababasang report na may outbreak ng measles ngayon. Okay? In the community health nursing area, the realities of cause and effect relationship always exist, and the CHN nurse is in a very strategic position to decipher these occurrences. The following questions apply. In a political rally, spaghetti and fried chicken were distributed among 1,500 people who attended around 2 to 3 hours after lunch. People started experiencing GI symptoms such as stomach pain, nausea, vomiting, diarrhea, fever, and dehydration. Health authorities confirmed that the outbreak of illness was mainly due to staphylococcal enterococci. This condition is an illustration of statistical association, which is, ano kaya siya? Ano kaya most probably cause kung bakit nagkaroon ng gastrointestinal symptoms? Dahil sa spaghetti. Diba? Dahil sa spaghetti, most probably, direct causal yan. Okay, direct causal siya. Okay, direct causal yan. Ano ba yung type ng epidemic? Anong type yan? Isa lang ba siya? Isa lang siya? Isa lang siya, yes. Okay, isa lang siya. Most probably, point siya. Okay, point source siya. Okay? So, meron tayong different kinds ng epidemic. For example, yan. Number 1, common source. Yan yung point source. Okay? Yan yung point source. Yung number 2, propagated. Ito from transmission from one person to another. For example, yan syphilis. Okay? Number 3 is a combination of your common source and your propagated. Ibig sabihin nito, nanggaling siya sa isang source, tapos napakalat ng another person. That is an example of your mixed. Okay? Yung mixed. Ang common example nito yung shigellosis. Hindi ko sure kung alam mo shigellosis. Ano siya? Para nakukuha siya fecal oral transmission, tapos mapapasa siya from time to time. Yan siya, yung type ng epidemic. Tatlo yung types ng epidemic mo. Sabihin niyo kapag done na. Ito lang ba yung class niyo for today? Or meron pa kayong night class? Ito yung nakukuha to fecal oral transmission. Tapos mahahawa niya yung ibang other people. Yan. Meron pa 6 p.m. 6 to 10. Ano yung pinaka-late ng class na na-handle or na-experience? Ano yung pinaka-late yan? Pero may umabot na ba ng 12 a.m. sa inyo? Wala pa naman. May 9 p.m. Wala pa. Ako dati umabot kami dati ng past 10. May 2 to 8 kayo. Okay? The public health nurse conducts a study on the factors that can contribute to the high mortality of particular disease in the municipality. So hinahanap niya why. Bakit siya mataas? Okay? Which branch of epidemiology does the nurse practice in this situation? Anong tamang sagot kaya dyan? 1050, letter boy. Diba? Ang descriptive kadalasan yan, time, person, place. Diba? Who, when, where. Ang analytical mo kadalasan, ay shit. Kaya laban kayo dyan. Ang pinakamaganda dyan, umattend kayo lahat ng class nyo. Analytical is why and how. Yan, ang analytical mo. Itong dalawa, X lang siya. Okay, ito yung mas inaalam nyo. Descriptive and analytical. Pero nagkakaroon pa kayo ng rest day. Nagkakaroon pa kayo ng rest days nyo. Or wala din. Minsan, at least meron kayong rest day. Diba? Yun yung maganda. Ganun talaga, once a day lang yung rest time nyo. Ang pinakamagandang tip ko dyan, attendan nyo lahat ng class nyo. Attendan nyo lahat ng class nyo para hindi kayo nagkakaroon ng backlog. Okay? Hey, here, the nurse would want to determine the magnitude of the problem. Therefore, she will compute for, kapag magnitude, ano i-identify mo? New cases or old cases? Or all cases? Anong tamang sagot dyan? Kapag magnitude, ang hanapin mo, new. Mga bagong case. Okay, new. Ano siya? Yan yung incidence rate. Letter boy. Ano yung prevalence rate? Ano yung prevalence rate? Prevalence rate. Old and new, all cases. Okay, all cases. Paano nyo matatandaan yan? Okay, paano nyo matatandaan? Kapag prevalence, okay, pag prevalence, AL, all cases. Kapag incidence, new cases. Para matandaan nyo lang. Again, kapag prevalence, letter AL, all cases. Kapag incidence, letter N, new cases. Okay? Sabi sa akin pag next na. Next na. Okay? In cases like epidemics, it is necessary for the nurse to be able to call to action and mobilize the community towards, ano kaya yan? Paano mo malalaman kapag nag-action na yung community mo kapag community or individual response? Mas gusto mo syempre community, lahat sila nag-respond. Letter apple. Letter apple. Situation, the Good Shepherd Parish Church in Las Piñas City initiated a parish-led 5-year community health and development project. Community diagnosis needed to be able its parish public health nurse prepare the necessary community health nursing care plans and programs which would be responsive to the needs of the parishioners and various communities. To realize all this collaborative work is necessary. As parish community health nurse, working volunteer, RNs, and affiliate, you will assess community and environment characteristics. Which of the following pertains to your environmental characteristics? Number 1, environmental po ba? Yes or no? Number 1, no, more of ano yan? Socio-political. Diba? More of socio-political yan. Number 2, occupation, unemployment status, and poverty level. Socio-economic yan. Okay, socio-economic and characteristics. Number 3, air, water, noise pollution. Yes. So, X agad yung lahat ng wala number 3. Letter C. (37) A step in the development of community health plan that answers the question, what health problems, health threats, and health deficits exist and how community copes with these health problems is referred to as, anong ginagawa mo pag ganyan? Nag-gather ka ba ng information? Nag-gather ka information, yes or no? Nag-gather ka pa na ba ng information? Yes. So ano siya? Assessment? Yes, assessment pa lang siya. Letter apple. Okay, assessment. Hindi ka pa nag-implement, nag-gather ka pa lang ng information. Letter apple. Collaboration is strengthened by the parish health team with the city health department and various health centers of the city's stool examination day were conducted where majority of the children were found to have ascaris. Ascaris, sakit na po ba? Yes or no? Kapag may ascaris, sakit na siya? Which among the following community health nursing diagnosis will guide the nurse in setting strategies to address the problems? Ano ba yung mga first level of assessment mo? Ano muna yung mga first level of assessment? Ano yung number 1? Presence of, ano kayo una? Wellness condition, di ba? Ano yung number 2? Ano yung number 2? That is your presence of your health threat. Very good. Ano yung number 3? Health deficit. Ano yung number 4? That is your foreseeable crisis or stress points. Kapag wellness condition, sabihin niya parang readiness, health education. Kapag health threat, ano ba yung sabihin ng health threat? Para any situation siya conducive for ano? Conducive for the development of the disease. For disease na lang. Yan. Ang health deficit, ito may sakit ka na kagad. Sakit ka na. May sakit. Ang foreseeable crisis, ito yung mga kadalasan yung developmental milestones. Ano mga example ng mga foreseeable crisis? Ano yung mga common? Ano yung mga common? Marriage, o kaya papasok na sa school yung bata, ano pa, namatayan, yan yung mga pregnancy, very good, yan yung mga common. O may ASCARI siya, ano siya? Health threat, health deficit, foreseeable crisis. Deficit, letter dog. Letter dog. Number 39. The following nursing interventions address the health problem of parasitism except nursing intervention. So priority mo ba independent or dependent? Independent or dependent? Independent. Number 1, independent, number 1. Ay letter apple. Independent. Letter C, treat patients with both broad spectrum antihelmintics, independent, dependent. Dependent yan. So ang tamang sagot mo ay letter C. 'Di ba? Letter boy kasi independent din yan. Letter dog is also an independent din siya. So mag-go ka na sa letter C. Evaluating the nursing care given, which of the following vital statistics in the community indicates best health status? Ano kayong tamang sagot dyan? Letter? No, kaya letter A, infant mortality rate. Okay, infant mortality rate. Ano po ba ang crude death rate? Kadalasan ang crude death rate, titingnan mo kung may decrease in population. Okay? It is a measurement of one mortality that may result for your decrease in population. Ano natin to? Ito na lang. Ayan. Ang Swarup Index, anong Swarup's Index? Anong Swarup's? Anong Swarup's? Longevity. Ito siya. Ilang taon? 50. Okay? Ano yung crude birth rate? Ano ang crude birth rate? Ano kaya ang crude birth rate? Ito yung increase in population. Okay? Yan lang siya. Sige, catch up muna yung mga person. Sabihin sa akin pag next na. Next na. Okay. Next. You are a public health nurse of Barangay Legazpi. You have just finished implementing the program for the identified community health problems last month. You are now preparing to check if target goals and objectives were met. The following questions apply. Evaluation involves which of the following process except, ibig sabihin hinahanap mo yung maling sagot. Anong tamang sagot kaya dito? Letter A, exploration. Kasi ang evaluation mo involves these two processes, your observation and your measurement. Again, it involves your observation and your measurement. Okay? Yan po ang evaluation mo. Letter B and C po. Okay? The correct answer is letter apple. Next. Which of the following phases of the proceed model correspond to the evaluation if the objectives and sub-objectives have been met? That is your letter boy. Impact evaluation. Kapag process evaluation, anong monitor mo? Kapag process evaluation, anong monitor mo? Ito yung mga activities. Okay, ito yung mga activities. Kapag outcome evaluation, anong monitor mo? Ano monitor mo? Yung? Hala. Wait lang, mute na. Ayaw. Yan, na-mute ko na. Ito, hinahanap natin yung goal. Wait lang. Wait lang ha. Hinahanap natin goal or the long-term effects. Ayan. Okay? Yan lang siya. Itong tatlo yung kadalasan. Process, impact, and outcome evaluation. Next. Which of the following is evaluated by outcome evaluation? Sinabi natin. Ito, anong tamang sagot? Letter? Apple. Goal. Goal. Ay, pabalik. Next. Goal. Wala pong effect. Kadalasan lang po process, impact, and outcome evaluation. Dito na tayo. Which of the following evaluation indicators is described by the statement, what exists is actually within reach of those who need that, who need them? Sabihin noon, anong tamang sagot dyan? Sabihin yan, access. No? Meron ka bang accessibility? Letter apple. Ano yung efficiency? Ang efficiency po, ito siya. Wait lang. Whether the resources, ito siya, lagay na natin. Whether the resources and activities are put to use and to achieve the activity, the objectives. Yung coverage mo, what proportion of those who need something are actually receiving it? Lagay natin. Yan. Ang effort mo, ito siya. Effort, how much, and what is being invested in order to achieve the objectives. Ay, charon, ayaw na mag-cap. Ito. Yan. Next na po. Sabihin ko pag next na. Next. Ay, shortcut ng next. Oh, what is the ultimate goal of community health nursing? Anong ultimate goal nyo? What's your ultimate goal? Letter? Ano? Ano kaya ang goal nyo? Letter? Apple. Competence. Ang self-actualization sa ano yan? Hierarchy of Maslow. Maslow's yan. Maslow's yan. Di ba? Maslow's yan. Ang gusto mo, competence. Okay, community competence. Sabihin nito, kaya nila mag-stand on their own. Self-reliant sila. Okay, self-reliant. Your community self-actualization, kay Maslow's yan. Nalito, kay Maslow's yung ano, self-actualization. Okay? Letter Apple. Letter Apple. Nurse Isa is caring for the Maizo family and is currently doing his first level assessment of the family's nursing problems. Mrs. Maizo was looking at the chance of having baby for the incoming year. Nurse Isa knows that if Mrs. Maizo becomes pregnant, the family will have what type of family health problem? Sinabi na natin to, pag Juntis, ano ka? Anong level of assessment yan? Stress point. Diba? Sakit po ba ang pagbubuntis? Yes or no? Sakit po ba ang pagbubuntis? No, hindi yan sakit ang pagbubuntis. Okay? Mrs. Maizo gave birth to a baby girl named Dina. It was the second child of the family and all of the couple's attention was focused on their offspring. Denden, who's the elder sister of Dina, is becoming jealous of her. This was noted by Mrs. Maizo and she asked the best advice of the nurse. As a nurse, what would be the most appropriate nursing interventions for this scenario? Letter Apple. Maganda ba yan? Maganda ba yan? No, kasi di mo na-address. Diba? Pamphlet. Sobrang passive. Letter Boy. Advise Miss Maizo to reprimand. Ano to? Si Denden to. Of her bad attitude. Siyempre hindi rin. Letter Dog. Create a plan that would address the jealousy of Denden together with Mr. and Mrs. Maizo. Letter Dog. 46. Screen cap ba yung 46? Oh, yan na. D. 47. 48. Pwede 48 na. Pwede na mag 48. Go. Mr. Maizo, who is 20 pack years of smoker, approached Nurse Isa and told him that he was diagnosed by the pulmonologist with chronic cough syndrome. Knowing the pathophysiology of the chronic cough syndrome, Nurse Isa knows that the disease is chronic in nature. Given the situation, what type of health problem is the family experiencing? Again, may sakit po ba si Sir? Yes or no? May sakit ba siya? May sakit? Yes. Kapag may sakit, that is health deficit. Okay, that is health deficit. Paano kunwari ano lang? Ang tawag dito, nakatanggal to. Smoker lang siya. Ano siya? Pag smoker lang, health threat. Health threat. Very good. Okay? Mrs. Maizo does not want to have any immunization of her youngest daughter, Dina, because then it experienced adverse drug reaction after pentavalent vaccine. This problem can be noted as what type of the family problem? Conducive ba yan sa sakit kapag hindi ka na-immunize? Yes or no? Conducive ba siya? Yes. So ano siya? Hindi siya, fortune, hindi siya wellness state. It is your letter, Dog. Health threat. Paano siya magiging wellness state? Kapag nagtatanong si Mrs. Maizo kung para saan yung immunization. Diba? Pag nagtatanong siya, yan yung example niyan ng wellness state. Kaya nagpapag-guide siya kung anong gagawin kapag nagpa-immune, pag nagpa-vaccine si Dina. That is a wellness state. The following is the best way to measure the skill of Mrs. Maizo in caring for her new infant. Ano kayang pinakamaganda kapag adult? Pinakamaganda assessment kapag adult, return demonstration. Okay, return demonstration. Ano kayang pinakamaganda return demo dyan? Letter A or D? Letter Apple. Charot. Demonstrating how to hold her new infant. Letter Apple. Number. Charot. Situation, documentation, and management of the patient's records are two important tasks of the nurse. Nurse Caitlin should be aware that she should always complete the documentation. The following questions apply. During the interview of the patient, Nurse Caitlin observed that the patient suddenly curled up and moans due to pain. After a while, history revealed that the pain occurs about an hour after taking black coffee without breakfast, and it has been occurring for the 3 weeks now. This is recorded as letter Apple. Ano nagpamali sa Apple? Ano nagpamali kay Apple? Ano kayo nagpamali kay Apple? Yung presence ng ano kaya? Analgesic kasi nagdagdag ka. Okay, nagdagdag ka. After drinking coffee, the client experienced severe abdominal pain. Ano nagpamali dyan sa letter boy? Severe. Diba? Severe. Wala din naman nakalagay na may severe abdominal pain siya. Client complained of an intermittent abdominal pain an hour after drinking coffee. Ano nagpamali dyan? Intermittent, di ba? Nag-intermittent. The correct answer is letter dog. Letter dog. 52. Which of the following entries in the nurse's note is most appropriate? Ano kaya yung pinaka-appropriate dyan? Letter dog. Bakit mali yung letter apple? Ba't mali yung letter apple? Ba't kaya mali yung letter apple? True. Diba? Chronological yan dapat. Clear breath sound siya. Clear breath sound siya pero nag-suction ka. Diba? Nag-suction ka ng clear breath sounds. Eh, chronological yan. Kung ano yung una mong sinabi, yun yung una mong ginawa. Okay? Kaya siya mali. Okay? Large black hematoma noted on the right arm. Ano mali dito sa letter boy? Yung ano kaya nagpamali sa letter boy? Large kasi hindi siya quantifiable, hindi siya measurable. Letter C, ano nagpamali dyan? Seems like. Kasi para ka bang hindi sure sa assessment mo, yes or no? Para ka hindi sure. Yes. Okay, parang hindi ka sure. Nurse Caitlin is writing down her progress notes. Should the recording mistake occur, which of the following should he do? Ano kayong tamang sagot dyan? Pwede ka gumamit ng pencil. Pencil? Pwede ka ba gumamit ng lead pencil sa documentation mo? No, that is a legal document. Kaya dapat permanent ink. Multiple lines? No. Okay? So you would go for letter C or D. The best answer is letter C. Draw a single line. Through it and write his initials or name above the near or near the line. Okay? Letter C. #54. Dr. Sanchez made a telephone order for patient molded due to sudden pulmonary embolism. Yeah, pwede din naman, but mas maganda yung letter, mas best answer yung letter C. Okay, letter C. Nurse Caitlin should do which of the following when receiving telephone orders? Saan ba nilalagay yung ano? Order. Sa Cardex po ba nilalagay? Sa Cardex po ba nilalagay? No. Okay, pero ang tinanap mo kasi except, saan ba nilalagay yung order? Sa medical order sheet. So mali agad to. Mali agad to. Okay? Ask the prescriber to speak slowly. Yes. Diba? Yes yan. Kailangan slowly siya. Read the order back. Read the order back to the prescriber using the abbreviation which he used. Dapat ba may abbreviations kapag nagte-telephone order ka? Dapat po ba may... No. Okay? So the correct answer is letter boy. Okay? Boy. Ay, charot. Sorry. Oh. 55. Nurse Katie decided to call Dr. Zarasme due to patient Madag who suddenly collapsed. Which of the following should avoid when giving telephone report? Ano kaya dyan? Include the client's name and medical diagnosis. Yes. Okay, yes yan. Okay, specify that the nurse would like to the attending physician to come and assess the client. Yes, kaya ka nga po tumatawag eh. Kasi something emergency ang nangyari. Okay? Inform the physician of the pertinent changes in the patient's baseline data. Yes. So the correct answer is letter boy. Bakit kaya mali yung letter boy? Ano kaya nagpamali kay letter boy? Ano kaya mali? Nagpamali kay letter boy kasi nagbigin ka mag-report pagkatawag mo pa lang nagsabi ka na ng complaint. Eh di ba dapat pagkatawag mo, introduce yourself, tapos identifier si patient, 'di ba? Identifier si patient kaya letter boy. Okay, letter boy. 54 po is letter boy. Yeah. A physician orders 2,000 ml of D5-NSS to infuse over 12 hours. The drop factor is 15 drops per ml. Nurse Likey sets the flow rate at how many drops per minute? Letter apple. May nalilito ba dito? May nalilito? May nalilito? Okay. So, paano po ba kino-compute yan? Paano kino-compute? Okay. Una muna, total volume divided by ano siya ni-divide? Number of hours times ilang minutes sa isang oras? 60. That is constant. Okay? Hours times 60. Constant yan. Times, saan mo siya i-multiply? Sa drop factor. Drop factor mo siya i-multiply. Kaya mangyari dyan, 2,000 ml divided by number of hours, which is 12 times 60. Ano yung drop factor mo? 15. Yan. Okay, so mangyari dyan, higing 2,000 ml divided by 720 times 15 is equal to, so divided muna yung 2,000. 2,000 divided by 720. Okay, may nagtanong saan daw sinusulat ang tawag yun, saan sinusulat yung telephone order? Sa medical order sheet. Okay, sa medical order sheet siya susulat. Okay? So lalabas dyan ay 2.778 times 15 is equal to 41.67. So round off muna siya kaya siya naging 42 drops per minute. Letter apple. Okay? Last year daw, board exam, ganyan ang tanong sa board exam. Drop factor lang. Last November, ganun daw yung tanong sa board exam. Somehow ganyan. Drop factor. Okay, so nyo muna mag-lunch break muna. Lunch break muna. Lunch break bago tayo mag-proceed. Lunch break? Yes? No? O, lunch break muna. For 1 hour. Balik kayo ng 1. Okay, balik kayo ng 1. Thank you. Pag may mga tanong, ano nyo dito? Sampal nyo dito. Sasagutin ko naman kayo. Okay? Pag may tanong, sampal lang yung tanong, sasagutin naman. Thank you so much. Have a good night. Good lunch. Enjoy your meal. Hello, kamusta? Kamusta mga people? Naantok 'no? For sure inaantok 'yon mga 'yan. Good afternoon, kamusta? Anong mga lunch niyo? Ano yung mga lunch niyo? Naantok? Tinola, sinigang, wow, sana all. Si Yes si ano, hindi ko ang pangalan, si Yes na Yes for ay driving? Driving ka ngayon, grabe. Stay safe. Good afternoon. Sige, start tayo ng 1:05 kasi sure ako madaming late. Okay, bulalong, yaman. Nagra-rice ba kayo? Adobo. I suggest habang ay caviar, yaman 'yan. Pa-caviar pa siya. Pa-caviar pa si bakla, yaman 'yan. Yaman. Samgyup, wow. I suggest ngayong nagbo-board exam kayo, wag kayo masyadong mag-diet. Yeah. Parang i-spoil yung nasa Wolfgang. Sana all, 'di ba? Ako nga lunch ko pakbet, no rice. 1:05 start na tayo. So for sure madami late, tingnan mo diyan pala tumataas yung number, oh. Alam ko na 'yan. Nagbabawas lang kasi ang taba ko na. Nagbabawas lang ako. Jerome Ponce, kamukha ko daw sa Jerome Ponce, sure ka ba diyan? Nasa duty. Alam niyo sobrang bilib ako sa mga taong nag nagwo-work habang nagre-review. Yeah. Coffee or tea? I'll go for coffee. Coffee ako ngayon. Black coffee to be specific. Pag tea, chai tea. Di ko alam kung meron na nahilig dito sa chai tea. Juan Ponce, grabe ka naman. Mukha ba akong matanda? Mukha ba akong matanda itsura ko? Grabe ka naman. Hoy, hindi naman. Mukha bang matanda yung mukha ko? Seryoso ba? Mukha ba akong matanda? Hoy, grabe naman sa Sian Gasa. Grabe naman. Mukha akong matanda? Seryoso? Grabe. Napakabata na nga ako. Ano gagawin ko? Hoy, hindi ko kamukha. Si Poca yung 'di ba? Study routine ba? O sige. Si Bam Aquino, alam niyo ba na napagkamalan akong kamag-anak ng mga Aquino dati. Yeah. Sa Manila Memorial Park kami noon. Tapos, oo nga, nasa Manila Memorial Park kami noon sa may Parañaque. Tapos tinignan na namin yung yung puntod nila Cory Aquino. Tapos meron bigla sa akin, pa-picture daw. Pa-picture daw. Sabi ko, bakit? Akala ko, pipicturean ko. Yung pala, magpapapicture sila sa akin. Uy, grabe naman si Bimbi, hindi naman. Wala ko sa'yo. Skincare reveal kapag maaga tayo natapos. Pag maaga tayo natapos. Char, may skincare reveal pa. Habang makinis sa mukha ko, hindi yan makinis. Filter lang yan. Pero dati noon, parang last month ata, February ata yon. Hindi ako belo. Last month, last kwento ko na last month yun. May student ako na hired sa hospital kung saan ako nag-work. Tapos bigla sabi niya sa akin, "Sir, makinis ka pala. Akala ko filter lang." Grabe naman. As in sabi niya, "Sir, makinis ka pala sa personal. Akala ko filter lang yung ginagawa mo kaya ka makinis." Hindi pa ako Chinese. Hindi pa ako Chinese. Grabe naman, kamukha ko pa yung ex mo. So galit ka sa akin. Pagkamukha. Galit ka sa sabi niya, "Sir, kamukha mo ex ko." So galit ka sa akin. Siguro kinamumuhian mo na ako. Okay na, let's start na. Kamukha mo yung baby ko. Ano, mukha kong bata? Di lahat ng kamukha ko. Send yung mga pictures ng mga kamukha ko. Pag hindi ko kamukha, batok sa mukha. Pag hindi ko kamukha, kayo yung magja-judge. Kapag kamukha ko, babatukan. Pag hindi ko kamukha, babatukan ko yung mukha mo. Sama. Situation. Middle East respiratory syndrome is a viral respiratory disease caused by a novel coronavirus that was first identified in Saudi Arabia. Kanina nga sabi, kamukha ko daw si Luis Manzano. Yung may picture si Luis Manzano, sinend sa akin. Okay, the clinical spectrum of MERS-CoV can include all of the following except, ano po ba yung ano? Your MERS-CoV has a wide clinical spectrum. Okay, pwede siya mag-range from asymptomatic. So check na to agad. Pwede siya mag-cause ng severe acute respiratory disease. Check na to agad. And pwede din siya mag-cause ng mild respiratory symptoms. Okay? Pwede din siya umabot sa septic shock. Okay? Pwede din siya umabot sa septic shock. The correct answer is letter dog. Okay? Pwede mag-respiratory failure ang patient mo dyan. Respiratory failure. Pwede mag-septic shock. At pwede magkaroon ng multi-organ failure. Yan. Okay? Yan yung mga pwedeng manifestations or pwede maging kahinatnan ng isang taong may MERS-CoV po. Okay po? Uy, tapos na tayo sa 55, 56, doy. 55 letter boy, 56 letter apple. Okay? Next. The said novel coronavirus is believed to originate from what animal? Saan daw nanggaling ang MERS-CoV? Sa direct answer is letter boy. Camels. Okay, sa camel po, according to the WHO, MERS-CoV is a zoonotic virus, meaning it is transmitted from between the animals and people. MERS-CoV has been identified and linked to the human infections in dromedary camels in several member states of Middle East, Africa, and South Asia. Letter boy. Okay. Which of the following client bears the most risk of acquiring severe disease if infected by MERS-CoV? Okay, kapag ganyan, tanggalin mo na yung ano, yung mga kailangan i-identify mo na dito healthy sa unhealthy. Okay, letter apple, pwede to, pwede siya. Letter boy, X agad yan kasi wala naman din sinabi. 'Di ba? Walang sinabi diyan. X agad to. Okay, pregnancy pwede siya. Pero yung MERS-CoV is linked kadalasan niya sa mga severe diseases kapag merong mga chronic diseases. Okay, kapag may mga chronic diseases ka, prone ka for your severe disease, severe form of your MERS-CoV. Yan. Ay, severe form of your MERS-CoV. Ano ba yung mga chronic diseases na most probably DM, cancer, chronic lung diseases, ano pa? Pwede pa yan magkaroon sa hypertension, cardiovascular diseases. Yan. Okay, bakit sir hindi yung letter apple? Kasi take note of the word history po. Okay, history lang siya. Okay, history lang po. Kaya siya nagpamali dyan. So the best answer is letter dog. Pregnancy, hindi rin to. Okay, hindi rin to. Hindi naman siya sakit eh. Hindi naman siya chronic disease. Okay, so letter dog. Next. Charot. Typical findings in patient infected with MERS-CoV include which of the following? Okay? Ano kaya dyan? Anong tamang sagot dyan? Kapag viral, di ba kadalasan ang MERS-CoV kinakonsider siya as flu? So, pwedeng letter apple, cough. Ano pa yung pwedeng manifestation? Fever, cough, and shortness of breath. Yan siya. Okay? Letter apple. $59, letter dog. Letter dog. Dito tayo. Your relative is currently working as an OFW in the United Arab Emirates called you and asked how he can prevent acquiring the infection. You are correct by instructing him to do the following except, may except na naman. Oh. Practice general hygiene measures before and after touching animals like camel. Yes. Avoid close contact with potential sick individuals. Yes. Ensure that animal products are cooked thoroughly. Yes. May vaccine po ba sa virus? Sa MERS-CoV? Yes or no? May vaccine na po ba sa MERS-CoV? May vaccine na ba sa MERS-CoV? Wala. Wala pa. Let's see. Let's see. Ano yung BPSU? Hindi ko alam yung Bataan? Peninsula State University? Ano yung BPSU? Bataan Peninsula State University. Okay. The Aquino administration initiated Pantawid Pamilyang Filipino program or commonly called 4Ps. Ay, ang haba naman ng school mo. Pangasinan, Payambang, Campus State. Ang haba ng school mo naman. At its flag, saan ako nag-school? Poverty Television Program, University of the Philippines po. UP Manila po ako nag-aral. Okay? Which of these government agencies is our partners in enrolling beneficiaries from different state universities and colleges? Ano pong tamang sagot dyan? Letter, dog, all of the above. Your Philippine Association of State University and Colleges, Department of Labor and Employment. Maling situation nyo. And Commission on Higher Education. Okay. Letter, dog. Which of these programs is not included in the 4Ps? 61 po is letter C. Ano kaya dyan? So your 4Ps po include your social development, breaking the lagay natin. Social development, breaking the intergenerational poverty cycle, yan ang ano mo, paano siya? By having your health checkups for preggies, children, check up. Lagyan natin dito. Ay. Check up ng PDEA. The worming. Yan yung mga common programs. The worming. Enrollment of children. Family development session. Wait lang. Yan. Okay. So, correct answer dito is letter dog. None of the above. None of the above. Okay, none of the above. O, screen cap nyo muna. Ano mas preferred nyo? Face-to-face or online class? F to F. Bakit? Anong nangyari kapag Kapag tulog lang kayo, no? Kapag online. Umamin kayo, tulog. Madi-distract. Okay. Pabalik. Oh, sorry na. Talaga itong mga to, oo. O last one na 61. Family development sessions, for example, family planning, ano pa ba? Marriage counseling, yan yung mga example ng family development sessions. Okay? Talaga kayo. Ay, charot. Joke lang. Mukha ako masungit, no? Pero hindi talaga ako masungit. Mukha ba ako masungit? Mukha ba ako masungit? Okay na, let's go na. Hindi ko, hindi. Hindi ako masungit. Oh, how often are deworming pills given to the children age 6 to 14? Oh, every 6 months daw binibigay ang deworming pills. Mukhang mabango, hindi tayo sure kung mabango ako. Joke lang. Anong tamang sagot kapag every 6 months? Twice a year. Letter C. Letter C. Okay. Letter C. Actually, true. Well, hindi ko pa kasi natatry yung face-to-face na lecture. Nasa online lang ako nag-settle. Okay? To be able to receive the subsidies of 4 Ps, which among these not part of condition that should be met by the household beneficiaries. Okay? Dapat naka-attend siya ng family development session, sinabi natin to. Dapat naka-attend siya sa school, sinabi natin to. Tsaka nakapag-check up. Bakit mali si letter boy? Faith healer. Faith healer, 'di ba? Ayaw natin ng faith healer. Kailangan medical practitioner ang attend. Huy, ang layo ng Baguio. Tingnan natin kung kaya. Pero ang layo kasi ng Baguio. Nag-work pa po ako. Pero try natin. Tingnan natin kung pwede. Pag pre-boards. Pag pre-boards, tingnan natin. Taga Laguna. Pero nagsistay po ako sa Manila. Tapos nag-work ako sa Makati. Diba? Rona, G1T1 is on her second day postpartum day. She asked Nurse Maha about definition of exclusive breastfeeding. Nurse Maha responds based on his knowledge that exclusive breastfeeding means, alam ko nang mali po yung nasa choices nyo dito. Alam ko na po. Ano pong tamang sagot dyan? Kapag exclusive breastfeeding, pwede po ba ng water? Yes or no? Water. Pwede po ba? Water intake kapag exclusive breastfeeding? No. Matic X yan. Ayaw natin. Kapala natin. No, ito X. Solid food pwede. Solid food. Exclusive breastfeeding? No. Gamot. Gamot. Vitamins. Ba't hindi pwede ng vitamins? Pwede ng vitamins or hindi? Hindi. Kasi naniniwala tayo na enough na ba yung breast milk for the first 6 months? Hindi ma-dehydrate yung baby. Hindi siya enough na yung vitamins and minerals na nakukuha niya kay mommy. Yes or no? Yes. Diba? Enough na yun for the first 6 months. So letter boy. Letter boy. Next, immunization for different diseases are important for healthcare workers who are frequently exposed to different patients and environments. Pre-exposure vaccination for rabies consists of how many doses? Ilang doses? Letter A. Okay, day 0. Okay, day 0 mo siya ibibigay. Day 7, day 21, or day 28. Yan. Yan siya. Next na po ba? Pag post, mamaya nandun yung sa post. Nandun dito yun. Okay? Pag post nandito. Okay? Next. Diba? Nandito yun. Student nurse. Pag nagkasakit si baby, syempre special, other instance na yun. Di ba? Pag nagkasakit si baby, tapos, kumari, it would require antibiotic kay baby, pwede na yun. Okay? Pwede na yun. Magbigay. Kasi kailangan na yan other, extraordinary measures. Okay? Pwede na yun. Pero we want to promote exclusive breastfeeding. Kumari, total healthy naman yung baby mo. Okay? Totally healthy yung baby mo. Exclusive breastfeeding ka. Pero kung nagkasakit si baby, special instance na yun. Pwede ka na magbigay ng gamot. Student nurse Nicole was doing ocular survey in barangay Loma when a dog suddenly attacked her and beat her. Maria's school records show she had a complete prophylaxis for rabies. How many doses of rabies vaccine does she expect to be given to her after her bite? Ang tamang sagot kaya dyan? Letter C. Letter C. 2 doses. Okay, kasi nagkaroon na siya ng prophylaxis. Nagkaroon siya ng prophylaxis. So kapag wala, letter dog. Pag wala, letter dog. Okay, letter dog kapag wala. Kung post ka na. Okay, wala. Okay? May nagtatanong pa niyan, intradermal po ba sir or intramuscular? It would, kadalasan kung mag-aano ka ng cost effectiveness, intradermal. Okay, intradermal yan kapag cost effective ang gusto mo. Pero there are other institutions that will give intramuscular injection. Okay, intramuscular injection. May mga hospital na nagpapa-intramuscular. Okay? Move forward na po ba ako? Yeah, ID na ang bago ngayon kasi cost effective siya. Mas madami kang magagamit doon sa vial. Pero may mga iba pa din. Baka kasi may magtatanong, sir, ako po IM injection po yung binigay sa akin. May mga ibang hospital pa din po nag-IM injection. Okay? Lalo na kung hindi naman siya mass, kung baga hindi siya pang lahat, kung isang dose lang sa'yo for the day, most probably IM injection na bibigay sa'yo para hindi masayang yung rabies vaccine. Which of these vaccines are not given orally? Ano kaya dyan? Letter? Apple. MMR. Diba? Paano binibigay ba ang MMR? Paano binibigay MMR? Subcutaneous. Ilang ml? Ilang ml? 0.5. Very good. Ang polio, rota, and cholera vaccine, yan yung binibigay orally. Okay? Ganyan yung mga tanong sa board exam, promise, ganyan. Okay, anong dose ng MMR vaccine? Ganun lang siya, promise. Medyo malilito ka talaga. Okay? All of the following vaccines except one are examples of life attenuated vaccine. Choose the exception. Okay? Ibig sabihin niya, take note mo, all but one. Sabihin, hinahanap mo tamang sagot. Pero ito-choose mo yung exception, nahanapin mo yung mali. Gets nyo ba? Gets nyo yung or nalito? Pag ganyan, all of the following except. So, hinahanap mo yung maling sagot. Choose the exception. So, tamang sagot ang hahanapin mo dyan. Tamang sagot dyan, letter dog, tetanus. Ang tetanus ay ano? Ano kaya ang tetanus? Toxoid. Very good. Oy. Or inactivated. Toxic. Yan. Next. In administering BCG to a neonate, how should the nurse, Nicole, withdraw from the vial? Ilang ml? Letter C, 0.05 ml. Saan siya binibigay? Saan, anong route muna? Anong route po? ID, saan? Saan sa usual binibigay? Saan parte ng katawan siya binibigay kadalasan? Deltoid. Right or left? Right or left? Right. Right po. Kailangan po ba magkakaroon ng scar? Kailangan po ba magkakaroon ng scar? Yes. Paano pag walang scar? Paano pag wala kang scar? Ulit sa left. Sa left na. Okay? So may magtatanong ulit yan, sir, wala po ako sa right and left. May magtatanong yan for sure. Wala po ako sa right and left. Wala. Sa puwet siya ilalagay. True yan. Sa puwet nga ilalagay. Sa puwet siya nilalagay. Ano daw kasi aesthetic? Tinanong ko na yan. Bakit, sir? Tinanong ko yan sa doktor. Parang nagtaka kasi ako kasi nagbibigay ng BCG vaccine sa amin. Sa neonate. Tapos sa puwet nilalagay. Aesthetic daw kasi. Para daw hindi daw pangit tingnan. Remember dito sa puwet na nilagay. Being the staunch leader in the health. Sa daughter. Diba? In the meron. O, tinan mo. Meron na nagbo-board exam sa puwet na nilagay. Ako dito pa. The Department of Health developed numerous health programs over the years. The programs adjust the leading health populations or conditions of different population. Various nutritional programs are implemented for reduction in the common nutritional deficiencies present in the country. Most programs are structured to address the deficiencies in these nutrients, namely vitamin A. Yes or no? Vitamin A? Yes. So, X to. Iron. Iron po, iron. Yes. Vitamin C. Vitamin C? No. So, X to. Tsaka iodine. Ang protein ba? Kailangan ng protein? No. Anong kulang dyan? Anong kulang dyan? Ang kulang dyan, folic acid. Okay, folic acid po. Very good. Okay. Next. Ay, baka hanapin nyo. Screen cap nyo na. Oh, delete ko na. Macronutrient supplementation of vitamin A aids infants and children in their growth and development. How much vitamin A should be given to a 7-month-old infant? Ano kaya yan? Letter? Ano? Ano kaya? Letter? Dog. Letter dog. 100,000 IU for 1 dose only. Okay? A dose of 100,000 IU in infant 6 to 11 months age is given. Letter dog. Letter dog po. 74. When should the pregnant mother should take a vitamin A supplements? Question, vitamin A, teratogenic, yes or no? Teratogenic po ba ang vitamin A? Yes or no? Teratogenic po siya. So, bibigay mo ba siya sa ano? First month, yes or no? No. Okay? So, wag mo siyang bibigay sa first trimester. So, bigay mo siya in the 4th month. Okay? During the 4th month of pregnancy. Letter boy. Okay, letter boy. Second trimester mo na siya ibigay. Okay? Go lang. Go lang. If you have class, hindi naman ako nasasaktan. Ay, hindi mo ako nasasaktan. Hindi man ako na ano. Go lang. If you have other class, go lang po. Okay? In providing teachings to the livelihood residents and mothers of a barangay in Cavite, you explain to them that Sangkap Pinoy still means that the food is ano? Kapag may Sangkap Pinoy meals, ano meron siya? Fortified siya ng vitamin A or iron or both. Okay? Letter boy. Ano yung mga common na may Sangkap Pinoy seal? Ano yung mga common ng ano pagkain na may ganon? Yung oil chips. Pansit Canton, yung mga pansit Canton meron yan. 'Di ba? Yan, letter boy. City at charge nurse of the pediatric ward. She is handling 45 patients for the morning shift with 3 RNs and 2 nursing attendants and 1 ward clerk. Grabe gutom, may cracklings, may pillows. Gutom yan. Okay, the staff are able to wish off their schedule with CT, thereby their motivation to please her all the time. What is the primary source of power over the others in the unit? Okay, wishing. So, nagre-reward ba to? Yes. Ano yung coercive power? Ano yung coercive power? Anong coercive power? More of punishment or force, by force siya, di ba? Ano yung informational power? Knowledge. Knowledge. Okay, expert. An expert. Skills. And what? Experience. Ano pa yung mga other? Ano pa yung mga others? Ito na siya. Ito pa yung iba. Yan. Pwedeng legitimate, means may possession. Coercive, may fear. Expert means skills and experience. Informational means knowledge. Reward, ito yung mga raise, promotion, and awards. Connection power, ito yung may network skills ka. For example, ako, for example, friend ko si Sir V. O, tas may friend din ako na Dean. May friend din ako na ganyan. I have my connection power kasi kakilala ko yung mga sikat na tao or like matataas na tao. That is connection power. Sabihin niyo sa akin kapag next na po. Next na. Annually, CT, ano to, assist the unit's head nurse after budgeting. This activity is under what management? Kapag nagbabudget ka, nagpa-plan ka ba? Nasa planning phase ka po ba? Yes. Yes. Letter, ay charot. Sorry na. Letter apple. Letter apple. In the ward, the staff work as a team. CT is responsible for carrying out the orders of the doctor, while each of the nurses are assigned to feed and bathe the patients, administer the due medications and therapeutics, and monitor vital signs and fluid infusions. What nursing delivery system is utilized in the unit? Ano kaya yan? Letter 77, letter apple, letter C. Functional nursing. 'Di ba? Meron yan. For example, ako si medication nurse. Siya yung feeding nurse. Siya yung vital signs. Okay? Sa lahat ng patient yan. Ang modular, ito yung geographical. Ano yung sabihin nito? Ito yung mga yan yung may mga district staff. Ito yung may mga district. For example, District 1, sa'yo lang yan. Regardless kung meron kang admission, sa'yo lang yan. Okay? Team nursing, ito yung may team leader kayo. Meron si charge nurse dito. Si charge nurse, siya yung kilala niya lahat ng patient. Okay? Tapos, meron dito yung mga bedside nurses. Si bedside nurses, sila yung nag-handle ng mga patient. Okay? Si primary nursing, anong tatandaan lang kapag primary nursing? Ano kaya tatandaan kapag primary nursing? Yes, 24 hours from the time na na-admit yung patient mo to discharge. Okay, from admission to discharge. Pinaka-common. Ang pinaka-common ng alam, depende kasi. For example, sa amin sa hospital ko, team nursing kami. Sa Asian Hospital, yung sister ko kasi taga-Asian, ano sila? Primary nursing sila. Okay, admission to this, sila? Sariling carry out ka. Primary nursing din kasi yung sariling carry out. Kumbaga, sa'yo lang yung patient mo the whole day. It would depend. It would depend siya. Okay? It would depend. May mga advantages and disadvantages per type ng nursing. A new protocol for administering tube feedings among units is introduced in the unit. The staff are having problems in the implementation. What is CT's first action? Ano kaya yung pinakamagandang gawin dyan? As report from the staff nurses report, 'di ba? Mas maganda mag-call for meeting para ano mangyari? Pag-uusapan ba lahat ng tao? Yes, 'di ba? A staff meeting is to discuss issues existing. In this question, it is a new protocol in administering your tube feeding. Mas maganda pag-uusapan nila 'yan. Okay? Letter boy. 80. Which of the following statements should be avoided by CT in giving feedback to the staff after performance appraisal? Performance appraisal, confidential po ba to? Yes or no? Confidential ba ang performance appraisal? Yes, confidential siya. Pwede ba siyang pag-usapan sa meeting? No, kasi ano mangyayari? Magkakaroon ng comparison. Letter apple. At the same time, pwede mo naman pag-usapan yung improved techniques on giving medication, strengths and weaknesses i-identify din during the evaluation. Tapos, titignan doon kung ano ba yung mga weakness mo and anong pwedeng gawin mo. Okay, sa weakness mo. Okay? Letter apple. move forward na. Forward na ang person. Yes. A group of nursing students is conducting a research on medical ward of a Philippine General Hospital with the topic of the effects of nursing health teachings in the reduction of anxiety of diabetic patients undergoing limb amputation. The group advisor would most likely suggest a study to check the procedures of the research. Anong ginagawa mo dyan? Pwede ba yung preliminary studies? Yes or no? Preliminary studies? Yes. Okay, preliminary studies. Anong tamang sagot dyan? Letter? Dog. Pilot study. Okay, pilot study. Ang pre-test, ito yung mga ginagawa bago ka magbigay ng intervention. Okay, for example, kadalasan niya sa mga sa mga conferences, nagpi-pretest sila bago mag-start yung conference, nagpapasagot sila ng questions. So magkakaroon ng conference, then after ng conference may post-test kayo. Yun ang pre-test. Okay? So ano daw ang independent variable ng study na the effects of nursing health teaching in the reduction of anxiety of diabetic patients undergoing amputation. Ano ba yung independent variable? Ang independent variable, siya po ba ang cause? Cause po ba siya? Yes. Siya ba yung nagpapagalaw? Siya ba yung nagpapagalaw? Or siya ba yung nagbibigay ng movement? Yes. Okay? Siya ang cause. Diba? Anong tamang sagot dito? Letter? Letter? Apple. Nursing health teaching. Okay? Kadalasan fixed variable, hindi siya naapektuhan. Okay? Hindi siya naapektuhan. Oh, ano naman ang variables that can be measured? Ito po ba yung dependent variable? Dependent variable po ba yung mini-measure? Yes, that is the dependent variable. Or pwede ba siyang effect? Effect? Pwede ba siyang effect? Yes, siya yung effect. Siya yung mina-manipulate. Being manipulated. Okay? Ano kayang tamang sagot dyan? Letter? Apple. Reduction of anxiety. Okay, reduction of anxiety. What research design is likely to be utilized? Ano kaya? Yung, syempre may intervention. Ano ba mas gusto mo? Randomize or hindi? 82 letter apple. Mas gusto mo randomize, kaya mas gusto mo experimental. Diba? Experimental. Mas gusto mo na dun ka na sa sa highest form of your research design. Experimental. Letter dog. Letter dog. Number 85. Which of the following an example of your convenience sampling? O, letter apple, ano yan? Ano yung letter apple? Purposive. Diba? Purposive. Galing. How about your letter boy? Ano yung letter boy? Ano yung letter boy? That is your, ano kaya? Systematic sampling. Ito yung may KN. Okay? For example, paano kino-compute yan? Paano kino-compute? Sa systematic sampling, paano kino-compute yan? Kadalasan yan, ano yan? Total number of population. Divided by, ayan na pala. Hindi, ano yan eh. KN yan eh. Ano yan eh? Ano ba tong problem? Formula yan. Okay, total number of population divided by the sample size. Yan. Ay, charot. Yan. Yan siya. Yan siya. Okay? Yan yung ano niya. For every second, every third, yan siya. Okay? Ano yung letter C? Ano ang letter C? Letter C, ito yung simple random sampling. Or other term, a fishbowl method. The correct answer is letter dog, availability of subjects. Diba? Kung ano lang dyan yung meron dyan, yun na yun. Okay? Yun na yun. Delete ko na po. The case of acquired immunodeficiency syndrome in the Philippines has been rapidly increasing. Official records of the Department of Health show that the number of HIV cases rose from 709 compared to 528 recorded the previous year. Nurses have a pivotal role in educating the public to prevent an increase in occurrence of this transmittable disease. The nurse looks at the results of which laboratory measurement that provides reliable indicator of the lymphocyte status in a client with HIV infection. Ano kaya yan? Ano bang hinahanap natin dyan? Your CD4 count. Letter apple. CD4 count. Diba? Paano ba ilan ang CD4 count kapag makonsider mo siya as AIDS patient? Less than ilan? Less than 200. Okay, less than 200, pwede mo siya as AIDS patient. O kaya pag meron siyang presence ng opportunistic infection. Ano yung mga common example ng opportunistic infection? CMV, very good. PCP, pneumonia. What else? What else? Tuberculosis, pulmonary tuberculosis. Pabalik, sir. Sorry po. Pulmonary tuberculosis or pwede naman extra pulmonary tuberculosis. Candidiasis, yes. Pag fungal infection. A client who has acquired immunodeficiency syndrome asks why oral progesterone Megace is being prescribed for treatment. What is the best response? Anong tamang sagot dyan? Letter boy. Megace is used as an appetite stimulant to boost nutritional support. Ito kasi, di ba, ano bang common, kapag may AIDS, nagkakaroon ba sila ng loss of appetite? Yes or no? Loss of appetite? Yes. Wasting syndrome. Wasting syndrome. Ito yung makikita nyo, common sa mga AIDS patient, yung naggaganon yung mukha. Wasting syndrome, yes. Common ng wasting syndrome sa kanila. Okay? 88. Which one of the following suggestions by the nurse would be most helpful to immunodeficiency virus positive client who has altered taste perception? Ito, kapag hindi kayo sure sa mga sagot, pwede kayo context clues, di ba? Drink plenty of salty broth. Siyempre hindi naman, X yan. Okay? Avoid using plastics. Using plastic eating utensils. Siyempre hindi rin yan. Di ba? Avoid intake of meat to at least 1 serving per day. Di ba? Hindi rin naman. So ang best answer mo na dyan, ang pinaka-appropriate na sagot dyan, letter boy. Try zinc supplementation to improve taste perception. Letter boy. Next, which of the following suggestion would the nurse give to the client with human immunodeficiency virus to best alleviate nausea? Drink liquids with meals. Ibig sabihin nito, habang kumakain ka, inom kang tubig, mas masusuka ka ba nun? Yes or no? Mas masusuka ka ba? Yes. Eat high foods. High fat foods. Matagal ba may digest kapag high fat foods? Matagal ba may digest? Yes. Mas pwede kang masok ka dyan. Lie down after eating. Ginagawa nyo ba yan? Umamin. Ginagawa nyo ba? Lie down after eating. For sure, madami dito nakahiga ngayon. Diba? For sure, may mga nakahiga dito ngayon. Tapos maya-maya, tulog na. Diba? So the correct answer is letter C. Eat small frequent meals. Letter C. Sure yan, may mga nakahiga na dyan, tapos maya-maya tulog na sila. Mamin. Maya-maya, 5 minutes lang. 5 minutes lang ng pipikit. Tapos pagkagising, 1 hour na nakalipas. Nasa NP5 na kami. Diba? Diba? Okay. The nurse is caring for a pediatric patient or client with acquired immunodeficiency syndrome. Which activity? True, it's normal naman. Which activity by the nurse should be reported to the employee health department as an exposure for the nurse? Oh, letter boy. Bigla nag-stab sa'yo ng sterile syringe. Magkakaroon ka ba ng HIV noon? Sterile naman, B. X. Nurse does not wear mask while in the client's room. Ano po bang precaution mo kapag HIV? Contact precaution po ba? Contact precaution. Contact precaution po ba kapag HIV patient? Yes or no? No. So naka-gloves ka po ba kapag magba-blood pressure kay patient? Or magba-vital signs ka lang, naka-gloves ka ba? No. 'Di ba? Standard precautions. Kapag ma-expose ka to any body fluid, doon ba kailangan mo mag-gloves? Yes, doon ka mag-gloves kapag ma-expose ka sa body fluids. So the correct answer is letter apple. Okay, while flushing out the use of bedpan, fluid splashed in the nurse's eyes. You are beginning community health nurse in your health center. You are aware the meaningful integration is essential for you to carry out roles and functions. The following questions apply. Integration is the process of establishing rapport with the people in the community. It can be best achieved by, ano kayong tamang sagot dyan? Letter C, conversing with the people where they are participating in social activities. Grabe naman, letter B, masyado kang olirang nurse. Lilinisin mo yung bahay ng ng mga pasyente mo. Bringing some gifts. Kaya pwede ka ba magdala ng gift? Kung may intervention ka, pwede ka ba magpa-raffle? Pwede ka ba magpa-raffle? Ginawa nyo nung college siya, nagpa-raffle. Umamin. Diba? Umamin para dumami ang nandun. Sponsoring a sports festival, yaman din yan, B. Yaman. Diba? Letter C. Okay? Okay. Community organizing is an important part of the community nursing function. Given the following elements, choose an organizational structure, identifying and recruiting members, defining mission, vision, and goals, clarifying roles and responsibility. At which do these elements belong? Ano kayong tamang sagot dyan? O nag-ano ka pa lang, vision, mission ka pa lang? Letter C. O ano muna steps ng community organizing? Ano yung steps ng community organizing? Ano yung step 1? Step 1? Community organizing po, hindi po COPAR. Ito siya. Sige, bigay ko na lang sa inyo. Ito siya. Yan. Community analysis, design initiation, implementation, program and maintenance, and dissemination. Yan. Yan siya. Saan niya nakuha, sir? Sa white book po. Nasa white book to. Meron ba kayong white book? Meron kayong white book? Meron kayong white book? Aralin niyo yung white book. Sobrang, ang daming kinukuha sa white book na tanong. Yeah, may PDF na white book. May PDF na white book. Baka hindi po alam ng mga tao. Meron kang PDF ng white book. Hindi ko alam kung na-share na ng mga ibang section. Pero meron PDF ng white book. Pa-send. Send ko ba? Sige, ito na. Wala mo na mag-message sa akin. Yan na. Sending na. Okay? Next na. Yan na. Na-send na po. Nakuha nyo na ba? Yung mga white book. Aralin nyo, sobrang niyan. Sobrang dami lumalabas. Promise. Dami lumalabas sa white book. Andyan din yung mga tanong kadalasan. Yung tanong sa blood transfusion na lumabas sa board exam po, nandyan siya. Dito ko sinend. Magsabi ko, thank you po, Daddy. Dali. Sabi nyo, thank you, Daddy. Char, joke lang. Joke lang. Ay, grabe siya. Charot lang. Okay? Ay, grabe sila. Next, at which phase of the community organizing process are the leaders or groups given to development? Ay, ba't may pa-baby tayo dito? To their knowledge, skills, and attitudes in managing their own programs. Anong tamang sagot dyan? Community organizing process are the leaders given training to develop their knowledge. So nasa organizing ka na and building phase. Letter cat. Letter cat. When you've already organized, follow-up home visits are likewise needed. Which of the following should you do first? O kapag kadating mo sa bahay, ano mong gagawin? Dire-diretso ka po ba sa loob? Dire-diretso ka ba sa loob? Syempre mag-introduce ka muna. Okay, greet the patient or resident and introduce self. Okay? Alam mo na mag-wash hands ka kagad. Letter cat muna. Which of the following priority condition will be determining factors of frequency on the home health visits? Ano kaya dyan? Ano yung pinaka-importante dyan? Dapat ba tanggap ka ng pamilya mo? Yes or no? Dapat po ba tanggap ka nila? Yes. Kasi kapag hindi ka tanggap, pero alam mo yung mga needs ng 'di ba? Kapag hindi ka tanggap ng family mo, pero alam mo yung mga needs nila, kinabukasan ba, nakalak na yung pinto nila, wala nang tao sa bahay? Yes or no? Yan na. Acceptance of the family. Okay? Yes. Next, urethral catheterization requires physician's order. Special characteristic aseptic technique must be observed for the clients with indwelling catheters. Okay? 96. A day after insertion of the urinary retention catheter, the patient complains of discomfort in the bladder and in the urinary meatus. The initial action of the nurse would be, kapag ganyan, initial action, tandaan nyo, kapag initial action, assessment, kadalasan ang priority mo. Okay? First thing to do, initial action, kadalasang assessment dyan. Okay? The correct answer is letter boy. Check the bladder if distended. O paano kumari ang tanong? Check the bladder or check the Foley catheter? Ano unahin mo? Correct? Sa dalawang choices mo, check the bladder, check the Foley catheter. Anong unahin mo? Ang isa pang tip dyan, always assess the patient first. Unahin mo yung pasyente mo bago yung mga equipment sa kanya. Bladder pa din. Okay? Bladder pa din po. The client is ordered to have close intermittent catheter irrigation. The nurse performs the procedure in the following order. Ano kayang tamang sagot dyan? It's letter. Doon tayo sa use aseptic technique. O, tanggalin mo na sa letter apple, letter dog. Ano unahin mo? Aspirate sterile solution into the syringe or clamp indwelling retention catheter? Letter boy. Okay? As using aseptic technique, put the sterile solution in the sterile graduated cup. Tapos, aspirate sterile solution into the syringe. Clamp the indwelling retention catheter. Slowly inject sterile irrigant to the catheter and bladder. Withdraw the syringe and leave solution for about 20 minutes. Then remove the clamp and allow irrigant to drain into the collion bottle or bag. Letter boy. When the client has retention catheter, the nurse is expected to, ano kaya? As needed or periodically mga lilinisin? Siyempre, doon ka na sa periodically. Kesa as needed. Clean the urinary meatus and the adjacent skin periodically. Hindi ka, siyempre ayaw mo sa as needed. Kumbaga, kapag as needed, ano siya? Kung kailan lang madumi. Okay, kung kailan lang siya madumi. Letter apple. Number 99, after removing the indwelling catheter, the client complains of difficulty in her first attempt to urinate. The nurse explained that this is due to letter C and D. Letter C, case. Okay, letter C, case yan. Letter A and B, pwede siya maging umbrella answer ni letter boy, 'di ba? Letter boy. Attempt of the body to adjust to or normal reflex mechanism. Letter boy, 'di ba? Under na ni letter boy si A and B. Okay? Under na 'yan. Kaya letter boy ang best answer. When considering a safety needs of the client with urinary catheter, which of the following should the nurse observe? Ano kayang tamang sagot dyan? Part siya ng CAUTI or your CAUTI bundle of care, catheter-associated urinary tract infection bundle of care para ma-prevent ang UTI. Always keep the bag lower than the bed. Bakit kaya? Bakit? Bakit importante dapat yung urine bag mo nasa ilalim or nasa baba? Kasi ang tendency pwede mag-cause ng infection. Opo, para ma-drain din yung ihi ni patient. 'Di ba kapag nagpo-pull yung ihi sa bladder, ano mangyayari? Pwede po ba magkaroon ng infection? Yes, pwede mag-cause ng infection 'yon. Okay? Yes na yes. O, bladder break for 5 minutes, 2 o'clock. O, bladder break for 5 minutes, 2 o'clock, balik kayo. Kerry. Pag may tanong, sampal lang. Mag-bladder break lang ako. Okay? Let's go. Hoy. Pabrik sa 100. Sige na, okay na. Ito na. May nagtanong, bakit daw hindi letter dog keep a closed drainage system? Pwede din siya, but according to the source kasi, maintain a closed sterile drainage system except kapag pag nag-irrigate ka. Nag-irrigation system ang context natin dito. Kay letter boy ang mas appropriate answer. Okay, letter boy. Linaw na. Hello. Noel is a 45-year-old obese client who has been struggling to pass out stool for the past 45 days. He has been worried that he might have cancer. The following questions apply. After taking the history and vital signs, the physician does which test screening for colorectal cancer. Ano kaya ang pinakamagandang sagot dyan? Letter C, X yan. Exam siya. Okay, physical examination, not a test. Letter dog, confirmatory test. Matitira ka sa letter A and B. Okay? Ang nire-recommend po ni colon cancer is letter apple. Double contrast barium enema. Okay? Double contrast barium enema. NP5 po tayo. NP5 po. Okay? Ang enema, ang double contrast barium enema, ito ay every 5 years pagdating ng starting at age of 50. Ay, sorry na. Sige, hanapin niyo muna. Yung USA, University of San Agustin ba yan? USA, University of San Agustin. Yeah, confirmatory yung letter dog. Proctostigmoidoscopy or yung mga colonoscopy. Yan. But hindi po di. Take note po, screening test. Screening test. Okay, screening test kasi siya. Kadalasan kasi itong proctosigmoidoscopy, almost same to your colonoscopy. Ang colonoscopy and proctosigmoidoscopy is confirmatory test po. Okay, confirmatory test siya. CEA, cancer marker to. Cancer marker, blood test. Okay? Blood test siya. It's not sensitive po. Not necessarily mataas yung CEA mo, meron ka ng colorectal cancer. Kasi pwede din niya magkaroon ng other test. Pwede din niya mag-add pag mataas sa CEA mo, pwede naman pancreatic or other types of cancer. Okay? Hindi siya kumbaga specific. To confirm the impression of colorectal cancer, Noel will require which diagnostic study? Ano kaya yan? To confirm the impression, confirmatory letter dog, dyan na siya papasok. Okay, dyan na siya papasok. Letter dog, colonoscopy. Okay, colonoscopy siya. Kasi kadalasan pag colonoscopy, tapos nakita nila invasive yung tumor, kukuha na sila doon ng specimen, tapos papasend na for biopsy. Kasi send na siya for biopsy. Number 3, which of the following would you expect to see in Noel's history which predisposes him to colon cancer except, actually, walang tamang sagot dyan, yes or no? Walang tamang sagot dyan. Agree ba kayo sa akin? Walang tamang sagot, yes. Pero syempre, sa board exam, hindi nyo naman siya i-contest na ma'am, wala pong tamang sagot dito. Ganon. Pero dun, magre-resort ka na lang sa pinaka-okay na sagot. Diba? For example, inflammatory bowel is a risk factor. Yes. Smoking is a risk factor. And genetic factors of familial adenomatous polyposis. High-fat diet, yes. High-fat diet, yes yan. Pero high-fiber diet, yes or no? No. Kaya ang best answer dyan is letter boy. Okay, ano pa ba sir yung ibang risk factors? IBD, Inflammatory bowel disease. Crohn's. Ulcerative colitis. Fam history. Lack of physical activity. Low diet in fruit and veggies. Wait lang, extend natin ng konti. Ano pa? Low fiber diet. High fat diet. Saka high diet. High processed meat. Yan yung mga alcohol consumption. Ayan. Obesity. And tobacco. Yan yung mga risk factors. Okay? Yan yung mga risk factors for your colon cancer. Okay? Kung ano yan, pinaka dyan, evident dyan, family history. Kasi yung father ko died due to colon cancer. Tapos yung kapatid din niya namatay din colon cancer din. Kaya diet modification lahat kami magkakapatid. Okay? Next na. Sige, kopya muna. Okay na. Ako kumakopya pa ang mga person. Kailan recalls 3 nyo? Di ba alam ko next week na ata recalls 3 nyo eh. Di ba? Alam ko next week na recalls 3 nyo or this week. Kasi may recalls 4 na na schedule sa akin. Next na po. B, natulog na kayo, B? Next na. Okay? Symptoms associated with colon cancer include, di ba kapag colon cancer, may mass ba sa may colon mo? Yes or no? May mass ba sa colon? May mass ba? Nakakalabas ba ang pupo? Yes or no? Nakakalabas ba ang pupo? No. So pwede ba siyang malilit na pencil shaped stools ang lalabas mo? Yes or no? Yes. Okay? So letter boy. Okay, blood in stools. Bakit sir? Kasi pinipilit mo ilabas. So ang tendency niyan, yung mass mo nag-scrape siya. Okay, kaya ka nagkakaroon ng blood in stools, leading to your anemia. Letter boy. A tumor was seen in Noel's diagnostic workup and the doctor prescribed excision of the mass. Several days prior to bowel surgery, Noel may be given sulfasalazine and neomycin. Ano ba yung neomycin? Antibiotic po ba to? Yes or no? Antibiotic ba to? Yes. So ano sagot natin? Sagot natin. Letter apple. Reduce the bacterial content of the colon. Galing. Nurse Pete has been observed that they are having difficulty of stabilizing your ET tubes. Before data gathering, which of the following should be initiated by Nurse Pita? Before data gathering, alamin mo muna kung ano bang problema. True or false? Alamin mo muna yung concept. Letter apple. Begin with the concept and seek how to best implement the concept into client care. Okay? A concept will help the nurse sharpen her focus on which data to gather. The nurse should think how this concept affects the client care and what is need for improvement. Letter apple. Number 7. The next step that the nurse, at pabalik po sa situation. Ayan po. Number 6, 7. After mo ma-identify yung concept, you define the problem. Letter apple. Letter apple. Number 7, letter apple. Number 8, following the review and evaluation of the data, the nurse should, kung nakuha mo na yung mga data, anong gagawin mo sa mga data mo? You collect or choose the relevant data. Okay? Relevant information. Letter Apple. Okay, letter Apple. Number 9. With the following information obtained to promote evidence-based practice, the nurse should, kung ano may nakita ka evidence-based practice, anong gagawin mo? Letter boy. Conduct a pilot study to selected clients. Tingnan mo kung effective ba siya. In the several units of the study, tingnan mo muna kung effective siya. Tsaka mo i-implement sa lahat ng patients. Okay? Mag-implement ka muna, mag-pilot study ka muna kung effective ba siya sa inyo. And then after that, dun ka mag-go to all of the patients. Letter boy. Number 6, letter Apple. Number 8 is letter Apple. Following the success in stabilizing endotracheal tube in their unit, Nurse Pita shared the literature they found on the endotracheal tube stabilization with nurses in the ICU. In order to reflect current published knowledge, which of the following appropriate action should critical the nurses do? Sinabi na, actually nasa context siya ng number 8. Di ba magagawa, di pala. Number 9, magko-conduct siya ng pilot study. So, gumawa ka ng research. Conduct a similar research in the ICU. Letter dog. I am impressed. Okay, letter dog. Okay? Situation. Nurse Nadine is a nurse in the burn unit. The following questions apply. Nurse Nadine is caring for Teresa who sustained circumferential thermal burns in the right upper extremity of chest. Nurse Nadine noted that the pulse could not be appreciated on the right arm. Which of the following will Nurse Nadine do first? Letter dog po, number 10. Kapag ganyan, do first. Ano daw una mong gagawin? Refer or assess ka muna. Refer or assess? Assess. Okay? Assess. Ano yung pinakamaganda assessment dyan? Pinakamagandang assessment, letter C. Try to take the pulse on the uninjured extremities. Diba? I-compare mo muna. Diba? Compare muna. Letter cat. Vong is a truck driver for 10 years. While loading containers with chemicals from a truck, he accidentally spilled the whole can of corrosive. Corrosive siya, sabihin, damaging siya all over his body. Which of the following would Nurse Nadine consider priority intervention in the emergency department? So most probably, all of the body, ano yan? Buong katawan yan. Pwede ba, kailangan ba i-secure mo na yung airway? Yes or no? Corrosive material yan. Corrosive, nakakasunog, nakaka-damage. So, i-maintain mo muna yung patent airway. Airway muna kasi nagsabi all over the body. So, pwede na-apektuhan yung face niya. Okay? Pwede mag-constrict yan. Kaya, establish mo muna yung airway mo po. Okay? Letter boy. Letter boy. Nurse Nadine is also managing patient Edel who sustained partial thickness of burn on the face and inquires about skincare after discharge. Which of the following should Nurse Nadine include in her discharge teaching? Pressure garment po ba? Pressure garment? Yes or no? Pressure garment. Ni-remove mo yung clothing. Take note kapag ang ano kasi niya all over the body. So including yung nasa ano niya, nasa mukha niya. So, tinanggal mo yung clothes, hindi mo na-maintain yung patent airway. Di ba? Airway ang priority mo. Di ba? prioritization siya. Okay? Prioritization. Priority intervention kasi siya. Okay? Kaya mas iuunahin mo yung airway po. Okay? Di ba dapat light dapat to, wala siyang pressure? Avoid sunlight. Avoid po ba? Yes or no? Avoid? No. Hindi naman avoid, 'di ba? Hindi siya avoid. Continue to eat high caloric food. Pwede din naman siya, but the best answer is avoid facial makeup. Bakit kaya? Bakit kaya? Bakit kaya avoid facial makeup for a year? Irritant po bang makeup? Yes. Pwede ba siya maging cause ng infection? Pwede ba siya maging Yes, pwede siya maging cause ng infection din. 'Di ba? Technically kasi madumi ang makeup, 'di ba? Ayun. Okay? Dito na tayo. Kawawa naman. Okay, baby boy who sustained severe burn injury in the three-fourths of her body and she is in the emergent phase. Nurse na noted the following laboratory. 12.5. 12.5, normal, abnormal. Normal, abnormal yan. Nasa normal range pa yan. 12 to 16, carry pa yan. Hematocrit of 49. Hematocrit ng 49, medyo nasa ano ka na, upper limit ka na yan. Serum sodium ng 130, normal, abnormal? Abnormal. Ano ba normal lang serum sodium mo? Normal serum sodium, 135 to 145. Very good. Okay? So, anong tamang sagot dyan? Bakit may abnormal result siya? Due to letter dog. Okay, letter dog. Diba? X agad to. Letter dog. Raj is fond of eating Betamax and isaw on the streets. Recently, he has been complaining anorexia and is always feeling tired. Developed jaundice. After workup, he is diagnosed of having hepatitis A. Raj asked you about gamma globulin for himself and their household help. Your most appropriate response would be, kapag hepatitis A, paano transmission ng hepatitis A? Paano transmission? Food, oral-fecal transmission yan. Or fecal-oral transmission. Same as your hepatitis E. Okay, hepatitis E. Okay, anong pinakatamang sagot dyan? May na-develop na pong vaccine for the hepatitis A. Letter dog. Letter dog. Okay? Nurse Ramil is a member of the Philippine Oncology Nurses Association. He has been advocate of cancer prevention in the community. The following questions apply. Nurse Ramil is a member of the task force to plan activities for the Cancer Consciousness Week in the community. His committee has 4 months plan and implement the plan. The group was assigned to contact various cancer support groups in the hospital. What will be the priority activity? O nasa planning ka pa lang. Kapag planning, anong kailangan mong i-identify? Letter? Correct. Letter apple. Objectives, di ba? Pwede din naman yung letter boy. Di ba? Pero mas importante objectives, di ba? Objectives. Letter C, hindi mo kailangan yan. Di ba? Hindi mo kailangan ng VIPs. Okay? Letter doc at a later time pa. Identify mo muna yung objectives ng activity mo para saan ba yung activity mo. Okay? Before finding any budget or finding any support groups. Okay? 15 po is letter dog. Letter dog po. Nurse Ramil will also do the medical mission activity of his alumni association in the planning stage. In the planning stage, everybody is expected to identify what they can do during the medical mission and what resources are needed. He thought it is also his chance to share what he can do to others. What will be the important role where he can demonstrate the impact of nursing in health? Ano kaya ang tamang sagot dyan? Pinaka-favorite natin gawin. It's letter dog. Health education, di ba? Conduct health education on healthy lifestyle. Diba? Letter dog. Impact of nursing in health. Okay. One of the patients in the ward, nurse Jaja asked about brachytherapy. Implant po ba to? Yes or no? Pag brachytherapy, implant or hindi? 15 po is letter dog. Oh. Brachytherapy, implant or hindi? Internal siya. Very good. Internal. Radioactive po ba yung patient? Yes or no? Yes, radioactive siya. Which one of the following nursing intervention would be most helpful in preparing her for brachytherapy? Pinaprepare mo pa lang siya based sa ano? Sa number 17, health education. So letter dog din ang sagot mo. 'Di ba? Letter dog din ang sagot mo. Emphasize on the therapeutic value of the treatment. Health education din siya. Letter dog. 'Di ba? Meron yan dalawang types ng radiation therapy. Ano yung dalawang types ng radiation therapy? Your internal and external, or your teletherapy and your brachytherapy. Ayan siya. Your external or teletherapy, ito yung client is not radioactive. And internal radiation or brachytherapy, your client is radioactive. SSD. Done na. Next. What side effects are most apt to occur during radiation therapy to the pelvis? Ano kayang tamang sagot dyan? It's your letter dog, 'di ba? Kasama kasi dyan, pwede masama kasi yung colon mo dyan, leading to your nausea, vomiting, and your diarrhea. Letter dog. Letter dog. Okay? Next. Eugene soon developed skin irritation after radiation therapy. Which of these can be used on the irradiated skin? Ano kayang tamang sagot dyan? Siyempre, matic yan, hindi ka pwede mag-adhesive tapes. Kasi pwede mag-cause ng irritation. Talcum powder is also irritating. Okay, talcum powder is also irritating. Your zinc oxide is also irritating. Actually, may burning sensation ng zinc oxide mo. It can add up to the burning sensation ang zinc oxide mo. So, ang best answer is letter boy, mineral oil. Okay? Letter boy, mineral oil. Okay? Bakit, sir? Meron ako nabasa na pwede mo siyang pantanggal ng markings if permitted. Okay. Your talcum powder kasi irritant siya. Adhesive tape irritant siya. Zinc oxide is also irritant. So, ang pinaka-best answer na lang talaga dyan is letter boy. Letter boy ang best answer na lang talaga dyan. Actually, wala talaga tamang sagot dyan. Okay, wala talagang tamang sagot dyan. Kasi, most probably irritant din siya. Pero, meron nag-recommend na pwedeng gumamit ng mineral oil. Kaya mas nag-settle ako to letter boy. Okay? Next. Which of the following is the earliest sign of skin? What does mineral oil do? Pwede mo siyang di ba, kapag ang tawag dito, kapag nag-radiation, external radiation yung patient, meron siyang markings. May markings ba yun? Yes or no? May markings po ba? Pwede mo siyang pangtanggal doon sa markings kapag nagkaroon ng mark. Pag pwede na tanggalin yung markings, yung mineral oil. Kaya mineral oil yung pinaka-okay. Okay? Which of the following is the earliest sign of skin reaction Nurse Jaja expect for Eugene to manifest? Desquamation, ito yung pagbabalat. Pagbabalat yung desquamation. Okay, pigmentation, ito yung nagkakaroon ng discoloration na. Okay, erythema, that is your pamumula. Letter boy. Atrophy, anong atrophy? Lumiit. Atrophy is lumiit. Hindi ko na sure kung anong tamang pronunciation. Atrophy. Basta lumiit siya. Okay? Ray receive an internal implant. What is the purpose of wearing film badge while caring for a patient who is radioactive? Anong purpose ng film badge? To monitor or to measure the amount of exposure to the radiation. Letter dog. Diba? Limit ba natin dapat ang pag-ground sa patient na may internal implant? Yes or no? Limit ba? Yes. Diba as much as possible, start at end of shift ka lang papasok doon. Diba? Start at end shift lang. Tapos dapat si patient mo naka-facing the door or facing the window. Saan dapat naka-face yung patient mo? Door or window? Window. So window siya, hindi siya tatapat sa door. Kasi pagkapasok mo, buga agad sa'yo yung radiation mo. Nurse 1 is aware that healthcare-associated infections occur in both adult and pediatric patients. Bloodstream infections followed by pneumonia, UTI, are the most common healthcare-associated infection in children. UTI are common on the adults. Joshua develops nosocomial infection. Ano yung sabihin ng nosocomial infection? Ano yung sabihin ng nosocomial po? It is developed kapag nasa hospital ka. Hospital acquired siya. Okay, letter C. Okay, letter C. Angel is currently receiving total parenteral nutrition. As a nurse, Nurse 1 knows that one of the complications that have to watch out when caring for Angel is, anong tamang sagot? Infection. Very good. Infection. Tanong, kapag nag-handle ka ng parenteral nutrition, clean or sterile technique? Clean or sterile? Clean or sterile? Sterile. Okay, sterile technique po. Okay, sterile technique. Central line, peripheral line. Sa ma-administer yung parenteral mo. Central. Alam, may pakis-kis pa sila. Central or peripheral? Central line. Very good. Diba? Hypergly, hypogly. Hypergly. Very good. Diba? Nurse 1 is aware that the patient Eric who sustained major burn has sustained Pseudomonas aeruginosa infection. As a competent nurse, if he would assume that the solution used to treat Pseudomonas infection is, hirap niyan, Pseudomonas infection. Mabaho. Anong tamang sagot? Alam mo yan ng tao, di ba, acetic acid? Ay, Dakin solution. But according to the studies, it is acetic acid po. pH modification can be determined introducing infection. Historically, acetic acid has been used to treat wounds with Pseudomonas infection. Letter C. Letter C. Number 26. Which of the following is most reliable in diagnosing and treating wound infection? Ano kaya yung dyan? Pinaka-appropriate. Letter dog. Okay? Your culture and sensitivity. Sir, ano po ba yung culture and sensitivity? Ang culture po, ito po yung may papatubuin ka kung may bacteria or present. Okay? Papalakihan mo siya sa agar. Kapag may tumubo dyan, ta-identify mo kung anong klaseng bacteria po iyon. Anong klaseng bacteria yon. Tapos, check yung sensitivity. Ito yung check mo kung saan siyang sensitive na antibiotic. Okay, kung saan siya sensitive na antibiotic. Ang mangyari niyan, direct yung antibiotic mo. For example, you will give Piptaz. Sensitive pala siya doon sa Piptaz. Most probably, matitreat mo infection. Okay? So, the best answer is letter dog. Sir, bakit hindi po letter C? Yung letter C po kasi gram staining, ma-identify mo lang dyan kung gram positive or gram negative yung bacteria. Okay? But you would then know kung sensitive ba yung bacteria na sa antibiotic. Okay? Yung letter boy, WBC count, hindi naman din siya reliable. Diba? Mataas lang yung WBC count mo pag pag may bacterial infection. Okay? But that doesn't mean na matitreat or magkakaroon ng most reliable treatment siya. Okay, so letter dog. Question. Antok-antok na mga person. Question. Uy. Wali, alak ka. Nakatulog na sila. O, Rita is a patient with bipolar disorder. Break? Gusto niya ba ng bladder break? Idlip break sa kaliko. 240. O ano mo na kayo, mag-bladder break mo na kayo hanggang 240. G? Parang antok na yung mga person talaga. 250. Sige, 250. Kailan medyo mahagol tayo ng slide kapag 250 promise. Medyo mahagol tayo. 245 na lang. 245. 245. G. O 245 balik. Medyo mahagol lang talaga tayo. start na. Let's go. Rita is a patient with bipolar disorder. During her manic episode, she accidentally dislodges her IV line and bleeds. Blood oozes on the bed table and hospital bed. It is most appropriate that nurse Juan instruct the housekeeper to clean the table with, ano kaya tamang sagot dito? Ano kaya yung pinaka-tamang sagot? Letter dog, bleach. Bleach talaga siya. Okay, letter dog, bleach. Nurse Juan is a member of the infection control team of the hospital. Based on the feedback during the meeting of the committee, there is an increased incidence of MRSA infection in the burn unit. What is the nurse priority activities? Ano kaya yung pinakamagandang gawin dyan? Ano kaya pinakamaganda? Mag-root cause analysis ka. Ano kaya pwedeng ano dyan sa root cause analysis? Letter, ano kaya? Root cause analysis. Data gathering pa din. Letter dog, do data gathering about possible sources of infection. Okay? Ala, meron nagbura. Ayan. Letter dog pa din. Nurse Yun Che is a nurse in diabetes clinic. 5 patients came to the clinic today for health teaching. What would be your start? Would you start prioritizing your activities? Kanina pa natin ito sinasabi, kapag mag-health teaching ka, anong priority mo munang kailangan malaman? Letter Apple, learning needs. Diba? Learning needs pa din. Okay? 30. Which statement made by Nurse Karina about the goal of total quality management or continuous quality improvement in a healthcare setting is correct? Okay? Kapag TQM or CQI, ito yung mga processes. Okay? Yung mga procedures po. Hospital procedures and hospital policies. Ano kaya yung best answer dyan? 29 is letter Apple. Letter Apple. Diba? So your TQI, TQM or CQI is about processes. Okay? Processes siya. So, the best answer for that one is letter boy. Diba? Letter boy yan. It's about the processes and procedures po. The nurse managers states that the staff will form a task force to investigate and develop potential solution to the problem and report it on this at the next staff meeting. Ano kaya ang tamang sagot dyan? Ano kaya ang tamang sagot? Letter Apple. Okay, kailan lang siya magiging laissez-faire? Kailan ka siya magiging laissez-faire? Kapag walang staff meeting. Kumbaga, bahala kayo dyan maghanap ng solution to the problem. Yes or no? Kapag laissez-faire, letter boy. Di ba? Pag laissez-faire, ang gagawin dyan, bahala kayo. Autocratic. Ano yung sabihin ng autocratic? Ano yung sabihin ng autocratic? Ito yung may siya lang yung masusunod. Yung manager mo lang yung masusunod. Diba? Authority lang. Si leader lang ang magde-decide. Okay? Yun siya. 30 is about policies and procedures. Your TQI. TQMS CQI. About policies and procedures. Okay? Nurse Bea informs the nursing staff at morning report that the clinical nurse specialist will be conducting a research study on staff attitudes towards the prevention of Yerkauti infection. All staffs are invited to participate if they wish. This affirms the ethical principle of, sabihin nito, i-invite mo lang siya, it would depend sa staff kung a-attend or hindi. Ano kang pwede yon? Letter boy. Autonomy. Okay, autonomy. Ano yung sabihin ng anonymity? Anonymity. Hindi ko alam kung paano i-mention siya. Letter siya. Ano yung sabihin nun? Ito yung walang, ano kaya? Letter C. Ibig sabihin ng letter C, ibig sabihin you won't give the identifiers. Very good. Identifiers, no identifiers. Very good. Okay. As a nurse, to which of the following groups are you best prepared to join? Ano kaya dyan? Morgue department. Pwede ka ba sa morgue department? Siyempre, ang pinaka-ideal dyan is letter C. Triage group. Diba? Triage group na. Okay? there are important principles that should guide the triage team in disaster management that you have to know if you were to volunteer as part of the triage team. The following principles should be observed in the disaster triage, except, anong tamang sagot dyan? Kailangan may resources available ka. Yes. Diba? Mas kailangan kapag disaster, greatest good of the greatest number. Okay? Tapos dapat efficient ka to all available resources. Ba't nagpamali si letter dog? Importante po ang training sa disaster. Diba? For example, BLS, Basic Life Support, is an example of pag nagtitrain ka sa disaster. Diba? Yan. Next. Which of the following patients should be considered your first priority? Okay? Your first priority. Diba kapag ganyan, airway, breathing, circulation. Diba? ABC ang priority mo dyan. Okay? ABC. Wait lang po. So, kapag ganyan, Crohn's disease, hindi naman to. Sakit yan, Day. Sakit ang Crohn's disease mo, pati pneumonia mo. Okay, sakit siya. You would go for your letter D or letter apple. Okay, may airway po bang involvement sa letter A and letter dog? Wala. Breathing, meron po bang involvement dyan? Meron po bang involvement sa breathing? Wala din. Diba? Wala din. So, ang best answer is your circulation. Yun yung bleeding leg. So, letter dog. Okay, letter dog. Next. A guideline that is utilized in determining. Bakit hindi po letter A? Because we are doing the prioritization. Okay, prioritization po kasi ang ginagawa natin. First priority siya. Okay, A, B, or C. Airway, breathing, circulation. Ano lang po ba may circulation dyan? Walang airway dyan, matik, walang breathing dyan. Ano yung may circulation? Ano yung altered yung circulation niya? Bleeding leg. Okay, bleeding leg. Okay, at the same time, long bone po siya. Long bone siya. So letter dog talaga ang pinaka first priority mo. Okay? Next. A guidance that is utilized in determining priorities to assess the status of the following except sinabi na natin A, airway, or breathing, circulation. Siyempre, ang next mo dyan is the mentation. Okay? The LOC ng patient mo. Okay? So, perfusion, respiration, mentation, so letter boy. Locomotion. Locomotion po. 37. Induction of vomiting is indicated for the accidental poisoning patient who has ingested. Ano kaya? Ano kaya mangyari? Anong pwedeng gamot? Your aspirin or your acetylsalicylic acid. Okay? Ito siya. Bakit hindi ka pwede dun sa B, C, and D? Bakit hindi mo pwede siyang i-induce yung vomiting? Kasi it could lead for your corrosive. Di ba further damage ba siya sa may throat area mo, sa may esophageal area mo? Pwede ba siya mag-further? Yes, further damage pa siya kapag nag-induce ka pa ng vomiting mo. Okay? Prior to the start of the shift, the nurse manager gave trivial quiz. Which of the following these clients would nurse put first on the list to be discharged in order to make a room available for new admission? Ano kaya dyan? O tingnan nyo. Siyempre dyan, titingnan mo yung timing. Yung timing. So that morning lang, mali agad si Apple. 24 hours ago, 5 days ago, and 48 hours ago. Sino yung pinakamatagal na nasa hospital dyan? Si Tony Stark. Diba? So most probably, resolving na ba yung infection niya? Yes. Resolving ng infection ni patient dyan. So siya ang pinaka-best for discharge. Okay? Siya yung best candidate for discharge. Next. Nurse Gabda, I have several clients who have arrived in the emergency department within 15 minutes. Which client should the triage nurse send back to be seen first? Okay? Kapag ganyan, ABC pa din siya. Airway, breathing, sorry, pansulat ko, and circulation. Oh, saan kaya dyan may airway ang involvement? Saan kaya dyan may airway involvement? Meron kaya letter boy, yung sing beard. Kasi ang tendency ng sing beard mo, pwede siya mag-cause ng constriction ng airway mo. Okay, constriction ng airway mo. Okay? So the correct answer is letter boy. Okay? Next dyan is letter apple. Okay, next dyan is letter apple. Yung CND kasi almost same lang yan. Okay, not your priority kasi. Okay? So best answer is letter boy. 38 po is letter cat. Sing beard, ano siya, it can cause kasi siya ng inhalational burn siya. It can cause airway edema, constriction po ng airway. Okay, it can cause constriction ng airway. Next, Nurse Jenny is a registered nurse witnessed an old man hit the pedicable causing a train railway. The old man fell at the railway. Jenny rushed at the scene. So, nang pinaka-appropriate dapat gagawin ni Jenny? First thing to do, safety ni patient. Diba? Safety ni patient. Take note, nasa railway si patient. Anong una mong gagawin? Kapag ganyan, ang pinakamaganda gawin dyan, move the person muna to a safer place. Kasi nasa railway ka. Pwede magkaroon ng train na dadaan dyan. So you go first for the safer place. Okay? Letter dog. Okay? Letter dog. Diba? Kaya mag-ano ka, palagi nyo din tatandaan, mag-depend kayo sa situation. Okay? Magde-depend kayo always sa situation. Kasi sa board exam, for example, 1 to 5, may situation 1 yan. Then 6 to 10 nandun sa situation 2. Okay? Number 1 tip yan, always depend on the situation. Okay? Next. Jenny suspects a hip fracture when she noticed that the old woman's leg is, ano kaya? Letter dog. Shortened, adducted, and externally rotated. Okay? Again, shortened, adducted, and externally rotated. Ano po ba itsura niya, sir? Adducted. Abducted yung letter boy mo. Saan? Okay? Ganito siya. Ayan po. Hip fracture, adducted, externally rotated, and shortened yung leg. Okay? Again, adducted, externally rotated, and shortened yung leg. Okay? Yeah. Ano yung holy? Masyado na ba ako mabilis or sakto lang? Parang ang daming questions. Mabilis ba ako? Sakto. 27 to 38. Anaphylactic, sakto lang. Parang nagkaka-anaphylactic reaction ka na. Okay? 27 to 38 daw po. Okay? Oh, the old man complains pain. Nurse Jenny noticed that the knee is reddened, warm to touch, and swollen. Bea interprets that these signs and symptoms are likely related to ano kaya? Letter boy, inflammation siya. Ano yung 6 na cardinal signs ng inflammation? 6 ba? 5 pala. 5 cardinal signs of your inflammation. Redness. Ano? Ito siya. Okay? Your heat. Anong other term for your heat? Calor. Redness. Ano yung redness? Rubor. Very good. Ano yung swelling? Tumor. Pain. Ano yung pain? Dolor. Ano yung loss of function? Ano yung loss of function? Yun yung factiolasa. Factiolasa. Okay, factiolasa siya. Yan yung 5 cardinal signs ng inflammation mo po. Okay? Next. Ryan, the old man was now immobilized and brought to the emergency room. Sorry. Sige. Okay, lagay ko na lang. Okay, your heat is calor. Redness is rubor. Swelling is tumor. Pain is your dolor. And your loss of function is functionless. Hindi ko alam kung paano basahin eh. Yan. Yan siya. Next na po. Yes. The X-ray shows fractured femur and pelvis. The ER nurse would carefully monitor Teddy for which of the following sign? Anong possible complication kapag femoral fracture? Anong possible na complication mo kapag femoral fracture? Bleeding. What else? Fat embolism. Okay, fat embolism. Diba? Fat embolism. So kapag nag-fat embolism ka, tachycardia ba? Tachycardia? Yes. Hypotension din po yan. Hypotension? Yes. Okay, hypotension. Tapos nagiging takipnik din si patient mo. Okay, nagiging takipnik din si patient mo. So letter apple. Fever is not a problem dito. Hindi siya problem yung fever mo. Okay? Which of the following serious complications can occur with long bone fracture? Sinabi na natin to. Letter boy. Fat embolism. Okay, fat embolism. Nurse Derek is a newly hired operating room nurse as he observed the movement of nursing in the operating room. The following questions apply. Nurse Kim is setting up for an emergency gastrectomy. The linen packs were damp. Ibig sabihin basa. Although these were just taken from the sterilizer. The nurse's appropriate action is, ano kayang tamang sagot? Pinaka-active mong pwedeng gawin? Letter C. Letter C. Sir, bakit hindi po letter dog? Mas active kasi yung mag-change ka ng linen pack kaysa hindi mo naggagamitin. Diba? So letter C ang mas magandang sagot. Okay? The clinical instructor assigned a nursing student to assist in the operation. When the nursing student entered the OR suite, her curly long hair was not completely covered by the head cap. Sabi niya, I'll try to talk with Ma'am JD, pero I'll go for letter C. What would the circulating nurse do? Anong tamang sagot dyan? I-assist mo na lang si nursing student to tuck in all her hair inside the head cap, 'di ba? Pero anong gagawin ng CI nyo pag nakita kayong ganyan? Anong gagawin ng CI nyo? Kurot. True. Manlalaki ba yung mata? True or false? Manlalaki yung mata? Extend ba ang duty mo? Extend ang duty, yes or no? True, 'di ba? Extend ang duty. Okay, after Dr. Jisoo finished her doing surgical scrub, he came into the OR suite swinging his hands casually. Non-sterile ba siya, yes or no? Mali ba yun kapag swinging hands casually kapag tas mo mag-surgical hand scrub? Yes, mali siya. The scrubbers would do which of the following appropriate action? Letter dog. Remind the surgeon to scrub again. Letter dog. Okay, letter dog. True. Try. Kaya pagalitan si Doc? Kaya. Doc, scrub out. Doc, X ka na. Huwag ka na mag-opera, Doc. Ganunin mo. Ako na, Doc. Diba? Huwag ka na mag-opera, doc. Cancel ng OR mo. Okay? When the resident did the skin prep and catheterize the client, the circulating nurse noticed when true, in reality, walang pake yung doktor. True or false, hindi tayo paninila, pero may mga doctors kasi na ganun. What is the appropriate action or immediate action? O nagkamali daw, anong gagawin mo? Ipapasok ba ulit yung catheter? Ipapasok pa ulit yung catheter? Yes or no? Gagamitin pa ulit yung catheter? No, bakit? Bakit? Unsterile na siya. Okay, so letter C. Okay, letter C. Galing. Next. After the last stitch, the surgeon is ready to apply dressing to the incision wound. Which of the following does the nurse expect the surgeon to do? O kapag nag-apply ka ng dressing, sterile or clean? Sterile or clean kapag nag-apply ng wound dressing? Sterile or clean? O kapag nag-apply ng wound dressing? Sterile pa din. Sterile pa din yan. Sterile yan. Galing kang OR eh. Sterile wound dressing yan. So, kailan ka magtatanggal ng gloves kapag nakapag-apply na ng dressing at nakapag-apply na ng tape. Diba? Letter C. Letter C. Okay? Letter C po. Depende sa institution kung private or ano. Ang you would always go, kapag surgical wound yan, you would always go for the sterile technique. Sterile kadalasan kapag wound. Okay? Sterile yan. Kahit hindi OR, sterile yan. Okay? Always go for the sterile. Go for the ideal. Okay? Nurse Patricia is a medical surgical nurse handling several cases for the shift. Nurse Patricia is also preceptively named Kristen. Nurse Patricia is aware that acromegaly is a condition when the growth of hormones occurs in excess in adulthood or after epiphyses of the long bones have fused. Acromegaly. Nurse Patricia asked Kristen of which of the following are typical physical features of the disorder, except, di ba kapag nakakita na ba kayo namin acromegaly? Ako hindi pa. Sa picture lang, di ba kadalasan malaki yung kamay niyan, malaki yung muka, di ba? Tapos prominent yung features na mukha niya. Okay? Tumatangkad pa ba to? Yes or no? Si Kuya Kim ba? Acromegaly ba si Kuya Kim? Parang hindi. Diba? So, ang correct answer dyan is letter C. Hindi na kasi siya tatangkad. Tingnan nyo, ang nakalagay dyan, no? Have fused. After the epiphyses of the long bone have fused. So, correct answer is letter C. Letter C po. The client was prescribed octreotide acetate. Nurse Patricia should instruct Kristen to monitor which of the following side effects. Ang pinaka-common side effect ng octreotide acetate is your letter boy, hypotension. Hypotension po. Choy, a patient with acromegaly was prescribed with octreotide acetate. Please note that this must be administered by which appropriate route 3 times weekly. Your octreotide acetate po. Octreotide acetate. Letter boy, subcutaneous po. Okay, subcutaneous. Okay. Priority discharge plan include which of the following? Select all that applies. Tingnan nyo, number 3 and 4, almost same answer ba? Almost same answer ba? Yes or no? Almost same answer ba si number 3 and 4? Yes. So most probably ba, mali yung sagot na yun? Most probably, mali ba yung sagot na yun? High chances mali yan. So most probably, cancel nyo na to. Okay, you would lead to your letter dog 1 and 2. Kasi acromegaly is a result of excessive growth hormone secretions, which stimulates your gluconeogenesis and lipolysis, causing your hyperglycemia. Okay, hyperglycemia. Okay? Bone resorption was shown to be increased more than bone formation, especially in patients with actively acromegaly. So the correct answer is letter dog. Acromegaly often develops insidiously. The nurses should understand that the client with disorder would seek medical care because mukha nila malalaki yung mga prominent features sa mukha nila, di ba? Best answer dyan is letter boy. Changes in appearance. Changes in appearance. Situation. Ay, sorry tayo next. Kimberly, a status post Bill 2, was admitted to the post-anesthesia care unit from the OR. The client is still sedated but responsive to commands. Kasi 'di ba, ba't kailangan ng fasting blood sugar? Kasi po, 'di ba, ang tendency niyan, okay, lagay ko na lang yung ratio dito. Ito siya. Yan. Kasi ang tendency niya, nagkakaroon ng excessive growth hormone leading for your stimulation of your gluconeogenesis, causing your hyperglycemia. Sabi mo sa akin pag-carry ka na. Bilro 2. Ano ang Bilro 2 po? Ano ang Bilro 2? Bilro 2, jejunostomy. Very good. Letter C. Ano ang Bilro 1? Bilro 1, duodenoscopy. Okay, very good. Yan siya. Ang pogi ko ba today? Hindi ang ano, ang random. Charot. Okay, let's go. Next. O ano daw ang priority mo post-op? Anong una mong i-assess? Tamang sagot. Letter. Apple. Patency of the airway. Ano bang priority mo post kapag assessment? Ito na yung arrangement. Bibigay ko na sa inyo. Una mo ang airway. Diba? Airway ang priority mo. Kung airway ang priority mo, anong position of choice mo po? Position of choice kapag airway ang priority mo, post-operative. Ano kaya? Priority position mo is semi-Fowlers. Ang semi-Fowlers, ang tendency niya, pwede ba ma-block ng tongue niya? Yes or no? Ang airway mo? Yes. Ang best answer if pag airway ang priority mo is lateral, side-lying position po. Okay, side-lying position. Kapag na-establish mo na ang airway mo, ang second priority assessment mo is your breathing. Breathing, your O2 and ventilation. Okay, dyan papasok si Fowler's position para makahinga ng maayos yung patient mo. Next to assess is your cardiac status or your circulation, LOC, cough and gag reflex, ability to move extremities, skin color, fluid status, post-operative site, drains and pain, and safety. Ayan po ang proper arrangement ng assessment mo post-operative sa PACU. Sorry na. Ito na. Screenshot done na. Done. Next. Nurse Tunying monitors Kimberly as she noticed a bright red spot on the dressing which measures 2 cm in diameter. The nurse would initially do which appropriate nursing intervention? Ano kaya yan? Gaano kalaki yung mga ganyan na kalitsa, no? Normal, abnormal? Expected or unexpected dyan? Normal yan. So continue ka lang. Mag-monitor. Okay, continue ka lang dyan. Kapag lumalaki yan, doon ba siya magiging abnormal? lumalaki siya. Yes, doon ka mag-aano, assessment pa further. Okay, doon ka mag-notify ng surgeon kasi possible hemorrhage yan. Kimberly was taught preoperatively to perform deep breathing exercises, coughing and turning to sides. Which nursing action would be most helpful for the client? Take note, ano ba to? Nag-bill to si patient. Ano yung pinaka-active mong pwedeng gawin dyan? Siyempre naturo mo na yung importance. Naturo mo na yung reassurance dyan. Pinaka-best answer dyan is letter dog. Apply abdominal sprint while coughing. Okay, siya na yung pinaka-appropriate thing to do na. Okay? (55-56) is letter cat and apple. Kimberly suddenly complained of abdominal pain, nausea and vomiting with abdominal distension. The nurse anticipate which of the following priority management after referring to the surgeon. Okay? Ang magiging abnormal lang siya kapag lumalaki siya. Okay? Kapag lumalaki yung red spot dyan, ibig sabihin may active bleeding ka nangyayari dyan. Okay? Doon na siya naging abnormal. Okay? Most probably, post-op complication nito is paralytic ileus. Nag-ileus ang patient. May sabihin nito, walang forward movement yung GI tract mo. So, ang best way niyan, uminom ka na ng water. Nagkaroon lang ng stasis sa gas sa stomach mo. Ang best answer dyan is letter dog, gastric decompression. Sir, ano po yung gastric decompression? Ito yung mag-insert ka ng NGTK patient, then tatanggalin mo yung fluid present po sa stomach ni patient. Okay, that is your gastric decompression. Okay? Nurse, you should be aware of the rules and regulation governing the nursing profession. The following questions apply. For failure of the nurse to check the nasogastric tube placement before administering feeding, the patient aspirated and died. The nurse may incur what? Hala ka, galit yarn. Ano kaya dyan ang pwede? Actually, all of the above yan pwede. Diba? Administrative liability, ito yung sa hospital mo. So, siyempre, pwede ka magkaroon ng suspension. Okay? Pwede ka magkaroon ng suspension. Okay? Civil liability. Ang civil liability, ito yung for example, malpractice. Okay? Malpractice yan. Criminal liability, nagkaroon ka ng murder or homicide. Diba? Pumatay ka namatay yung patient mo. Okay? Kaya siya all of the above ang pwede mabigay sa'yo. Letter C. Hala, galit na galit yan. Next. The following are sources of laws, rules, policies that affect the nursing practice in the Philippines. Ano kaya yan? Kapag ganyan, matik all of the above mo na yan. Letter Apple. The PNA, your Board of Nursing promulgations, the DOH administrative orders and CHED memorandum, and House bills and Senate bills. Letter Apple. No, promise. Sabi nila, hindi ko na kasi medyo matandaan board exam. Kung may natatandaan pa ako, pero sobrang konti na lang. Sobrang obvious daw kapag all of the above ang sagot sa board exam. Okay, sobrang obvious daw. Yun yung sabi nila. Okay? Zakay plans to take the NLE this year. The following are true about the requirements for applying for your NLE. Except, so ano yung nanap mo? Maling sagot. Okay? Good moral character, yes. Ito, after the board exam na to. After board exam na yan. Ito, applicant must finish BSN, yes. And applicant must be a Filipino citizen. So, ang best answer is letter dog. Only 2. ASEAN countries now engage in mutual recognition arrangement negotiation consistent with liberalization measures of the General Agreement on Trade in Services. The applicable mode for this kind of agreement is Ano kaya yan? May mga expected talaga na weird questions talaga, promise. For ang best answer is letter dog. The movement of natural persons. Letter dog. Okay, letter dog. Next. Tony, a 20-year-old patient, was admitted to the treatment of their Graves' disease. The physician prescribed PTU to treat the disorder. Okay? Before administering the medication, which of the following is the most relevant for the nurse to ask? Ano kayang tamang sagot dyan? Last menstruation, X. Prefer liquid form, X. Okay? Nasa sonder siya, in-emphasize po talaga si letter boy. Do you experience gastric discomfort? Kasi it can cause your stomach upset. It can cause stomach upset. Or pwede din siya nausea, vomiting. Okay? It can cause also your nausea, vomiting. Okay po? Best answer is letter boy. 65. Tony is prepared for thyroidectomy in about 10 days' time. Lugo solution of 4 GTTS per order must prescribe for 10 days. The client asked the nurse for the purpose of the drug. Which response of the nurse is correct? Ang Lugo solution po, binibigay siya preoperatively to reduce your vascularization. Reducing vascularization. So kapag nire-reduce ang vascularization mo, magpo-prone ba siya for bleeding? Mare-decrease ba niya yung risk for bleeding? Yes, letter boy. Okay, letter boy. '66. When Tony returns to the unit after surgery, which technique is most appropriate to monitor bleeding from the incision? Ano kayong pinaka-appropriate dyan? Siyempre, matik yan, hindi ka magre-remove ng dressing, doy. Siyempre, sino ba dapat mag-unang removal ng dressing mo? Sino una magre-remove? Si doktor. X din to, hindi mo na makikita. Ito din, way all gauze dressing before and after change of wound dressing. Letter, apple. Apple. Next, which of the following assessment findings when observed in a post-thyroidectomy client is indicative of your thyroid crisis? Okay, your hallmark for your thyroid crisis is what? High fever. Okay, high fever po ang hallmark natin. Letter, ay mag-praise. Letter dog. Okay, ano pa yung mga other manifestation? Tachycardia, atrial fibrillation, and hypermetabolism. Okay? That is your hallmark. High fever. Ano bang range, sir, ng fever niyan? Pwede yan mag-range ng 40 to 41 degrees Celsius. At hindi siya nare-resolve ng maayos. Okay, letter dog. 68. Tony, post-thyroidectomy was prescribed of levothyroxine. Levothyroxine is a thyroid hormone drug, yes or no? Thyroid hormone drug. Yes. The nurse monitors for side effects. Which side effect would the nurse expect to assess? Expect mo, i-assess mo, kapag nagbibigyan ng thyroid hormone drug, expect mo yung manifestation niya, hyperthyroidism. Kasi nagbibigay ka ng thyroid eh. Thyroid hormones eh. Hypertension, yes or no? Hypertension, yes. Check. X si letter boy. Tremors, expected po ba? Side effect. Tremor sa hyperthyroidism, yes. Okay, X si number. Okay, hirsutism. May hirsutism po ba kapag side effect? No, wala po. Okay, wala. Ang best answer is letter apple. 1, 2, 4, 5. Pwede ka magkaroon ng insomnia, tachycardia. Okay? Yan yung mga common manifestation. '69. Which admission assessment would make you suspect that Nairobi has hypothyroidism? Kapag hypothyroidism, everything is slow. Diba? Everything is slow. Oh. Heat intolerance po ba siya? Yes or no? Heat intolerance po? No. Diba? Cold intolerance siya. X si letter dog. Diarrhea. Expected po ba diarrhea? No. Constipation ba sa kanya? Yes, constipation sa kanya. X, A, and B. The correct answer is letter cat. 3, 4, 5, 6. Bradycardia. Coarse and dry skin. Ano yung somnolence? Ano yung somnolence po? Ano yung somnolence? Antok-antok. Drowsy. Okay? Ito yung common manifestation mo ng hypothyroidism. Yeah, pwede din lethargic. Antok-antok siya. Next. Rio was ordered to undergo radioactive iodine uptake the following day. The nurse determines that this determines which of the following. 68 is letter cat. Ay, charot. Letter apple pala. Letter apple. Somnolence na. Antok-antok na nga yung mga person. Halata. Halatang somnolence na kayo. May hypothyroidism ang mga person. Letter apple. Letter apple. Kaya nyo yun. Lumaban kayo, day. Matapos na tayo. Matapos na. Oh. If the doctor will prescribe basal metabolic rate to you, which of the following is not indicated? Okay. Kinukuha na ng liwanag. True. Paano yun kapag 7 to 8 p.m. na ang klase nyo? 7 a.m. to 7 to 8 p.m. 12 hours. Diba? Tamang sagot dyan is letter kapeng malala. True. Anong kape nyo? Anong preferred nyong kape? The correct answer is letter boy. Blood extraction upon waking up. Coffee ko black. Hindi masarap kaya yung coffee ko black. Try nyo black coffee. Kaya masarap. Dunkin' Donut, masarap din. Dunkin' Donut na coffee, masarap. Starbucks, immune na ako sa Starbucks. Yun. Hindi na ako sa Starbucks eh. Cytomel. Liothyronine was prescribed to Rio before. Ano masarap? Kahit iced coffee ng Dunkin' Donut, masarap. Masarap, promise. Before administering the drug, nurse Karen should not only verify the doctors, but also, anong ma-monitor mo? Tim Hortons, masarap din siya. Double-double. Kaya lang sobrang tamis. 71 is letter boy. Nawala na naman ako. Sige, go. Okay. So dito tayo, nagbibigay tayo thyroid hormone na drug. So pwede ba siya mag-tachycardia? Tsaka hypertension? Yes. Letter apple. Naka-emphasize talaga yan pag monitoring. Foam coffee? Ano yung foam coffee? But first coffee, masarap din yung Vietnamese coffee. Try nyo. Sa Pick up coffee, try nyo. Grabe. Pick up coffee, lakas makasipa nung cafe latte ata. Cafe latte. Grabe. Lakas makasipa ng ng gising ako noon. Gising ako sa sa pick up coffee na iced coffee latte ba yun? Rio asked which diet is most appropriate for her. Pero ang lakas na maka-acid, true. The correct response of the nurse would be hypothyroidism si patient. Hypothyroidism. High calorie, low calorie. Ayan, nagigising sila pag chikahan. Talaga kayo. Low calorie siya. Low calorie. X to. High fiber, low fiber diet. High fiber diet. Letter boy. Diba? Letter boy. 74. O, emergency disaster tayo. Our nurse in Japan has been assigned as part of the triage team in the recent earthquake in the capital city. You assess and prioritize the patients according to their status and needs. Different emergency nursing concepts apply during this phase. Which of the following should be done during your secondary survey of the patient? Tamang sagot. Kapag ganyan, always remember the ABC. Okay? ABC. ABC ang unahin mo dyan. Cervical spine para ma-stabilize mo. Pag hindi mo na-stabilize ang cervical spine, ano mangyayari? Ano mangyayari? Or may cervical injury siya tapos hindi mo na-stabilize. Respiratory paralysis, yes or no? Tanggal ang airway breathing mo. Diba? EKIS po ito. Establishing patent airway EKIS. Diba? Close reduction of pulseless extremity circulation po siya. Okay? Best answer is letter cat. Letter cat. Ang pinaka-ayokong med-surg na topic, ortho. Ortho po pinaka-hate ko. As in, ortho cases. No ako sa ortho cases. Situation. Ito ang situation niya. Ortho. No ako sa ortho. Okay? Bakit letter C ito? Okay. Diba? Ano po ba ang priority natin? A, airway, breathing, circulation. Kapag tinanggal mong, pag hindi mo na-stabilize ang cervical spine mo at may cervical injury yung patient mo, ano mangyayari? Tanggal si airway mo. Respiratory paralysis ka. Establish mo muna yung airway mo. Diba? And second, pulseless yan, circulation po yan. Diba? Yan. Letter C. Okay, letter C yan. Okay? Next. Or pag reverse triage, tandaan nyo kapag reverse triage, tanggalin mo agad yung mga patay. Yes or no? Tanggalin mo yung mga patay. Yes. Tanggalin mo yung mga patay. Ano dito? Unconscious, tanggal. Pulseless infant, tanggal. Ano mas unahin mo? Gasping or yung mas stable? Reverse triage ka. Yung ano unahin mo? You must stable. Letter boy. Okay? Letter boy. 76. Critical incident stress management is what type of prevention in disaster management? No, critical incident stress management, ibig sabihin may nangyari ng ano? Meron na nangyaring incident or disaster, may intervention ka na, that is letter boy. Secondary na siya. Okay, secondary na po. Next. Following the triage system, which among the following would you highly prioritize? Tamang sagot dyan. Ano unahin mo? Airway, breathing, circulation. Airway. Ano dyan ang may airway problem? Ano yung may airway problem? Very good. Letter C. Nagagasp ng air. Letter C. Which of these principles not included in performing start triage in emergency disaster? Diba kapag nagtatriage ka na, gaano ka? Separation pala ng client. Okay? Magbibigay ka ba ng intensive care? Bibigay ka ba ng provide treatment for clients requiring intensive care? No. Letter C. Letter C. Nurse even is giving 8 p.m. medication to the client who happens to have slid down to the bed for Fowler's position. Sabihin, naka-Fowler's position siya, nakaganyan yung bed niya. Nakaganito yung bed niya. Yan. Okay? Kasi may airway pa din. May airway ka pa din. Gasping siya. Okay? Buhay pa yung patient mo. Okay? Which of the following intervention is most effective when the nurse reposition the client? Kumari, ganito yung position ni patient mo. Ganyan yung bed niyan kasi naka-fowler's position. Oh. Anong gagawin mo muna? I-adjust mo muna yung bed pahiga para maakyat mo si patient. Okay? Kasi kapag ganyan siya, hindi mo maakyat yung patient ng pag ganyan, mag-slide down lang yung patient mo. Anong tamang sagot dito? Tamang sagot, letter dog. Very good. Letter dog. Letter dog. Russell asked the nurse how to use the trapeze in his bed. Using the overhead trapeze for repositioning the client with can accomplish by instructing the client to grasp. Ang trapeze, ganito itsura ng trapeze mo. Nakaganyan siya. Triangle siya, tapos nakasabit dyan. Sabit dyan. Tapos, usually yan, dapat paano mong gagamitin ng patient mo yan. One hand lang ba o both hands? Tingnan nyo, halos touch sila one hand, one hand, one hand, one arm. Somatic yan, mali yan agad. Letter, boy. Both hands yan. And lift and pull. And lift and pull during the move. Okay? Next. Hands on bed rest is rolled on lateral position by the nurse. The nurse is negotiating the move correctly when he, anong tamang sagot dyan? Ito, letter boy, ano nagpamali dito? Client's far hip, malayo, dapat malapit ka. Broad stance, dapat maliit yung stance mo. Okay? So the correct answer is letter Paul. Position himself at the mid part of the bed and place both hands at the back end of the client and roll the client onto side. Okay? 82. Darlene, with an injured left leg due to vehicular accident, is sitting on bed and preparing for transfer to wheelchair. The nurse is assisting the client to position the wheelchair on the, saan mo siya ipoposition? Right or left? Sa strong or sa weak? Sa strong or sa weak? Sa strong. Kasi kapag sa weak mo siya pinosisyon, anong mangyayari? Ano mangyayari pag pinosisyon mo sa weak side, magfo-fall lang yung patient mo. Matutumba lang yan. Letter boy. Letter boy. Okay? Next. Colleen has difficulty walking and needs wheelchair to facilitate performance of daily activities. Anticipating the needs of the client, the nurse should have the wheelchair ready for placing it at, take note mo to, letter apple, X, letter cat, X, same degrees lang yan. So, syempre doon ka na sa 45 kasi mas madali siya, may access ka doon. Okay? And this amount of your body rotation. Letter boy. Nursing is currently conducting discharge teaching on how to do pulmonary hygiene. Okay? Measure at home. The following improve clearance of airway secretion except postural drainage. Pwede ba yan? Yes. Effective coughing. Siyempre, nagka-cough ka. Yes. Fluid intake. Bakit ka mag-measure ng fluid intake? Bakit? Kasi, ano bang ginagawa ng pag mataas ang fluid intake mo? Thinning ng secretions mo. Diba? Letter boy. Pag nag-complete bed rest ka, nagkakaroon ba ng stasis ng secretions mo? Yes or no? Yes. Okay, yes. Magpupuling ang secretions mo lang. 85. Intramuscular supplementation of iron local causes local pain, can cause stain in the skin. If you are the nurse, what best technique of administration will you use? Letter A, Z-track method. Okay, Z-track method. O, COPIN and EPIN daw. Scrub nurse and circulating nurse respectively are preparing for cholecystectomy. Their last case of the day. Okay. Upin discovered, si Upin ay si circulating, ay si scrub nurse, cut in his palm while she was opening the sterile packs. O, Ipin should, anong gagawin ni Ipin dyan? Ano kayong pwedeng gawin ni Ipin dyan? Can cause bleeding yan. Paano kung bigla pa nagka-tear sa ano niya? So, syempre, ang pinakamagandang gawin mo dyan, relieve mo na lang si scrub nurse. Letter boy. May letter boy. 87. Before any member of the surgical team proceed to the surgical hand scrub, sabihin nito, wala pa siya sa ano, hindi pa magsa-start or andun pa lang siya sa OR suite room. He or she have complete operating room attire, identify all the appropriate for this case. Head cap, yes or no? Kailangan ba naka-head cap ka na? Head cap? Head cap? Yes, naka-head cap ka dyan. Required ang head cap sa OR, di ba? Yes, required po ang head cap sa OR. Face mask, yes or no? Yes. Sterile gown? Sterile gown? No. Kasi mag-hand scrub ka pa lang, oh. Okay? Gloves? No din. Correct answer mo is letter cat. Again, take note mo before proceed to do surgical hand scrub. Okay? Letter cat. A sterile setup has been prepared. The OR was notified of delay in transporting the client from the OR to from the ward to the OR. Which of the following guidelines should be circulating nurse follow? Anong pinakamagandang gawin dyan? I-cover mo na lang, di ba? I-cover mo na lang appropriately para ma-prevent ang man-sterile yung bagay. Identify which appropriate gloving technique will the assistant surgeon use when he performs the skin preparation. It is the 88. Sige. Dark S is letter dog. Charot. Gloving self-open technique. Diba? Common yan kapag sa mga skin preparation, bone marrow biopsy, and urinary catheterization. Letter dog. 88 po is letter apple. The first assist contaminated his gown while the surgery is ongoing. He's expected to change his gown and gloves. Which of the following is the correct technique to be followed? Anong una mong gagawin? Siyempre, paantay mo muna yung gown mo. Siyempre, nakalock yung gown mo eh. Paantay mo muna bago mo tanggalin yung gown tas yung glove. Okay, letter boy. Letter boy. Okay, letter boy. Next. Maddie has a family history of cervical cancer and came to the clinic for screening. With your knowledge of cervical cancer, which of these would you include in your teaching on risk factors? Tamang sagot? Monogamous? No. Diba? Sexual contact? Matik yan. Diba? Sexual contact, matik yan. Underweight? Underweight? No. 'Di ba? Tanggal agad 'to. Anong tamang sagot? Letter B. Letter B. Yung HPV-6, ito, genital warts yan. Genital warts po yan. Okay, genital warts yan. Next. Maddie was diagnosed with cervical cancer and metastasis was noted. What is commonly the first metastatic location of cervical neoplasm? Saan ka dyan yung pinakamalapit? Your pelvic lymph node. Letter C. Letter C. Okay? Next. A surgery is suggested to treat Maddie. However, she exclaimed that she wants to bear a child. Okay, gusto pa niya magkaroon ng baby. Which of the following procedure may be done to patient granting her wish? Ang pinakamagandang gawin dyan, Kapag ganyan, hindi kayo sure. Hysterectomy. Ano ba hysterectomy? Tatanggalin ng uterus? Yes or no? Tatanggalin ang uterus? Yes. Magkakaroon pa ba siya ng anak pag tinanggal ang uterus mo? No. Tanggal. Tanggal din to. Same lang naman sila eh. Matitira ka sa letter C and D. Hindi mo alam yung trachelectomy. Diba? Hindi mo alam yung trachelectomy. Ano yung salpingoectomy? Tatanggalin yung tatanggalin yung fallopian tube. Fallopian tube yan. Bilateral pa. Pwede ka pa ba mabuntis pag ganun? Most probably hindi na din. Letter C. Okay, trachelectomy. Ito yung surgery to remove the cervix and nearby tissue and lymph nodes and the upper part of the vagina. Lagay natin. Yan. Okay? Yan po siya. Next, Jera underwent hysterectomy and was transferred to your ward 3. To your ward 3 hours post-surgery. Which of this assessment would warrant you to notify the doctor? Kapag ganyan, notification ng doctor, tapos pare-pare sila ng ano yung mga expected versus unexpected. Okay, expected versus unexpected. Pain on the incision site, expected, unexpected. Expected. Vaginal bleeding, hysterectomy yan eh. Meron niyang vaginal discharge. Edema, namamaga. Pwede bang mamaga yan? Yes. Diba? Chest pain, syempre, hindi yan expected. Ang layo ng hysterectomy sa chest pain. Letter boy. No. Early ambulation for Jera who underwent surgery of cervical cancer is encouraged to prevent your DVT. Very good, DVT. Jessa was diagnosed of SJS, which would, while you take history, which of these signs and symptoms will be part of your prodromal stage of syndrome? Ano pa ba yung prodromal stage? Ang prodromal stage ito yung mga manifestations niya. Yan. Your fever, sore throat, kaya tamang sagot is letter boy, chills, headache, and malay. Okay? Malay. 94. Bladder breakdown, G, 10 minutes. 15 minutes bladder break. G. G naman ako kung gusto niyo bladder break. Kahit paano, merienda pa. Go lang ako kung gusto magmerienda ng 30 minutes. G naman ako dyan. Which of the statements by the patient will give you an information of the cause of the syndrome? Balik na lang kay after 1 hour. Carry lang. Anong tamang sagot dyan? Ang common causes ng SJS mo is your antibiotic, penicillin, and ano ba to? Penicillin and your sulfa drugs. Anong sagot dyan? Sinabi ko na yung sagot, doy. Letter C. I take penicillin whenever I feel like I will have cough or colds. Dr. Yarn, diba? Ito na. Kapag SJS, namamaga ba yung buong katawan mo? Yes or no? Namamaga ba yung buong katawan mo? Namamaga ba yung buong katawan mo? Yes. Yes. Yes yan. Inflammatory reaction ng katawan mo yan eh. Diba? Inflammatory reaction ng katawan mo. Anong blood levels yan? Letter boy. Elevated C-reactive protein. Ito siya, 95. O 99. Which of these complaints by the patient indicates progression of the SJD, your Stevens-Johnson syndrome or disease? O pag ganyan, expected. Di ba kayo na sinabi natin sore throat? O X. Itching makatiyanday. Masakit din siya. Ay, charot. Ba yan? Nahilo na kayo. X din yan. Anong tamang sagot? Letter boy. Diba? Letter boy. O, bladder break. Bladder break. Gusto nyo? G naman, kung gusto nyo. 30 minutes. Sige, thank you. Bladder break muna. Charot. Okay. Which of this intervention would you indicate in caring for the patients? Anong tamang sagot dyan? Letter number 99 mo meron na sa mata. Ano ang tamang sagot dyan? Letter C. Okay. Context clues mo na yan pag ganyan. Okay. Questions. Questions. 27 to 39 daw po. May magsisend yan ng complete answers. Questions. Okay. I'll entertain question hanggang 4. 98. Thank you so much. Sana may natutunan kayo sa akin. Sana may natutunan kayo. What else? May mga tanong pa ba? I'll entertain questions. Thank you. Skincare review nga pala. Ito na. Total, maaga naman tayo natapos. Okay talaga. Ito na. Yan na. Skin cleanser. Cleanser ko. Kung makitaan ba to? Wait lang. Tanggalin natin yung... Wait lang. Wait lang. Tatanggalin ko na lang yung ano. Ay. Okay, background. Ito na. Oh. Cleanser. Toner. Serum. Moisturizer. Siyempre, hindi pwede mawala. Sunblock. Okay. Carry na. Hindi pang mayaman yan. Pang ano lang yun. Ayan. Question pa. I'll try to research on this one. Yung tatlong ginagamitan ng gloving self technique. I'll try to research on that one. Hindi kasi ako familiar doon. May use for review. Paano? Paano libro? Paano review? Okay, gets ko na. Gets ko na. Gets ko na. Ito siya. Ito siya. Skin preparation, bone marrow biopsy. Ito siya. Send ko na. Ito. Gets na kita. Okay. Ayan siya. Pag self-open gloving technique. Gets ko na. Tanong pa. Tanong. UP student ka. Hello. Pwede kayo mag-message sa akin personally if you need help. Saunders pwede din naman. Saunders. PDF. Of the resources naman kasi pwede. Di ako mas preferred ko IG kaysa kaysa Facebook kasi madami akong kausap sa Facebook kasi meron mga review assistant, meron pa akong nandun din yung work related ko sa Facebook. So ang nahihirapan ako kapag sa Facebook ako tumatanggap ako na nagtatasa. Yes, tumatanggap ako. 63 daw yan, layo ko naman sa 63. Letter dog. Letter dog. Question pa. Hindi ako nag-top sa board exam. Baka curious lang yung mga person. Hindi pa ako top notcher sa board exam. Saktong pasa lang ang person sa board exam. Pumasa lang, ganun. Sa Laguna, nasa Binyan po ako. Sa Manila po, Vito Cruz, sa Makati Med po kasi ako nag-work. Pwede ako makapagkita sa Makati Med. Glorieta, pwede. Ayala. Pwede ako sa Ayala. Ano pa ba? Ito din, hindi rin ako nagre-reveal ng NLE result ko kasi ang tendency yung mga students po ay nagkakaroon ng anxiety sa board exam. Diba? Naniniwala kasi ako na you don't need to flex anything sa students mo kasi it would increase the anxiety of the student. Pag sinabi ko kumari, ganito yung board rating ko, ang tendency kasi nagkakaroon ng anxiety yung mga students. Okay, so mas gusto ko na hanapin natin yung picture na yan. Externally rotated. Mas gusto ko kasi hindi talaga ako nagre-reveal. Para lang hindi lang din magkaroon ng anxiety yung mga students. As much as possible kasi I try to limit the anxiety ng students kapag ganyan. Okay? Kasi alam ko yung feeling. Marirecommend ko po bang MMC? Yes. Ang hirap ng tanong. Marirecommend ko ba MMC? Yes. Siguro bakit ako tumagal sa Makati Med? Kasi ang ganda ng work schedule. Flexible yung work schedules ko. Ang pinaka gusto ko sa MMC kasi 7 days ka on duty, 7 days kang off. Ano yung sabihin nun? Sa loob ng 2 weeks, 7 days lang po ako nag-duty. Okay. Sa loob ng 1 month, 14 days lang po ako nag-duty. Minimum ng 14 days. Ay maximum ng 15. Sagalin natin ng 15 days. Maximum na yun. Okay. Ang exemption lang dyan is ang alam ko, outpatient department. Outpatient department, 8-hour shifting yan. Delivery room, 8-hour shifting yan. OR, alam ko din 8-hour shifting pa, saka KU. Pero yung mga ICU, ER, regular wards, yan, matic yan, 12-hour shifting po kami. Yeah. Pasendong white book. Okay, I'll send the white book here. Dito ba? Saan akong department? Ang department ko po, hindi kayo magugulat kung anong department ko sa Makati Med. Maternity and VIP services. Ano po ako? Isa po akong VIP nurse. Mga hinahandle ko pong patients, mga big time patients, mga naka-presidential suite room. Yan. Yung tipong kaya nilang bilhin yung buong pagkatao mo, ganun levels. Kumbaga yung bayad nila ng isang kwarto nila, isang buong buwan mo ng sahod. Ganun level. Okay, questions pa? 2 types of radiation. Sanayan lang siya. Sanay na ako mag-handle ng VIP patients. Yeah, sanayan lang siya. Una, nakakaba siya. Nakakaba kasi siyempre yung mga na-handle mo, mga past president, senators, vice president, may mga may-ari ng mga sikat na fast food chains, sikat na mga restaurant, sikat na malls, sikat na hotel. Yan yung mga ma-handles mo. So eventually, masasanay ka. Celebrities yan din, common din yung mga celebrities. Na din, masasanay na lang din kayo. Masaya naman siya, hindi siya ganun ka-toxic. Kasi maximum na handle mo na patient dyan 6. Maximum na yon. Sobrang toxic mo na kapag 6 yung handle na patient mo. Kapag VIP services ka. Kasi sobrang dami nilang demands. Ano pang question? Paano maiwasan ng overthink sa board exam? Kung ano yung tinanong lang sa question, doon ka lang mag-stick sa sagot mo. Okay? Kunwari, a good thing na pinakamaganda diyan, pinakamagandang palagi kong number one example diyan is how would you identify your patient? Ask the patient or ID band. And then, number one question tinatanong ko sa mga students ko. How would you identify the patient? Last question na to bago ako mag-exit. How would you identify your patient? Ask the patient or ID band? The best answer for that one for me is ask the patient. Primary source over secondary. Diba? Primary source over secondary. Ask the patient yan. For sure yan nag-ID band kayo kasi meron kayong mga what if. Yes or no? May mga what if kayo. Yes or no? Yes. Tinatanong ko lang naman paano mo identify yung patient. Ideally, ang ideal state niyan, mentally conscious, coherent, responsive yung patient mo. Mentally competent siya. Okay? So, ang best answer dyan, ask the patient talaga. Okay? Simple as that one. Kasi may mga students dyan, what if sir intoxicated? Wala naman nakalagay sa statement, sa tanong ko. What if sir hindi siya competent? Wala naman nakalagay sa context na tanong ko. Diba? Tendency ng students kasi, kaya nag-overthink, madami kayong what if. Tanggalin niyo yung what if, kung ano lang yung tanong sa board exam, yun lang yung sasagutin niyo. Okay? Malinaw na? Malinaw? Leave na. Okay, see you sa, I think parang Recalls 4 nyo din ata ako. Recalls 4. Okay? Bye-bye. Good luck and see you. Thank you. Wala, ang bilis na naman mag-chat daw eh. Hindi ko na nakita. Bye-bye. Thank you.